Tabling of documents. Dépôt de projet de loi émanant du gouvernement. Statements by ministers. Présentation de rapport de comité. Rapport de délégation interparlementaire. Introduction of private members' bills. Ms. Collins Victoria, seconded by Mr. Garrison, moves for leave to introduce a bill entitled An Act to Amend the Criminal Code Controlling or Coercive Conduct. This motion is deemed adopted. The Honourable Member for Victoria.
Mr. Speaker, I'm proud to rise today to introduce my private member's bill, which, if passed, would make coercive and controlling behavior a criminal offence. Everyone deserves to feel safe in their own home, and this bill would provide more legal protections for individuals in harmful and dangerous situations. I want to thank my colleague and friend, the Honourable Member for Esquimalt-Saanich-Sooke, for his leadership on this issue and his hard work in the Justice Committee that led to the publication of 2 reports recommending that we make coercive and controlling behavior in intimate partner relationships a criminal offence. I also want to thank SEGES, an organization that seeks to support those in abusive relationships, as they have provided invaluable advice in developing a framework that will help protect individuals faced with domestic abuse. Mr. Speaker, coercive control is one of the common early signs before domestic homicide, even when no physical violence has occurred. Countless stories of femicide show aggressors with histories of coercive, controlling behavior that have gone unnoticed as warning signs or red flags. Criminalizing coercive controlling behavior will save lives, and it sends a clear message that abusive behavior is unacceptable and will not be ignored. Thank you.
Ms. Collins Victoria, seconded by Mr. Garrison, moves that the bill be now read a first time and be printed. This motion is deemed adopted.
First reading of this bill, première lecture de ce projet de loi.
When shall the bill be read a second time? At the next sitting of the House. Introduction of private members' bills. Mr. McGregor, seconded by Mr. Johns, moves for leave to introduce a bill entitled An Act Respecting a National Day of Remembrance to Honour Canadian Armed Forces members who have lost their lives in peacetime in Canada. This motion is deemed adopted. The Honourable Member for Cowichan-Malahat-Langford.
Mr. Speaker, I'm honoured to introduce my private member's bill, the Peacetime Service and Sacrifice Memorial Day Act. I'd like to acknowledge and thank the member for Courtenay Alberni for seconding the bill. I've always had incredible admiration and respect for the men and women who serve and have served our country in the Canadian Armed Forces. In addition to Remembrance Day, October 22nd has taken on significant importance for the veterans community in my riding, particularly for those who are members of Malahat Legion Branch 134. This day is recognized every year in my riding of Cowichan-Malahat-Langford in honor of Corporal Nathan Cirillo and for the more than 2,400 Canadian Armed Forces members who have lost their lives on Canadian soil during peacetime. Since 2013, more than 54 members of the CAF have died as a result of PTSD alone. And yesterday was the 3-year anniversary of the crash that killed Snowbirds captain Jen Casey in Kamloops. The bill I'm introducing today will formally recognize October 22nd as Peacetime Service and Sacrifice Memorial Day in their memory. In closing, I want to recognize Bob Collins as the driving force behind this bill and thank him for his continuous efforts to give this day formal recognition and for standing guard at the cenotaph in Cobble Hill in remembrance. Thank you.
Mr. McGregor, seconded by Mr. Johns, moves that the bill be now read a first time and be printed. This motion is deemed adopted.
First reading of this bill, première lecture de ce projet de loi.
When shall the bill be read a second time? At the next sitting of the House. Première lecture de projet de loi d'intérêt public émanant du Sénat. Motions? Présentation de pétitions. Presenting petitions. The Honourable Member for Mission Matsky, Fraser Canyon.
Mr. Speaker, your home, my home, our home, let's bring it home and reform medical cannabis licenses. Licenses for the production of medical cannabis are often abused, with production in excess of personal amounts diverted for commercial sale on the black market. The amount of cannabis individuals are authorized to possess for medical purposes is impossible for an individual to personally consume. Grow-ops in residential neighborhoods across British Columbia have negative impacts on nearby residents' health and well-being, such as excessive smells, frequent traffic, and reduced property values. Petitioners are calling on the Government of Canada to reform the licensing and oversight of the production of cannabis for personal medical use and its production in residential homes. Thank you, Mr. Speaker.
Presenting petitions, the honourable member for Kelowna Lake Country.
Thank you, Mr. Speaker. And I'm tabling a petition today which says Canada is home to the largest Punjabi diaspora in the world and nearly 1 million people, many of whom are of the Sikh faith. The current government neglected to include Punjab in their Open Skies Agreement that covers direct flights between Canada and India. And Amritsar is an important religious site, a major commercial and cultural hub, and the second largest city in Punjab. Therefore, the petitioners are calling on the Government of Canada to fix the Open Skies Agreement and establish direct flights between Amritsar and Canada. Thank you, Mr. Speaker.
Présentation de pétition, l'honorable député de Drummond.
The Honourable Member for Drummond. Thank you, Mr. Speaker. I am very pleased to rise to table a petition signed by 2,500 people in Quebec and elsewhere stating that the religious advisor reporting directly to the Prime Minister goes directly against state secularism. Combating bias should instead be under the Department of Heritage, and the petitioners also point out that Islamophobia is a term that can be twisted and that can include references to blasphemy, whereas blasphemy should not be a term used under a secular state. So in conclusion, the petitioners ask that the representative to fight Islamophobia position be abolished.
Présentation de pétition, presenting petitions, the honourable member for Winnipeg North.
Thank you, Mr. Speaker. I tabled today a petition signed by many people from Winnipeg, and what they're looking for is recognizing the exceptional growth of our Indo-Canadian community in Canada, in my home province of Manitoba, and ultimately, Madam Speaker, looking at ways in which we can increase the number of international flights between Canada and India, as cited in the past by me. I'd love to see something direct from Winnipeg to Amritsar. At the very least, Mr. Speaker, I would suggest to you the people that are signing these petitions are recognizing the growth of the community and the need to have more international flights, appealing not only to the Government of Canada, but to the different international airlines and the Winnipeg International Airport. Thank you, Mr. Speaker.
Presenting petitions, the honourable member for Saanich Gulf Islands.
Thank you, Mr. Speaker. I'm rising today and on the traditional territory of the Algonquin Anishinaabe people to raise a concern that is very close to the hearts of the Indigenous peoples of British Columbia, and that is the threat to the Pacific salmon, the wild Pacific salmon populations, and particularly of Fraser River sockeye. Petitioners call for the Government of Canada to implement all of the recommendations of what is now quite tabled some years ago, 2012, the report of the Cohen Commission, and yet we still have open pen salmon farms in the waters in and around the runs of wild salmon, threatening them with disease and with sea lice, which are really significant threats to the survival of the species. Between the climate crisis and the problems at sea that affect wild salmon and the effect of the caged salmon for aquaculture and their escapement, as well as the escapement of disease and sea lice, the petitioners point out that urgent action is needed, and they call on the Department of Fisheries and Oceans and the Minister to act with urgency. Thank you, Mr. Speaker.
Presenting petitions, présentation de pétitions. Questions on the order paper. The Honourable Parliamentary Secretary to the Government House Leader.
Mr. Speaker, I would ask that all questions be allowed to stand at this time, please.
Agreed? Agreed and so ordered. Orders of the day.
Orders of the day, ordre du jour, government orders, business of supply, Consideration of an opposition motion concerning opioid crisis, standing in the name of Mr. Poliev.
Mr. Poliev, seconded by Mr. Ellis, moves that given that, le Canada vit une crise des opioïdes qui
1. Canada is in the midst of an opioid crisis that has killed over 35,000 people since 2016.
Since 2017, the federal government has spent over $800 million on its failed Canadian drugs and substance strategy, including over $100 million in funding for hard drug supply projects across Canada, and plans to spend an additional $74 million to scale up these projects over the next 5 years. 3. Depuis que l'approvisionnement
3. Since tax-funded drug supply was ramped up in 2020, opioid deaths have only gone up, according to the Public Health Agency of Canada.
4. In 2020, slightly less than 7,000 people died of opioid overdoses, while only 3,000 died in overdoses in 2016, according to the Library of Parliament. 5. En Colombie-Britannique.
5. In British Columbia alone, yearly drug overdose deaths have increased by 330% between 2015 and 2022.
4. Recently, a Global News reporter in East Vancouver was able to buy 26 hits for $30 in just 30 minutes of a dangerous and highly addictive opioid that is distributed in tax-funded drug supply programs and flooding our streets with cheap opioids. The House call on the government to immediately reverse its deadly policies and redirect all funds from taxpayer-funded hard drug programs to addiction, treatment, and recovery programs. The Honourable Member for Carleton.
I'll be splitting my time with the Honourable Member for Cumberland Colchester. Mr. Speaker, after 8 years of this Prime Minister, everything feels broken. Life costs more. Work doesn't pay. Housing costs have doubled. And our Prime Minister divides to control the people. Worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is this worse than in the opioid overdose crisis that has expanded so dramatically in the last several years. The Prime Minister has a theory, backed up by a group of activists, most of them tax-funded, pharmaceutical companies, and others who stand to gain from perpetuating the crisis. The theory is that if the government provides powerful heroin-like drugs that are uncontaminated, that addicts will no longer use more deadly fentanyl, and they will practice safe drug use, and we will no longer have overdoses. So the Prime Minister has spent $78 million on 28 projects giving out free drugs. His recent budget proposes another $100 million for more tax-funded drugs. Mr. Speaker, this includes heroin dispensary machines where people can walk up, press some buttons, and heroin pops out. It also includes prescriptions that allow people to take the hydromorphine out into the street and use it or sell it however they like. Now, the theory is that this will divert away from more dangerous fentanyl. Let's look at the facts. Fact number one, since the Prime Minister took office, there have been more than 34,000 apparent opioid overdose deaths. Fact, this is not a problem that the Prime Minister inherited. It is one that he helped create. A total of 5,360 apparent opioid overdose deaths occurred from January to September of 2022. This is approximately 20 deaths per day. It is a 173% increase from 2016, the first full calendar year he was in office. In other words, since his policies have come into effect, the overdose numbers have nearly tripled. Fact number three, while the deaths have risen across the country under the Prime Minister's policies, they have been the very worst in those provincial and municipal jurisdictions that have most enthusiastically embraced them. For example, in British Columbia, where in most jurisdictions, particularly Vancouver, all three levels of government have endorsed the so-called safe supply and decriminalization of hard drugs, the levels of overdose deaths have been the highest. Across BC, the number of overdose deaths are up 330%. The COVID excuse no longer works, Mr. Speaker. Fact, despite the claim by supporters of handing out and decriminalizing drugs that COVID was to blame for the crisis, what we have seen is that as COVID moves more and more into the rear-view mirror, the overdose deaths actually increase. For example, in March of this year, we had 9% more overdose deaths in BC than in March of 2022, and 23% more overdose deaths than in March of 2021. So more we move away from COVID, the more the overdose deaths increase. In fact, the deaths are not coinciding with COVID, they're coinciding with the recent decriminalization of crack, heroin, fentanyl, and other hard drugs on January the 1st, 2023. Now, we're told that all the experts agree, just like Liberals tell us all the time, whenever they do something that defies common sense. Remember, all the experts agreed that printing money wouldn't cause inflation right before it led to a 40-year high, or that catch-and-release bail would not cause crime right before crime rocketed 32%. And we're told that giving out and decriminalizing hard drugs would reduce drug overdoses. These so-called experts are typically pie-in-the-sky theorists with no experience getting people off drugs, or they're members of the misery industry, those paid activists and public health bureaucrats whose jobs depend on the crisis continuing. Actually, the real academic scholarship is clear if the minister would even bother to read it. A thorough study by dozens of doctors and researchers from Stanford University, published in The Lancet and chaired by a former advisor to President Obama, found, and I quote, "At the same time, evidence clearly shows the folly of assuming that population health inherently improves when healthcare systems provide as many opioids as possible with as few possible regulatory constraints. Policies that should attract skepticism include the dispensing of hydromorphone from vending machines and prescribing a range of potent opioids and other drugs, benzodiazepines and stimulants, to individuals with opioid use disorders in the hopes of creating safe addictive drug supply and eliminating the supervision of methadone patients, i.e. converting the system to unmonitored long-term prescriptions on a take-home basis." And the study goes on to comment on this claim that hydromorphone is safe, because that's what the government is giving out. Although expressed from a public health point of view, these messages echo the opioid manufacturers in presuming that unrestricted opioid provision can only improve public health. The faith of some advocates that opioids are safe as long as they're not derived from illicit markets is impossible to reconcile with the hundreds of thousands of overdose deaths from legal pharmaceutical-grade opioids that preceded the introduction of fentanyl into the U.S. and Canadian heroin markets. Furthermore, the Safe Supply Program uses this hydromorphone, which one study published on pharmacology, in a pharmacology journal, said is similar, subjective, and physiological in its effects as heroin, but it is more potent than heroin. This is the stuff that minister and this Prime Minister are giving out with your tax dollars, Mr. Speaker. In a 2020 podcast, Dr. Mark Tyndall, one of Canada's earliest safer supply advocates, said that he had tested the urine of 15 patients who were on safer supply and found that 90% of them used fentanyl. In other words, they were not being diverted from fentanyl, they were using it in conjunction with fentanyl. And now we know that it's even worse than that, that the hydromorphone is being resold by the user to children and the profits being reinvested in buying fentanyl. In other words, this government is not only giving out dangerous hydromorphone, it is actually in effect giving out fentanyl by giving the user the hydromorphine to sell and raise the revenue to buy the fentanyl. This government is using your tax dollars to give out fentanyl on our streets and cause this crisis. Meanwhile, the cost of a hit of this hydromorphine has dropped by between 70 and 95% to roughly $1 a hit because the government is effectively paying for it and handing it out far and wide. Mr. Speaker, this makes no sense, and the facts and evidence disprove it as a strategy. This is a radical and out-of-touch approach that is not aligned with any other successful jurisdiction in the world. It is quite the opposite of what they're doing in places like Portugal, which have focused on recovery, not on handing out free hard drugs, Mr. Speaker. And therein lies the hope. We can turn the hurt the Prime Minister has caused into the hope that Canadians need. In Alberta, where they are thoroughly rejecting the decriminalization and tax-funded handout of hard drugs and instead putting the money into recovery, we have seen a 30% reduction in the most recent data in the number of overdose deaths. And that is because it is clear what people who are suffering from addiction need is help getting off the drugs. And to have that, we need recovery communities where they can go, have help with breaking the addiction. If necessary, a little bit of medication to relieve the side effects of getting off the drug, and then have the psychotherapy that is necessary to overcome the underlying reasons that they got into drug addiction in the first place. We know this works. The evidence backs it up. And so our common sense plan is to take the money away from subsidizing heroin-like drugs and instead put all of that money into recovery and treatment, to sue the powerful pharmaceutical companies that helped cause this crisis so that we can take the proceeds of that lawsuit in order to fund even more recovery. Mr. Speaker, that is how we are going to bring home our loved ones drug-free. It is how we will turn hurt into hope. It is the common sense of the common people, united for our common home, your home, my home, our home. Let's bring it home.
Questions and comments? Question or commentaire, the Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I guess I've been wanting to ask the Leader of the Opposition this question. Seeing that 46,000 overdoses have been reversed in the safe consumption sites, what would the Leader of the Opposition do in defunding them, and how would he speak to the loved ones who have lost a loved one because their overdose wasn't reversed?
Leader of the Official Opposition.
Well, what I would say to the loved one of anybody who's lost a daughter or a son to drug overdoses, that our heart goes out to you, and we are going to fix the problem that the government caused, which led to that overdose in the first place. The minister is quite right when she heckles out that these people have died. They have died under her watch. They have died under this Prime Minister as he has flooded the streets with powerful heroin-like drugs that are paid for by tax dollars and have funded a black market for fentanyl and killed so many people. But it is not enough for us just to point out that the Prime Minister's policies have led to these deaths. We are going to turn the hurt that he has caused into the hope Canadians need. And my message to those parents is that your child did not die in vain. We will make sure that other people's children get the recovery that would have saved the lives if that recovery had been in place. Recovery, treatment, rehabilitation. Hope is possible, and hope is on the way.
Questions and comments? Question or commentaire?
The Honourable Member for Saint-Hyacinthe-Bagotte. Mr. Speaker, I'd like to thank the Leader of the Opposition for his contribution to the debate. However, I think he goes a bit far. The terms he used are more demagogy than, well, this is a very aggressive and motion. If we look at what's happening in other countries and what's working, if there's a country that has tried a real combative approach rather than dealing with the issue as a social and public health issue. It's the U.S. And what we saw is that opiate deaths have risen from 11,000 to 2015 to more than 100,000 in 2021. So why can't we have a more social and charitable approach to this issue rather than such an aggressive approach? The Honourable Leader of the Opposition. In fact, the government's approach comes from the U.S. It comes from Seattle, San Francisco, and Portland. And that is why we see people who are dying in the U.S. because they are using the same wokest policies of this government. And there are deaths in these large cities. This is a tragedy. We shouldn't be trying to replicate this. It's an approach that we should be avoiding here in Canada. We should be looking at jurisdictions worldwide that are investing in recovery and treatment rather than providing drugs that are killing people.
Questions and comments. The Honourable Member for Courtenay Alberni.
Mr. Speaker, we have lost thousands of lives to an unregulated toxic drug supply, Mr. Speaker. And what do the Conservatives do? They bring forward this motion, they play politics with people's lives, and they oversimplify a really important health issue. Mr. Speaker, the Health Canada created an expert task force on substance use. It included members from public health, Indigenous health, community, business, unions, universities, social service agencies, law enforcement, and public policy thinkers. And they said, we need a safer supply of substances to stop criminalizing people who use drugs. It causes more harm. And yes, we need treatment on demand, recovery, education, and prevention. And the Leader of the Official Opposition calls them activists. The Canadian Association of Police Chiefs, Mom Stop the Harm, the Chief Coroner of British Columbia, the Chief Medical Health Officer of British Columbia, they all support a safer supply. So through you, Mr. Speaker, will the member of the Conservative Party allow his colleagues and his members to go back in their communities next week, meet with their Chief Medical Health Officer, their Chief Coroner, law enforcement? Will he allow a free vote on this motion, or is he going to continue to do more harm?
Leader of the Official Opposition.
Yes, there will be a free vote, Mr. Speaker. And more than just going back to our own riding communities, I've been to his community. When I got off the plane on Vancouver Island, what I found is that the people in his riding and across the island are disgusted with his policies and with the policies that he has embraced both provincially and federally. I got off the plane, and first thing, the pilot told me that he had two addicts in his backyard rummaging around trying to steal the night before so that they could pay for their drugs. Then I saw the front page of the local Nanaimo newspaper saying record overdoses. Then one of the people who was going to be at my rallies was in the hospital because he was attacked by some members of the local tent city. We have seen a massive overdose crisis because of the policies that member has embraced, both provincially with the NDP and federally with this Liberal government. We as Conservatives are the only ones who will fix it by going away from legal and free drugs towards recovery to bring our loved ones home drug-free.
Reprise de débat, continuing debate. The Honourable Member for Cumberland Colchester.
Good morning, Mr. Speaker. And in my mind today represents perhaps a seminal moment in Canadian history. What we have on one side is a Liberal government who want to flood our country with drugs. And on this side of the House, Mr. Speaker, what we have is a compassionate program for treatment and reducing the hurt and turning it into hope. How can we do that? When we look at safe supply, Mr. Speaker, what is safe supply that we hear so often touted about in this House of Commons? It is a term that was actually coined by Purdue Pharma. Now, I'm sure every Canadian out there knows who Purdue Pharma is. Let's just put some safe opioids out there. It'll be better for everybody. These are safe substances. And Mr. Speaker, what happened? We all know what happened. Everybody in this House knows what happened. That was the beginning of the opioid crisis. Even the Minister of Mental Health and Addictions knows that happened, Mr. Speaker. And so then we fast forward. We fast forward to a program that was created as a policy in British Columbia the early days of COVID-19 in 12 days, Mr. Speaker, to create this term now of safe supply. And what does that mean? That means that now the Canadian government, this Liberal Canadian government, is purchasing drugs for people to use. Now you think about it, if I wanted to take illegal substances and someone was going to buy them for me, does that make sense that I'm going to take less or I'm going to take more? I think the common sense of the common people out there would realize that that is going to compound this problem. I think the other important thing, Mr. Speaker, to understand is in this, I hate to say it, in this program that is beyond comprehension of a common sense person, what are the metrics to understand, is it working or not? And quite sadly, Mr. Speaker, there are none. There are no outcome measures, there's no metrics, there's nothing to say that, is this working or not? This is a sad but grand social experiment, Mr. Speaker, and it hurts me to say that. I have personal experience in this. I worked in a chronic pain clinic as the physician advisor alongside a psychologist, an occupational therapist, and a physiotherapist 1 day a week for 15 years. A long time. A lot of people there using opioids, Mr. Speaker. And one of the things that we know very clearly is that people suffering, if they don't have connectedness and hope and identity and meaning in their life and empowerment, they do not do well. They suffer. They suffer and they suffer and they suffer. And shame on this government, this Liberal government, for wanting those things to continue, Mr. Speaker. One of the things that we know very clearly is in this program, somebody who wants to participate can access 24 8-milligram tablets of hydromorphone. And we look at that, Mr. Speaker, and we say, well, it's 24 tablets, it's not that much. Let's put it in perspective. 1 8-milligram tablet of hydromorphone is the equivalent of 10 Tylenol 3s. Now, I use that as an example because oftentimes people have their wisdom teeth out or they have a significant injury. They might have received Tylenol 3. I challenge them to take 10 of them at once. No, I don't. Let's not challenge them because, Mr. Speaker, you know why? Because they could die from it. That is why we don't challenge them. That is why. If I had my wisdom teeth, I took 2 of them. I slept half the day. This is inappropriate, Mr. Speaker. And let's look at what these 24 8-milligram tablets look like. That's 192 milligrams a day, which is 960 milligram equivalents of morphine. Now, what does that mean? That means the equivalent of 246 tablets of Tylenol 3 a day. 246 a day. Who needs that much? Now, I realize chronic pain, my expertise, and drug addiction are 2 very different things. I understand that very clearly. But, Mr. Speaker, 246 tablets of Tylenol 3, that's what we're talking about here, the equivalency. And, Mr. Speaker, let's be clear. When this Liberal minister appeared in committee, we talked about fentanyl. The treatment dose, if you dislocate your shoulder perhaps in the emergency room, 100 micrograms of fentanyl, maybe 200 micrograms. And when we were doing those procedures, Mr. Speaker, we always had a respiratory therapist there to ensure that that person didn't stop. If they did stop breathing, we could support their breathing. What is this decriminalization experiment excited about? 2.5 grams of fentanyl, Mr. Speaker. How many people could you kill with that? The minister then went on to say, well, it's always cut with something. Let's say that 2.5 grams could kill 25,000 people. Let's cut it in half. Let's cut it in half again. Let's cut it in half again. 1,000 people? You have enough on your person to kill 1,000 people. Mr. Speaker, it's beyond comprehension. There's no common sense here. The market is being flooded with opioids. You heard the great leader of the opposition speak about the reducing price. Prices have gone down from historical averages of 8 milligrams of hydromorphone to 25 cents. Mr. Speaker, what do we see then? We see that those drugs are being bought from people who've gotten them for free for 25 cents, being distributed around the rest of the country for $5 a pill. They are also being now sold across the border into the United States. This is absolutely insane, Mr. Speaker. It makes absolute no sense. And what else is happening? those people are taking that money and trading up to fentanyl. It's illicit fentanyl, yes, but that's what they want. They want the high from fentanyl. That's what they want. That's what they're doing. That's how they're getting it. They're selling their hydromorphone that this Liberal government is giving them for free. They're selling it to buy fentanyl. Let's be clear. And if they're not, they are taking that hydromorphone, they're crushing it, and they're injecting it. This is fact. These are facts, Mr. Speaker. We see this because we know when people show up in emergency rooms, they have heart valves that are infected because of the injections. They have spinal cord abscesses that you almost only get with intravenous drug use. This is what's happening, Mr. Speaker, with this quote-unquote safe supply. Let's be honest, Mr. Speaker, it is not safe. There's nothing safe about this.
Absolutely.
The other very, very sad thing that we understand very clearly is that palliative care for these drug addicts is where this Liberal government is starting. They are not offering other treatment. They are saying that you are beyond reach, that all you're going to do is get medications that we want to perpetuate your state of existence. We are not offering them housing. We are not offering them social supports. This government is not offering them anything except more drugs to perpetuate their zombie-like state. Mr. Speaker, this is unacceptable in Canada. This is an approach that is not working, and we know that very clearly. We know that this is not the standard of care. We know that this anywhere else in the world that people do not want to exist in this state. We know that Canadians do not want to exist in this state. We know that it's not reducing deaths. If we want to talk about an outcome measure, we know that that is increasing. We know that 600 people have died in British Columbia in the first 3 months of 2023. We know that that's a 9% increase from last year. How can you say that we should continue this insane experiment?
Absolutely.
Mr. Speaker, most importantly, what we need to understand and what Canadians need to understand in this, as I said previously, this seminal moment is, does this make sense? Is there science behind it? And clearly we know that the answer is no. There is not science behind it. We know in the Portugal model that people like to talk about that when the funding reduced in Portugal for things like social supports and housing supports and medical supports, we know what happened, Mr. Speaker. And what happened then? The rates went back up again. The deaths went back up again. We know that we can't go down that same road, Mr. Speaker. We know very clearly that what we need to do is care for Canadians. We need to care for them deeply. We need not to treat them with a simplistic palliative care approach that says, take all of these medications that you want, they're safe. From the Purdue Pharma experiment, Mr. Speaker, we know that they're not safe. From the Canadian experiment in British Columbia, we now know that they're not safe. Deaths are increasing. We need to have this experiment stop now. It's not working. Mr. Speaker, I said it before, but what Canadians need, they need to be connected, they need to have hope, they need to have an identity, they need to have meaning in their life, and they need to be empowered to get better. And our program will enable Canadians to do that, Mr. Speaker. Thank you.
Hear, hear.
Questions and comments? The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. And I agree with the member opposite that people need hope and connection. And the way they get that quite often is at a safe consumption site or a safe supply prescriber. That is where they get the connection to get the hope and to be able to get on a path to a better life. What I'd like to ask the member is that does he remember when people objected to methadone? They objected to Suboxone. They objected to Sublocade. And it is about people who have dependence not able to tolerate being dope sick. So I want to know why the member rejects these opportunities for people to have finally someone they trust who can help them on a path to recovery.
The Honourable Member for Cumberland Colchester.
Mr. Speaker, I think there's a few things in that member's question. Number one is the 600 people who died in BC in the first 3 months of this year. They don't have an opportunity to get better. Number two thing is that member opposite who is also a physician, quoted a study from London that talked about a study which actually lost people to follow-up, so we don't know how many of them died. They also gave those people social support, housing supports, and medical supports. That is not what Safe Supply, that is not what this Liberal government is doing. Those folks received a program. They received prescription medications, and they were in a program. That member opposite, Mr. Speaker, misled the House and carelessly used facts in that particular case to suggest that the program was the same as what Safe Supply is and what the vending machines, which this Liberal government spent $3.5 million on in Vancouver and Victoria, are giving out on a daily basis, Mr. Speaker. That's a different case, and that's wrong.
Questions and comments? The honourable member for Berthier-Masquinongé. Thank you very much, Mr. Speaker. My question for my colleague is, their approach is very dogmatic, in my opinion. Isn't this more of a public health problem than a crime problem? People have extreme addictions. It's hard to judge from the outside. So you have to have spoken to people, for example, alcoholics, people with serious addictions, to see how harmful it can be to the individual and to their judgment. And the conservative approach is the opposite, but you really need to support these people to help them get over their addiction. How does my colleague feel about that, trying to help people get out of the black hole of addiction? The honourable member.
There's not many things that can really get my ire up in this House. But right now, I have to say that this is one of those things, Mr. Speaker. For someone on this side who sits in the block to say that we have a dogmatic approach when we talk about creating connectedness and hope and giving people meaning in their life, giving them identity and empowering them to have a better life is a dogmatic approach, that it is politicized, that it's not taking into the fact that this Liberal government has created an environment for social chaos, rampant crime, rampant violent crime, that an approach that will actually give people a chance to recover and have a new life and rediscover their life again is dogmatic and inappropriate. Shame on that member, Mr. Speaker. I say again, shame, 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 shame.
Questions and comments? The honourable member for Courtenay-Alberni.
So, Mr. Speaker, my colleague's worried about vending machines selling Safe Supply. He should be worried about the unregulated toxic drugs that are being distributed, manufactured, and marketed by organized crime on almost every downtown street corner across this country, yes. Mr. Speaker. You can find it on the dark web. It's not Safe Supply that's killing people. It's fentanyl, Mr. Speaker. Now, the Canadian Association of Police Chiefs put out a statement. They said in their report, they endorsed access to users of a safe supply of pharmaceutical grade of opioids to combat the uncertain composition of illegal street drugs, which is the cause of many overdoses. It further made a recommendation in favor of supervised consumption sites where people could use drugs in a clean, safe environment under the supervision of health professionals trained in emergency intervention. So, Mr. Speaker, to my colleague who's a party that says they're for the law and order party, are they going to listen to the Canadian Association of Police Chiefs?
Here.
Well, member for Cumberland-Colchester, very quick answer, please.
Well, Mr. Speaker, I thank the member for that question. You know, I think when this member is up at night cruising around the dark web, what we're doing on this side of the House is actually understanding that there is a crisis in crime, that there is a crisis in the fact that this Liberal government supplied hydromorphone is being sold to buy illicit fentanyl because that is what addicts are wanting right now. And Mr. Speaker, we know that this is an untenable position, and we know on this side of the House that we want Canadians to have a home, our home, your home, bring it home.
Reprise du débat, continuing debate, the Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker.
I'll be sharing my time with the member for Sherbrooke. Before I begin, I'd like to acknowledge that I'm speaking to you today from Ottawa, which is located on the unceded traditional territory of the Algonquin and Anishinaabe people who've lived on this land since time immemorial.
We take the time today to address this national public health crisis. But first, however, I want to talk about the wording of this motion that we are debating today. The opposition is calling on us to reverse deadly policies. Yet the BC coroners has repeatedly said there's no indication that prescribed safe supply is contributing to the death, the unlisted drug deaths of the illicit drug supply. It seems that this party wants to take us back to the failed ideology of the Harper-era drug policy.
Enough's enough.
Can't the opposition understand that the harm that their narrative is causing? When the member opposite talks about zombies and talks about crazy policies, this is stigmatizing, and that's all they know how to do. Do they not hear the public outcry from people who actually have lived and living experience of substance use? The people who have overdosed 2 and 3 times and been revived in a safe consumption site are now part of helping people get well. Groups like Moms Stop the Harm will have the loved ones of people who've lost lives to the overdose and toxic drugs. They've asked the Leader of the Opposition to meet with them in early June. Will he meet with them and hear their story? It changes people's lives and their opinion. This fight against evidence-based programs that are actually saving lives just has to stop. People are dying, but not for the reasons they're giving. Le Canada fait face à un double.
Canada faces a double epidemic of a toxic illegal drug supply and an overdose crisis.
Countless lives are shattered by the devastating consequence of the crisis, and over 30,000 people have died.
We have to recognize that substance use and addiction are complex issues that can't be solved by just ignoring them or using outdated approaches.
And the loss of their loved ones. Communities bear witness for the tragedy of addiction, and individuals suffer often in silence because they're being stigmatized, as the opposition is doing today. But it doesn't have to be this way. Substance use disorder, opioid use disorder, a recognized chronic medical condition deserving the same respect and evidence-based care as any other illness. By implementing safer drug supply initiatives, we can save lives and provide individuals with the opportunity to break free from the cycles of addiction. Because there is no recovery for people who are dead. We have to be there when the person using drugs says, "Where's the Suboxone lady?" We have to have that absolutely real-time approach. It is by implementing safer supply that we minimize the risks of people using drugs. We can ensure that those who use drugs have access to pharmaceutical-grade substances that are tested for potency, purity, and provenance. It is the poison drug supply that is killing people. I think the opposition needs to understand that that is the problem we're dealing with, is this toxic drug supply. Nous pouvons prévenir les surdoses.
We can prevent accidental overdose caused by drugs of unpredictable potency, contaminated substance, or adulterants.
Save lives. But our approach goes beyond saving lives. It is about creating the path to recovery and rebuilding shattered lives and families. When individuals have access to safer drugs, they engage with the healthcare professionals. They are able to seek support, healing, and rehabilitation. It's like moving from in-site to on-site in Vancouver. It provides an opportunity for connection, trust, and the delivery of comprehensive care. But I want to be clear. This is not about encouraging drug use or turning a blind eye to the consequences. It's about acknowledging the reality that people will continue to use drugs, and that by providing a safer alternative, we can minimize the harm and pave the way towards recovery and rehabilitation. Illegal drugs being sold illegally is still illegal. Diversion is illegal. Nous devons reconnaître.
We have to recognize that behind the statistics and headlines, There are real people with aspirations, dreams, and difficulties. People who deserve our empathy, our understanding, and support. Further stigmatizing them and criticizing the care they get won't get people struggling with a substance use problem to seek treatment.
What's more, Canadian drug policy and international drug policy are aligned. Prevention, harm reduction, treatment, and enforcement make up the 4 internationally recognized pillars of drug policy. We lived through 10 years of that Conservative government taking harm reduction out with their deadly war on drugs that has been proven to be ineffective, costly, as well as deadly. These policies have also had a profound negative effect on Canada's most vulnerable, including Indigenous people, children, young people, people living with disabilities, and immigrants and refugees.
While the Conservatives keep trying to take us back to the days when people who use substances were told that their lives didn't matter, our government will use every tool at our disposal to put an end to this national public health crisis.
I'd like to quote from the Public Safety and Justice Advisor to former Prime Minister Stephen Harper Van Perrin. Safe supply is tested and found beneficial for people who are unable to get treatment for whatever reason and are long-term substance users. We're talking about substituting a contaminated street dog with a drug that is known content and potency and help people stay alive and to be able to stabilize. And here are some other important experts. Both the College of Physicians and Surgeons in BC and Ontario have made statements acknowledging safer supply as a harm reduction tool to support people with opioid use disorder. I encourage the member to reread the CMAJ article from last September and see that the Safe Supply, the Community Health Centre, is providing the suite of health and social services reports. That's exactly what we do. That's how you get them in the door so they can find a way to a better life. And as I continue to say, since 2017, safe consumption sites in Canada have received more than 4.1 million visits, reversed 46,000 overdoses, and made 236,000 referrals to health and social services, which the Conservatives have vowed to defund.
What would they say to the families whose loved ones would have died if this approach was not available to their loved ones who use drugs? If only I could say this was the first time the Conservatives hadn't followed public health advice.
This is the pattern for the official opposition. Despite overwhelming support and effectiveness of vaccines, despite the fact that 11% of maternal deaths are from unsafe abortion, this party continues to prefer ideology over evidence. We as a country must and can do better. I prefer the Canadian Medical Association Journal to the National Post. And more importantly, this is how we will save lives. Right. Thank you, Mr. Speaker. Merci.
Questions and comments? Question commentaire, the Honourable Member for Mission Mascouy Fraser Canyon.
Thank you, Mr. Speaker. I represent Mission Mascouy Fraser Canyon, which is in the Fraser Health region. In British Columbia, the most deaths from opioids took place in the Fraser Health region. In 2022, 680 people died in the Fraser Health region. Since the implementation of the decriminalization policy of this government, those deaths have only increased. But I have a very specific question today for the minister. Part of the agreement when the government decided to decriminalize hard drugs in British Columbia was that schools and places where children frequent, that there would be enforcement and that the policies of decriminalization wouldn't apply. A week after this government decriminalized, my son's daycare had to be shut down because people were injecting illicit substances and leaving that behind. I couldn't take my son to daycare that day. He goes to a school in downtown Abbotsford. So my question to the minister is this: what policies have been put in place to enforce areas where children frequent to ensure that they're not exposed to illicit drugs? We are normalizing illicit drugs in this country, Mr. Speaker, and I want to know what the minister is going to do to stop that. Thank you.
The Honourable Minister.
Well, I thank the member for the question. I also I'm pleased that he recognized that in the agreement for the Section 56 exemption, that it is still not okay to actually use drugs in the playgrounds or the places near schools. Many municipalities are looking at expanding that with their bylaws, but at the moment that is still illegal. And so what we're also saying to the member is that a lot of the deaths in the Fraser Canyon and all over the country are actually not with the people who've been using drugs for a long time. Construction workers. I was at the Carpenters Union in Nanaimo, where they're in Victoria, where they're actually handing out naloxone because they are losing loved ones on the work site because of the poison drug supply. So I want the member to understand that people are using alone, dying alone, and we actually have to have policies that will prevent those deaths.
Question et commentaire. L'honorable député de...
The honourable member for Longueuil-Saint-Hubert. Thank you, Mr. Speaker. I appreciated my colleague's approach in her speech. It's true that it's a complex human issue. That behind the stats and the numbers, there are some very grim realities. I myself, in my family, experienced this problem. It's not easy to talk about. It's emotional without getting emotional. So I agree with my colleague that it's a public health issue, unlike the dogmatic conservative approach. But if it's public health, then it's obviously a health matter. And of course, Quebec has called for increased health transfers. Unfortunately, we asked for $6 billion. We barely got $1. Of course, there are people who have these addictions. What's the government waiting for before increasing health transfers? The Honourable Minister for Mental Health.
Mr. Le Président.
Mr. Speaker, my condolences and sympathies for the member when it comes to the sad situation in his family. Transfers to the provinces and territories, and particularly the $25 billion, one of the tranches, one of the substances for substance, one of the amount of money is for addiction and substance abuse situations. So that could go part way towards dealing with that tragedy and the pandemic as well.
The Honourable Member for Courtenay Alberni.
Mr. Speaker, we heard the Conservatives from Fraser Valley rail against harm reduction when, in fact, they support harm reduction and they support treatment and recovery. There is no war between harm reduction and treatment and recovery. We need them both, Mr. Speaker. So what I'm seeing today is we see the Conservatives spread misinformation, which is costly in a health crisis. But we also see the Liberals take an incremental approach, which costs lives. So through you, Mr. Speaker, I've asked the minister repeatedly to scale up efforts. This is a national health crisis. They're spending less than 1% of what they spent on the COVID-19 crisis and the response to it. We've lost almost as many lives, Mr. Speaker. And we look at the amount of money they spend on the AIDS crisis, on SARS, on other health crises. It doesn't even pale in comparison. So when is the government going to scale up on safe supply? When are they going to get involved in the recovery and treatment on demand? Because we need them to get involved. They can't keep downloading to the provinces. That's where Portugal stepped up, Mr. Speaker. And we need this federal government to scale up with rapid investments so that when people need help, they get it and we meet them where they're at.
The Honourable Minister of Mental Health and Addictions.
Thanks very much, Mr. Speaker. And I thank my colleague for the really important distinction that the polarization of harm reduction versus treatment is extraordinarily unhelpful. We know people need access to treatment at that moment they're ready, but we also know they need adequate aftercare so that they actually don't fall back into the environment that made them sick in the first place. I think that as we move forward, as the member well knows, that there were over $100 million have been designated for safe supply. In this last budget, we received another $144 million in terms of the substance use and addiction programs, as well as the $25 billion going to the provinces and territories, where one of the four pillars is mental health and substance use. And we hope that the provinces will be able to use that on the issues of complex care, the issues of treatment beds, as well as aftercare, and I look forward to working with the member as we tackle this flawed ideology on the other side.
Reprise du débat, continuing debate. L'honorable secrétaire parlementaire.
The Honourable Parliamentary Secretary to the Minister of Mental Health.
Pleased to rise in this House today to address the motion from the member for Carleton and provide an update on our government's response to a complex challenge facing our country, the overdose crisis. This crisis is having a tragic and unrelenting toll on Canadians, their families and communities. Chacun de ces décès est une tragédie.
Each of these deaths is a tragedy and creates a void in our community that can never be filled. Each person who lost their life in this crisis left someone in mourning.
Recognized internationally that are necessary for a successful substance use strategy: prevention, harm reduction, treatment, enforcement. Our government is committed to a comprehensive approach that implements policies and supports in all four of these essential areas. The dangerous, ideological, and outdated approach proposed by the Conservative motion creates a false choice between harm reduction measures and treatment. We need both. As BC Chief Coroner Lisa Lapointe recently said, there should not be a dichotomy between access to life-saving safer supply and access to life-saving treatment options. Cette motion est simplement conçue pour
This motion has simply been designed to strengthen stigmatization, engage in fear-mongering, and raise money among the Conservative base. It is dangerous, counter-scientific, and would cost lives if implemented. Mr. Speaker, the toxic drug supply and overdose crisis is a daily concern for our government. When we think about the lives lost, the effects on communities, the devastating losses for families, the effect on the economy, we can see that this is a national tragedy. It has never been more important for every order of government, partner, and stakeholder to work together to put an end to this crisis.
We must first understand the many different factors that drive substance use. That must include addressing mental health. Harmful patterns of substance use are established over time. Some people can trace their substance use back to early childhood trauma. Others may be affected by poverty or housing instability. Si de nombreuses personnes au Canada sont...
We know that many people in Canada are facing mental health issues, but some groups have particular challenges because of systemic racism, discrimination, socioeconomic status, and social exclusion. Marginalized groups are often falling victim to stigmatization and bias, which leads to increased risks for them. This includes youth, Indigenous people, racialized communities, and LGBTQ people.
In several ways. La stigmatisation dissuade les gens.
Stigmatization leads people to not request assistance and also reduces their opportunity to get help when they ask for it. It may also mean that there are issues in implementing programs to help people who consume substances.
A deep-seated misconception that addiction is a choice, and that's just not true. La dépendance est une condition médicale.
Addiction is a medical condition and can be treated.
Needs support, not judgment. They need community, not isolation. They need empathy and understanding, not stigma. When substance use is stigmatized, it creates a very dangerous situation. It can lead to people using drugs alone and prevent them from seeking help. That's why we need to provide a continuum of care to people who use substances, one that is woven through every area of their lives. Prevention, treatment, and harm reduction measures all have a role to play, as do actions that reduce stigma and provide continued access to health and social supports for individuals. Notre objectif est de réduire.
Our objective is to reduce the stigma and risks linked to consumption of substances, while also giving people who use drugs better access to social and health services. To reach that goal, Canada must take an overall social perspective on this issue. Since 2017, the government has invested more than $1 billion in prevention, treatment, harm reduction, and enforcement. That amount comes in addition to investments that provincial governments have earmarked in their jurisdictions. The Government of Canada is working with the provinces and territories to create a multidisciplinary approach that will integrate mental health and addictions knowledge.
Access to mental and substance use health through primary care to improve data and better sharing of health information between professionals they consult. These tailor-made agreements with provinces and territories will improve access to the supports Canadians need when they need it. Mais nous savons que nous devons faire plus.
But we know that we need to do more, including innovative approaches to save lives and enable people who use drugs to more easily access social and health services, like treatment for people who are ready. Budget 2023 presented our plan to transfer a large sum of money of billions of dollars to the provinces and territories over the coming years to improve healthcare, including in mental health and addictions. That will be done by increasing the Canada Health transfers and also by new 10-year agreements with the provinces and territories.
Help us build, among other things, a resilient health workforce that provides Canadians with high-quality, effective, and safe health services when they need them. That includes access to timely, equitable, and quality mental health, substance use, and addictions services. Grâce à nos accords bilatéraux sur mesure.
Thanks to our tailored bilateral agreements, we will invest $25 billion over 10 years to collaborate with provinces and territories in order to move forward common priorities in the area of health.
Effective way to integrate mental health and substance use services throughout the healthcare system. Cet investissement s'ajouterait aux deux.
This investment would be added to $2.4 billion over 4 years. That money remains to be sent to the provinces and territories for mental health and addictions treatment as part of the common joint statement on shared priorities from 2017.
Services are a vital part of a comprehensive, compassionate, and collaborative public health approach to problematic substance use that includes prevention, treatment, and additional social and health supports. Nous ne pouvons pas laisser l'agenda idéologique.
We cannot let the conservative ideological agenda close down safe consumption sites, which have enabled us to avoid up to 46,000 overdoses since 2017. These safe injection sites are replacing contaminated street drugs by drugs whose content and strength are known to help people stay alive.
Alive until they are ready to access treatment. We cannot allow the conservatives to take us back to the failed ideology of the past. Ensemble, nous pouvons créer un...
Together, we can lead to true systemic change and give everyone in Canada the support they need to live a long and healthy life. Thank you.
Questions and comments? Question commentaire, the honourable member for Mission, Mascouche, Fraser Canyon.
Well, thank you, Mr. Speaker. The member opposite just said in her speech that we need to help keep people alive until they're ready to receive treatment. I represent the Fraser Health region. We had the highest number of deaths caused by opioids last year, and we're on track to pass that number again. Under this policy, It's like death has become normalized. So part of the member's speech, I agree with it, that we need to have a comprehensive approach. But right now in British Columbia, Mr. Speaker, there is no comprehensive approach. In fact, in the Fraser Health region, there are only 8 detox beds. What we've done in Canada is normalize the use of hard drugs without providing any option or capacity for people that want to receive care to get it on demand. Why has this government failed to provide detox beds in the areas of Canada where there is the highest number of deaths caused by illicit opioids?
Honorable Secretary Parlementaire.
Thank you, Mr. Speaker, and I thank my colleague for his question, and my best thoughts are with the people of his riding. There are several ways to help drug users, and if we want to keep people safe, supervised consumption sites and overdose prevention sites are part of the solution. They play a significant role in saving lives, and almost no one died of illicit drug poisoning at these sites, and we are there, and we will move forward with the opening of others sites.
Questions and comments. L'honorable député de Berthier.
The Honourable Member for Berthier-Masquinongé. Thank you very much, Mr. Speaker. We in the Bloc Québécois, we believe that this is a public health problem. We believe that we need to support people when it comes to the opioid crisis. And yes, sometimes you need to give people time to transition in a safe place with a safe supply. There is nothing harmful about that. What I find unfortunate is that the terms that are being used in the motion already include a bias baked in. And when I asked a very common, polite question earlier to call into question the Conservative vision, I was told, shame on this member. I was told, shame on this member, to use the original language. So I'll ask the question to the Liberal member, and I hope that from a Liberal member I won't be told, shame on you. I'll ask her, how can we find a balance? Because the Conservative intentions aren't all bad. That's not what I'm saying. The idea of offering more services, the idea of offering treatment, there's a balance to be found. I'd ask the member to explain her vision. How can we find a balance between support for safe consumption and helping these people exit this vicious cycle? Because, of course, ultimately, that's everyone's goal. The Honourable Member for Sherbrooke. I'd like to thank my colleague for this very important question. And no, I won't reply in the same way as what he was told by the Conservative member. Indeed, there are 4 major pillars to the approach that this government is taking: harm reduction, supervised consumption sites, treatment, and enforcement. It's that overall systemic approach that can enable us to offer the approaches, the proper help that each person who uses drugs needs. This is a complex issue which is different for each individual. We don't know why different people are using drugs. We don't know the exact reasons for each of those people. So we need to offer them a wide range of solutions so they can find the one that works for them.
For Nunavut.
And I'd like to thank the member for her intervention. I wonder if I could ask the member to talk in a bit more detail about one of the 4 pillars and the importance of safe consumption sites, because I don't know that there's enough understanding about the importance of these places. Could you please provide more detail about why they're so important?
The Honourable Member for Sherbrooke.
Avec plaisir, Monsieur le Président. Donc, les 4 piliers, comme j'ai...
With pleasure, Mr. Speaker. The 4 pillars are prevention, harm reduction, treatment, and enforcement, as I was saying. And it is by following these 4 pillars that we will be in a position to offer solutions that are better tailored to each of the individuals who use drugs. And the latest numbers confirm that 46,000 overdoses have been avoided by the use of supervised consumption sites. That shows that these sites are essential. and are a key portion of the range of solutions that we can propose to fight this opioid crisis.
Reprise du débat, l'honorable député.
Resuming debate, the Honourable Member for Beauport-Limoilou. Thank you, Mr. Speaker. I'd like to start by saying that I will be sharing my time with my extremely eloquent, passionate, and interesting colleague for Longueuil-Saint-Hubert.
Facile.
It's difficult for me to talk about the topic of drugs. It's difficult because it makes me emotional. And when I don't want to be emotional, I tend to turn towards data and statistics. I have to try to take a rational approach because this is something that makes me so sad, because there are people I loved who will no longer be part of my present and future. And that is why this is a subject that makes me very emotional. And yet, this morning, clearly I'm having trouble not being as emotional about it, but I will do my best. We need to try to find a general view of the situation in order to act properly. These pilot projects specifically aim to give us more data. The opioid crisis is not a partisan issue, and it is not one that should ever become partisan. It's not the type of issue where you should say, oh, my party does this or that. It's the type of issue which we should instead say things about like, together we have succeeded to do such and such. Let me just go over the data a little bit and what's been reported in the media and try to nuance this and talk about what the point of the pilot projects is, as well as the safe supply programs. The data in the Conservative motion are true. I won't go over all of this data, but indeed 20 people a day are dying because of the opioid crisis daily. Since 2016, this represents more than 34,000 people, and nearly all of those deaths are accidental. In most cases, people who got drugs on the black market, products where people didn't even know there was fentanyl there. And in 88% of cases, we're talking about people between 20 and 59 who died, people in the prime of their lives. Before the pandemic, only 20 people a day were dying due to the opioid crisis. The increase can be attributed to mental health issues that were worsened by the distress people underwent during the pandemic. I listened to my Conservative colleagues saying, well, the pandemic is over. It's not because the pandemic is over that the distress caused is over. It is not because the pandemic is over that addiction has magically ended. In the media, it was said that people were taking hydromorphone to sell it and then buy fentanyl on the black market. Do all hydromorphone users resell it? No. How many of them sell it? Very hard to say at this point. I hope that we can find out eventually through the pilot projects, through the data. The black market exists because people can't access things legally, no matter what the product is, and on the black market, there's no way to control the quantity or quality of the doses. This is the main issue here.
A person who becomes addicted goes outside of the healthcare system. Even if they function well day to day, this person gradually leaves the system because they don't want to tell their doctor, I'm addicted, I need help. So the healthcare system has to reach out to that person. And how do we reach them? It's by going where they get their supply and ensuring that they're healthy. Unfortunately, sometimes it does create a dependency, but we have to offer to products that are of better quality. And so when they do use these products, there are people who can listen to them to know what their distress is, what the source of it is and to try to undo these issues. It's a very long process, and some people never manage to step away from it. The Conservative motion does not, unfortunately, mention the services that are offered. Sorry. It's incredible. The Conservative motion, unfortunately, does not mention the services offered by pilot projects. They're talking about medical care, mental health support, medical support for infections that are sexually transmitted through blood, employment assistance, lodging assistance. These projects have a holistic approach, a global approach of the needs of people who are addicted. And this didn't happen miraculously. Something took place. These issues with pilot projects, these interventions have to involve understanding and opening, not judgment, not punishment. We have to see where the person is at and how come they got there and how we can help them. We have to be able to get through the issues in the mental mind of the person who is addicted. These programs, where there is real investment, have seen advantages, an important increase in the quality of life and reduced consumption of street drugs that are dangerous. When we help solve health issues that are related as well, the person can have more energy, they can be more effective and have more time for their own lives. So all of these are important factors. And they allow the person to be more committed to themselves. And if this person is more committed to their own life and their own society, well, will they be cured for life? Maybe, maybe not. But we have to start on that path. Drug consumption is a public health and safety issue. There's no simple solutions. It's not just one department that is involved. It's everyone's responsibility, and we have to have based on best practices and on data. We have to protect the health and the dignity of people. Dignity is one of the most important keys in this process. Other people's opinion of you can have a big impact on the reaction of those who are addicted and their own judgment of themselves. When they look at themselves in the mirror and they see how they're really worn down and destructed by drugs, they know this. We have to help them to tackle these issues and accept help and see what is best in themselves, and we shouldn't be judging them and kicking them to the bottom of society. Otherwise, they'll be back on the black market with uncontrolled doses of drugs. In Quebec, we have a strategy that has 7 areas of action through the department: educational awareness, harm reduction, regulations, surveillance, research, training, treatment, and for dependency and also pain. These 7 areas have 15 measures to enhance access so we can offer services. We want to protect people even from themselves by developing safer supplies. We can improve the quality and quantity, and we can help these people lead to recovery because they have access to support services. This wouldn't happen without these pilot projects. Is it perfect? No. These services are really overwhelmed because of the crisis. We have to have better health care transfers. As I said, the current crisis means we have to listen to stakeholders, and we need a holistic vision so we can help those who are addicted by acting against criminals who act on the black market. And we have to stop stigmatizing this as a mental health issue. We shouldn't throw out the baby with the bathwater. We have to work with the baby. Thank you. Questions and comments?
Comments, the Secretary.
The Honourable Parliamentary Secretary. Thank you very much, Mr. Speaker. I share the pain and the emotions of my colleague. I could compare this to the rigidity of the Conservative Party. Well, in terms of how other people look at those who are consuming drugs and how these people look at themselves, we know that stigmatization has an important impact on how they react and how they behave. Because does she agree that if we work to lower the stigma, we can improve the current crisis? The Honourable Member for Beauport. When we see someone who seems to be in a crisis because they took drugs or because their mental health is poor, rather than judging them, we should look at the human that is behind them. And these pilot projects are also working on this. It's important. You have a human being that sometimes is injured, but that explains the current situation they're in right now. And we have to support them, help them, not judge them. Thank you.
Comments? The Honourable Member for Battleford's Lloydminster.
Thank you very much, Mr. Speaker. And I want to thank my colleague for her very real, human speech. It's unfortunate that this is turning into, well, I'm hearing words like rigidness and judgment, and that is not at all the case. I know here on this side, as we heard one of our colleagues talk about the importance of community, connectedness, hope. We believe in the value of every single person. Dignity is so important, like she said, absolutely, absolutely. Empowerment, it is so important that the policies that are being put in place at every single level of government are there to empower the person. So I know I did hear her talk about services. I believe in the importance of wraparound services such as housing, counseling, psychotherapy. I'm just wondering if she could expand if she believes in the importance of these services as well to help people overcome addictions. Thank you.
The Honourable Member for Beauport-Limoilou. Yes. Yes, these are essential services. Of course, there are some drug users who are functional, who have housing, but they could lose their housing if the situation gets worse for them. We also have to manage their pain, whether it's physical or psychological, and sometimes they need help to learn how to manage this pain and live with it. So yes, services are essential, and we need better funding. That's urgent.
Questions and comments? The Honourable Member for Port Moody Coquitlam.
Mr. Speaker, I really thank the member for her speech today. These are heartfelt realities that are happening to families across this country, and I'm just so moved by the member's speech today. I am disappointed, though, in the Liberals and the Conservatives in their actions over the last 30 years in regards to investments that the member spoke about in her speech, housing, pharmacare, all those investments that matter to the well-being of people. So I wonder if the member wouldn't mind speaking about the lack of investments and how it's affecting the communities.
The Honourable Member for Beauport-Limoilou. Yes, I'm disappointed by the lack of investment over the past few decades. But as I said at the beginning of my speech, we're at a time when we have to say together that we're going to succeed, and we're aware of the issue, we're aware of the solutions, and at the end of the day, when we invest in housing and in health and mental health, we're investing in our economy, because these people who have good housing, whose basic needs are met, manage to succeed and they go back to the workforce, or at least to society. They do their share in their way. So this type of investment is not a loss. It grows our society in a good way. Thank you. Resuming debate, the Honourable Member for Longueuil Saint-Hubert. Thank you very much, Mr. Speaker. I'm somewhat surprised by the way the debate has gone this morning. Not surprised, but this is a tricky debate. It's emotional. It's sensitive. It's a human debate. It affects people very deeply. And I can talk about this personally as well. I've also seen this in my family. It has been with me my entire life as a child, issues of addiction to various substances. You never really heal from addiction. You deal with it your entire life, whether you're using or not using. People who are addicts remain so their entire lives. It's something you are born with and you live with. You are born with it just like you're born with brown eyes or a talent to run 100 meters in 50 seconds or whether you've won a Nobel Prize because you're a big researcher. You're born with that ability or that something that's within you. You have to learn to live with it. So you have to put judgment aside. The problem with the Conservatives, it's always somewhat dogmatic. Yes, they have the merit, and I will say so today, to approach tricky questions that are complicated and important in their opposition days. In recent weeks, they have tackled the housing crisis, which is another major crisis that we're seeing in Quebec and Canada and even worldwide right now. It's a major issue. The problem is their solutions. What are they bringing forward to solve this issue? Another opposition day was on the carbon tax. They wanted to scrap it, and they're tackling another big issue of our time, another fundamental crisis that is the climate emergency. But they just want to scrap that carbon tax. That's no real solution. And the same thing for the housing crisis. What are the Conservatives bringing forward as a solution? Let's scrap municipal governments. There are too many governments in this country, and we agree with one government that is too many, but we could share that option. But it's not the same government as the Conservatives. Okay, but they tackle these key issues, but with simplistic solutions. Solutions that may not allow us to move forward. The tough on crime solution. My colleague mentioned it earlier. In the U.S., they tried this. Let's be hard with drug addicts, they say. Behind this approach, there's always a punitive mindset, one that condemns people. It's a problem we can get rid of, they say. But as I said earlier, when you live with this and you're born with it, you have to live with it every day. So let's talk about what's happening in the U.S. right now. The U.S. is recognized for its severe policies on drugs, but they haven't managed to solve the issue. In the U.S., there are deaths that have gone from 50,000 in 2015 to more than 100,000 in 2021. And that's with a punitive approach to drug use. It hasn't had an impact on drug use. So that's what the Conservatives are reproaching this morning, is this situation. And they have the worst incarceration rate of its population in the world in the U.S. Incarceration, that is drug-related. That is related to drug use. So it's part of the approach that was introduced by Nixon quite some time ago. And the U.S., as was mentioned earlier, in some regions, they started another approach that is similar to one that they developed in Switzerland and also in Portugal in particular. In 2001, Portugal changed its approach by introducing decriminalization for simple drug possession. And it worked in Portugal. It worked because, based on studies, they saw a new paradigm. And that's what we're defending this morning, and that's what we at the Bloc are defending. Drug use is not criminal. It is first and foremost a public health issue. But let's talk about public health. Because if we are criticizing the Conservatives today of being dogmatic in their approach, if we approach this as a public health issue and a mental health issue, because that's what it is, we have to properly fund this issue. We have to help people. We have to support them throughout this process. But that takes funding. It takes people to support them. It takes psychologists. It takes nursing support and centers where we can receive these people. It's a mental health issue, public health issue. So we need to properly fund health. And what did we see? What have we seen in recent months? Eternal criminalization across the country, a lack of adequate funding of the healthcare system. We've had negotiations recently, and what happened? Quebec was asking for $6 billion a year, and we've received barely $1 billion a year. So we need to recognize the work of the people who work in this field, and we also have to somewhat recognize the needs that we have on the ground right now, because they're not doing this. On the one hand, the Liberals have an approach that we may agree with, but that is largely underfunded. So there's an issue there. Another important issue that is related to this, and my colleague mentioned it earlier, when you talk about drug use, you talk about poverty. And who says poverty also has to mention housing issues and the housing crisis. It is serious in this country. We talked about it a million times. I can't imagine the number of times we've had to repeat the same issues over and over again in this House. Yes, I want to talk about the housing crisis because it's something that is at the very heart of this. It's related to what we have before us today. And the other side is denying this. The other night, I was at the Committee of the Whole with the Minister of Housing in front of me. The director and all of the important officials were there from the CMHC, and we saw a pathetic spectacle, a pathetic show. The Minister of Housing is someone who seems very kind, and I don't want to be partisan, but they don't have the guts to face the crisis we're seeing right now. We saw this Monday night. There were very relevant questions that were being asked. And the challenge there, and even they know this, the minister mentioned the issue that we have in this country in terms of housing, 3.5 million housing units that need to be built by 2030. And he even said it himself. It is a challenge. He knows it. And what's happening? According to the National Housing Council, the strategy has led to 15,000 units being built. But we need 3.5 million. 115,000 is nice, but with this approach, according to the National Housing Council, we've lost 150,000 affordable housing units. So we're in the red here. Over the past 5 years, we've spent millions, but we have fewer units on the ground and less access to affordable housing for people, for example, who have drug issues, could receive support and housing. But in Quebec alone, there are challenges. 1.1 million people, and an economist from the CMHC said this, 1.1 million people will have to be housed over the next 10 years. And we have to mobilize everyone here and all levels of government have to build 600,000 units over the next 10 years. That's 60,000 units a year. We're still far from this over the past 5 years. We're still far.
Mr. Speaker, there's all those things. Housing, funding for health. But behind all that, there's a human issue. There are tragedies. There are families losing loved ones. We have to mobilize. But unfortunately, it's not with dogmatic motions like the Conservatives' motion this morning. That's not going to solve the problem.
Kamal Tyre, the honourable member for Avalon.
Thank you, Mr. Speaker. I think that was the easiest name for you to say. It seemed like your tongue was stuck. And Avalon is much easier than some of the other ridings. I want to thank the member for his speech. And I was reminded while he was speaking that a few years back there was an article in the local paper in the St. John's area of Newfoundland, the Telegram, and it was a former school teacher from a school that had lost his job, lost his family, all because of drugs. And the drug of choice at that time was cocaine. And in the article he said, if you use it once, you're addicted because you can't wait to get back to the place where it put you. And I know the member mentioned that we have to do more, and I agree we have to do a lot more. As he said, housing, mental health, addiction services. We have to do more because we just came through a pandemic and still dealing with parts of it. This is going to be a bigger pandemic if we just sit down and do nothing about it.
The honourable member for Longueuil-Saint-Hubert. I guess there was a question in there, in that comment. Well, it's a real crisis. It's a real thing. It's very serious. And for me, it's very personal. I had a very direct experience with this. There's a human cost for families and so on. There's all kinds of things that come along, lying, sons stealing from their own mothers in order to be able to feed their habit, fathers who spend the rent on drugs, families whose fridges are empty because the money's going to drugs instead of to food. These are tragedies, obviously, but I think it's important, and it's important. I'm going to repeat this. The Conservatives have a knack for bringing up important issues, but when it comes to solutions, well, we're all going to have to work together to find them.
Thank you, Mr. Speaker, and I want to thank my colleague for his very sincere speech, because this is about real people. And if I can share with him, in my family, we've struggled with this. But I do want to discuss what he accuses us of is strict dogma. Mr. Speaker, this term, safe supply, was a marketing term by Purdue Pharma in order to get people to feel that these opioids are safe. And in my case, in my family, it wasn't street drugs, it was prescription drugs. And there may be less dangerous ways of managing them, but they're not safe. They're dangerous. They kill people. And a friend of mine who runs a recovery clinic, he said with the liberal approach, he said the challenge is addicts are drowning. And he says when they come in to see me, it's like I pull them out of the water and I say, are you okay? Are you okay? They say, yes, thank you very much. It's great. And then he throws them back in for another day. If you listen to our leader's speech, we were talking about recovery communities. Get them off the opioids, give them hope for the future. Does he agree that the Liberal approach is not working and we have to invest in recovery, in treatment, in order to make a real difference? Because nobody wants to be an addict. No family wants to lose a member because of this addiction. Thank you, Mr. Speaker.
The honourable member for Longueuil-Saint-Hubert. Well, everything needs doing. We need to do all kinds of things. We need to do it all. The current approach is perhaps not yet perfect. It can be perfected, but something needs to be done. We know people can't quit cold turkey. It doesn't happen, especially with hard drugs, with injection drugs. You can't quit cold turkey. You need medical care. You need supports. You need follow-up. You need psychologists, but all that requires investment, healthcare investment. So on the other side, they recognize the crisis, but they're not funding it adequately. They're not funding all the needs in order to implement all those supports. It's not working. Resuming debate.
The honourable member for Courtenay Alberni.
Well, thank you, Mr. Speaker. First, as much as I'm disappointed to see this motion come forward in the manner that it is, I'm also happy to see that we're actually having this conversation and debate today, because there's over 35,000 people, Mr. Speaker, that have died from a toxic drug supply in this country since 2016. Now, I'm going to speak about this motion because it isn't an opioid crisis, as the motion said. These deaths have occurred because of the toxic, unregulated drug supply. And I'm going to speak a couple things about the motion. Number 3, first of all, says since tax-funded drug supply was ramped up in 2020, opioid deaths have gone up, according to the Public Health Agency. Well, yes, of course they have. Between 2016 and 2020, fentanyl became the predominant drug on the market, meaning more people were accessing it instead of pills like OxyContin. Fentanyl analogs like carfentanil and benzodiazepines also appeared in the drug supply at this time. More people have died because the fentanyl supply has become more widely accessible and more volatile. There were less than 1,000 people across Canada, probably more, around 500, Mr. Speaker, accessing safe supply in 2020, with a denominator of tens of thousands of people using fentanyl, probably hundreds of thousands. Now, there were 22,000 people that were dead from an overdose by 2020 under this government. It's impossible that the 500 people or less that were on safe supply, the vast majority of whom are alive in 2023, drove 22,000 deaths. So Conservatives need to learn to do the math, and they need to listen to the experts. In number 4 of the motion, it states in 2020, slightly less than 7,000 people died of opioid overdoses, while only 3,000 died of overdoses in 2016, according to the Library of Parliament. Well, Mr. Speaker, again, you know, they can't back it up in terms of the results of that, these people have died from a toxic drug supply. So, you know, we know that these deaths are occurring, they're not occurring because of the government's safe supply projects or safe injection programs. To assert this is actually disinformation. I'm going to talk about some of the activists that the government has highlighted. They said that, you know, it's activists leading the safe supply charge, Mr. Speaker. We know that chief coroners across the country, chief medical health officers across the country, provincial medical officers like my home province, and police. And I'm going to read a quote again from the Police Chiefs Association, Mr. Speaker, who've made it very clear that they can't police their way out of this, that this is a health issue. And this is a statement from the Canadian Association of Police Chiefs. They cited that diverting people dealing with substance abuse or addiction issues away from the criminal system and towards societal services and healthcare. The association stipulated such change would need to be synchronized nationally, which the government hasn't done. They also cited in their report that they endorsed access to users of a safer supply of pharmaceutical-grade opioids to combat the uncertain composition of illegal street drugs, which is the cause of many opioid overdoses. It further made a recommendation in favor of supervised consumption sites where people could use drugs in a clean, safe environment under the supervision of health professionals trained in emergency intervention. So, Mr. Speaker, the activists are supporting safe supply. And so this is deeply concerning when I see the Conservative leader cite that it's only activists advocating. Also, one thing in his speech that I'd like to correct, he talked about incidents of youth being trafficked at safer supply. Well, today in the Globe and Mail, the Vancouver police were asked about such possible sale of narcotics. And in a recent statement, they cited that there's always a potential for safe supply medication to be sold on the illicit market. However, the force added that they are not aware of any incidents in Vancouver in which safe supply has been trafficked to youth, responding to the Conservative leader and comments he's made here in the House of Commons. But I can assure you, Mr. Speaker, they are certain and they know that youth are being targeted with illegal, unregulated, poison drugs, fentanyl, Mr. Speaker, that isn't regulated. So, this is what we're dealing with. And one more part of the motion, it cites a global news reporter in East Van that was able to buy 26 hits for $30 in just 30 minutes of a dangerous and highly addictive opioid that is distributed in tax-funded drug supply programs and flooding our streets with cheap opioids. Well, you can buy anything on that corner, and you have been able to for decades, Mr. Speaker, for over 50 years. So not great evidence when you go to the most robust drug-selling corner in Canada, and that's what you come back with. The photos of what they purchased, Mr. Speaker, show that most drugs were in a blister pack. That's the plastic sleeve in the photo. A blister pack is issued to one patient. So the global reporter bought most of these 26 pills from just one person, not evidence of wide-scale diversion to buy from one person. So, Mr. Speaker, this motion today, it could have been about calling on the government to create an emergency committee of parliament to deal with a toxic drug crisis that is the leading cause of unnatural death in my home province, more than motor vehicle accidents, more than homicide, Mr. Speaker, more than death by suicide. But they didn't do that. They chose to bring forward this motion, which creates more stigma and more harm, actually, Mr. Speaker. A person who decides to use a single dose of a toxic drug at a weekend party is also vulnerable as any other struggling person with problematic substance use. The result can be the same, a fatal toxic drug overdose. And I know it, Mr. Speaker, in my home community, we've seen lots of people die, lots of young men, because the average age of people that are dying are 44. The majority of them are men, dying at home alone. And I'm going to quote Guy Felicella, a peer clinical supervisor at the BC Centre on Substance Use. He says, quote, "People who aren't ready, able, or interested in addressing their addiction don't deserve to die from the toxic drug supply." I agree. I've risen in the House many occasions on this, as you know very well, Mr. Speaker, in support of a health-based approach to substance use. And I'd like to welcome all members from all sides of this House who are joining our call for increased investment to respond to this crisis and for people that are suffering with substance use disorder. The sooner we can actually come together across political lines to make this happen, the sooner we're going to save lives. This is a national health crisis, Mr. Speaker. We're not acting like that. But we need to understand what we're dealing with when we want to deal with this crisis. It's not an easy, simplistic approach that the Conservatives are bringing forward. This crisis will never end, through just investing in treatment and recovery without recognizing this is a complex emergency. It's multifaceted. It requires harm reduction as well. They go hand in hand. They're not pitted against each other, Mr. Speaker. Now, the government, they want to say that they're doing everything they can, but they've spent, Mr. Speaker, less than 1% on what they spent on the COVID-19 health crisis. This is not responding to a health crisis in the way that needs to happen. We saw how they can respond. SARS, HIV, COVID. They need to do what they did there. They need to pull everyone together. They can't just download and say, well, treatments for the provinces and recovery. Portugal, we saw what they did. They stepped up. They showed us that what courage looks like, what's needed, investments in therapeutic treatment and housing, and ensuring that we're dealing with this issue as a health crisis, not a criminal issue. So it takes a multifaceted approach, Mr. Speaker, and I really am encouraging that today. But we need to do simply more than, that we talked about. We need to listen to experts. It's so important that everybody in this House listens to experts. And I traveled across this country when I was talking about my bill, C-216, which was, just a reflection of the expert task force on substance use, Mr. Speaker. And I was able to meet with people on the front line of this crisis, people who use substances, experts, and the whole time they encouraged us to listen to the report, Mr. Speaker. The chiefs of police of Canada, as I cited, they've come forward with very much in line with what the expert task force had, and they actually had a seat on that task force, which was unanimous, and that we need to stop criminalizing people who use substances. We need to expunge records for people that have been charged with personal possession, that we need to ensure that people have access to a safe supply and treatment on demand. So we meet them where they're at, that we invest in recovery and education and prevention, because we know when people relapse that we need to catch them, but we also need to meet them where they're at through the whole thing. Now, Mr. Speaker, my bill was defeated. As you know, the Conservatives teamed up with the majority of the Liberals, and they voted against my bill, which was supported by the Bloc, the Greens, and the NDP. And I know the Bloc still had some issues with my bill, but they wanted to at least get it to committee and listen to the experts, which both the Conservatives and Liberals wouldn't do, despite the fact this just reflected the government's own expert task force on substance use. So Mom Stop the Harm are coming to the Hill, the anniversary of the bill, which comes up not next week or break week, but when we come back. It'll be June 1st, Mr. Speaker. They're coming here because they're upset, because a year later, not a lot has changed. That bill would have given government 12 months to come back with a strategy on how to respond to the expert task force on substance use. But they voted against it, Mr. Speaker. So I'm hoping that every member in this House will meet the moms. At least do that. And when they go back to their riding, talk to their chief medical health officer. I haven't found one chief medical health officer that doesn't support taking this approach, the multifaceted approach, and supporting safer supply, or a coroner, Mr. Speaker. So, I urge also that the leader of the official opposition meet with the chiefs of police. And hopefully, again, he'll meet with the moms from Mom Stop the Harm. Mr. Speaker, also, I know that the leader of the official opposition has been using global news reports or the National Post or even Conrad Black to get his advice on how to move forward in terms of this toxic drug crisis. But we really need to get back to ensuring that we're listening to the report by the expert task force. And I want to talk about who was on there. There was public health officials, Indigenous health leaders, community health leaders, business, labor, universities, social service agencies. Again, the Canadian Association of Police Chiefs, public policy thinkers, and people with lived and living experience. They were unanimous, Mr. Speaker, in their recommendations. So, I want to give huge credit and thanks to that task force because they put a lot of work in, Mr. Speaker. But they embrace the four-pillar approach, Mr. Speaker. Now, I understand that it takes courage to do this journey. We saw courage in Vancouver under, the former senator, Larry Campbell, who was a police officer, then he was a chief coroner in British Columbia, Mr. Speaker, then he was the mayor of Vancouver. He's the one who brought in Insight and safe consumption sites to save lives. That's the kind of courage we need here today, Mr. Speaker, and from everybody here. Again, we can look at other countries like Portugal. We can look at them for treatment and recovery. We can look at Switzerland, who has a safe supply model. So there is models around the world. And I hope that we can come together today and talk about how we can find a pathway to actually work together. But the stigma that's attached to substances is a huge barrier for people to get help. We know that even today's motion is triggering a lot of people that use substances, that we're looking at safe supply as a pathway out of supporting the unregulated toxic drug supply that's coming from the streets and manufactured, distributed, and marketed by organized crime. So we know we need to go farther. Mr. Speaker, we have to invest in a full spectrum to support people who use substances, and including supervised consumption sites, real-time, on-demand public treatment options, pharmaceutical-grade options and alternatives to illegal street drugs. Ensure people have housing. I was in my good colleague from Malahat Langford Cowichan, and we were at a no-barrier housing place, Mr. Speaker, and it was great to see some of the people there being able to access OAT or safer supply that they couldn't do homeless, Mr. Speaker, when they were living in the bush or wherever they could. So we need to make sure that that's included in it. But when we call for more treatment services, let's recognize that first, we must keep people alive by reducing their exposure to the toxicity of illegal street drugs. My good friend, the member from Vancouver East, represents the downtown east side, a community struggling for survival and ravaged by toxic drug deaths. She once told this House, dead people can't be treated. And how true is that, Mr. Speaker? Now, I just want to also do some fact checking here. First, there's, I'm going to read a quote from Corey Ranger. He's a clinical nurse specialist from AIDS Vancouver Island. He cites First, there is more sensationalist media hit pieces about safe supply than actual safe supply. In BC, well over 100,000 people are at risk of fatal drug poisonings, and less than 5% of those individuals are able to get a safe supply. That's exactly what's happening, Mr. Speaker. This incremental approach by the government is failing people who use substances. So we know incrementalism costs lives in a health crisis, but the Conservatives also misinformation costs lives, Mr. Speaker, and is deadly. So, I do appreciate the Conservatives bringing forward this notion to move this money from harm reduction to treatment. But even that isn't even close to enough money. Thank you, Mr. Speaker. I see I've only got a bit of time left. I want to read a quote from Guy Felicella. He says, I've been I've been to treatment and left treatment over a dozen times and tried to stay sober. If it wasn't for harm reduction services like supervised consumption sites, safer alternatives, naloxone, and clean supplies to protect me and my relapses, I wouldn't be alive today or have the decade of sobriety that I do. Don't listen to people who attempt to misinform you that harm reduction enables drug use. It enables people to stay alive and for many to try to recover again. That's from Guy Felicella, Mr. Speaker. So, I want to make sure that we talk about the importance of trauma-informed treatment and ensure that it's available to people, because I had a constituent that wrote me and said he was going to have to sell his house to keep his son in treatment. $300 a day. That's completely unacceptable. And again, we can look to Portugal that have taken huge steps. In my home community of the Alberni Valley, we had lost 20 people by the 8-month mark last year, Mr. Speaker. Community of 30,000 people. We're 4 times the national average, and this disproportionately impacts Indigenous people. And so, I think you know the numbers. I don't need to get too heavy into that. But I do believe, and I hope that every member of this House will read the expert task force on substance use. And I hope that every one of them will reach out to their community leaders, to their chief medical health officer, to their law enforcement, to the experts in their community, and most importantly, the moms that have lost loved ones in the week ahead. That's something that I certainly will be advocating for. Now, I'm just going to talk a little bit about safe supply and the pilots that have been happening. In Ottawa, it's had a significant increase, and this claim that people don't actually use their safe supply, they just sell it to others. This is a quote from the former Stephen Harper legal advisor, Professor Ben Perrin, that the facts, he states, participants in the Ottawa Safer Supply program reduced their use of illicit fentanyl by 85% while on the program. We've seen great results at Parkdale Queen West in London. Dr. Sereda has been running a really important program. And, we know that safer supply reduces risk of death and overdose, reduces reliance on an unregulated supply of drugs, increases access to engagement with health and social services, improves social well-being and stability, reduces ER visits and hospitalizations, improves physical and mental health, and reduces healthcare costs. That is a fact, Mr. Speaker, and also criminal activity. That's in the facts from these studies, Mr. Speaker. And it certainly helps people gain their life back. And we've heard, some people speak, participants, about what Safe Supply's done. One person wrote, "My whole lifestyle improved. I got my life back. My life has improved drastically. It saved my life. I function productively in society. My life is getting better. Free times to do more constructive things. More energy and confidence to focus on my art. Open a whole new outlook and positive way of thinking." The list is long, Mr. Speaker. But what I do know is that what we're doing isn't working. We're seeing a government take a very, very weak approach in responding to a health crisis, which is, shows the stigma underlying by the lack of investments and the lack of urgency, Mr. Speaker. This is the stigma right there with the government and their failed approach, and also their inability to pull together all parties in this crisis. So one thing I'll understand with the Conservatives and what they're bringing forward is frustration. Canadians are frustrated. They're frustrated by the lack of action by this government to respond to this crisis. But it doesn't mean the response should be guided by misinformation. It doesn't mean we cut off safe supply as a tool to keep people alive, to ensure that people are able to get the help they need and find a pathway to recovery, to treatment. But this motion today to gut the harm reduction program, to stop safe supply in its tracks without proper evidence and science, with going against what the Conservatives deem as the activists, the police, chief medical health officers, coroners, moms, experts, the expert task force on substance use, doesn't make sense, Madam Speaker. I see you've changed. And my time's wound up. But Madam Speaker, I hope this dialogue, I hope this conversation, that we could turn it around and try to come together and find some common ground to deal with this crisis that's right before us, that's impacting everybody here.
Questions and comments. Questions et commentaires, l'honorable député de Sherbrooke.
The honourable member.
For his speech and, of course, for his strong advocacy. In April of this year, the BC Coroner Service affirmed there continues to be no evidence that prescribed safe supply is contributing to illicit drug deaths. In fact, BC's chief coroner said, and I quote, "Safe supply is absolutely not driving this crisis." I'm disappointed at the misinformation and misconceptions the Conservatives are promoting. We know the street drug supply is toxic and poisoned. Recovery is possible, but it looks different for everyone. Can my colleagues speak to that people need to be alive to benefit from treatment?
Courtney Albany.
The choice is this. It's if they can get access to a safer supply, then we have also interaction, opportunity to work with that individual. But if they don't have that option, they're going to the street. That means they're getting their drugs from an unregulated supply, from organized crime, Madam Speaker. So what this motion does today, it actually takes away safe supply and tells people that they're going to go to the street. And the police have said they can't arrest their way out of this problem, that this problem is not going away. We have to listen to the experts. And the chief coroner in BC, she's going to be reporting today, Madam Speaker, and she's saying we need a safe supply program rolled out, not this incremental approach, by the way, Madam Speaker.
Member for Kootenay Columbia.
Thank you, Madam Speaker, and I want to thank the member for his speech. And one thing I do agree with is it's not working what we're doing today. We know that. The ideological approach of the NDP is causing havoc in my communities of Cranbrook and Nelson. And Madam Speaker, I'm just wondering if the member can maybe talk a little bit about why him and the NDP voted against a private member's bill that was going to allow addicts who get convicted of 2 years to go to a facility that deals with addictions rather than to a prison with gangs and organized crime and hardened criminals. Instead, they voted to put that addicted individual in a prison rather than going to a facility that's going to help with addictions. I personally believe, and I know personally from my family, that people who are addicted to opioids can recover and become part of our community. Yet the NDP voted against that. I wonder if they can explain why.
The honourable member for Courtney Albany.
Well, first, I appreciate the question from my colleague, who is a former police officer, who today's motion goes against the Canadian Association of Police Chiefs and their position and many other police forces across this country. But, Madam Speaker, I'll go to the bill that he talked about. The bill, Madam Speaker, was to ensure that people had treatment in prison that were in federal penitentiary serving 2 days plus a day. But Madam Speaker, here's why we voted against it. First of all, it excluded people that have been charged with drug trafficking or violent crime. How many people are in federal penitentiary would that exclude? A lot, Madam Speaker. Secondly, it was not supported by the national organizations that advocate for prisoners and their health in prisons. In fact, they got caught using quotes without approval from some of those stakeholders and organizations. And those organizations raised that back to me, and they told me not to support that bill and not that we shouldn't support anything like that.
Questions et commentaires, l'honorable député de...
The honourable member for Saint-Hyacinthe-Bagotte. Thank you, Madam Speaker. One thing is clear in this debate, is that we need a debate that, yes, is based on emotion to an extent, because, of course, we're talking about people who are living with this reality. But at the same time, we must always also depend on reason, data, statistics, and a true knowledge of what does and doesn't work. And we need to hold that debate in an intelligent way. And I didn't appreciate that earlier when my colleague asked a question, he was told, shame on this member. We're here for a debate. Just because we don't necessarily agree, that does not mean we're somehow feeding the opioid crisis. Earlier, I asked a question about the American model, and there's also the Portuguese model, conversely. We heard about that earlier. I read an excellent study about it, which says that 20 years after decriminalization, we see that the consumption of illicit drugs is below the European average, that opioid use remains high, but that there has been a drastic decrease in overdose mortality. There's also been a strong decrease in viral spread of diseases of infections like HIV. We've seen that thanks to these harm reduction practices, there's been an immediate decrease in the burden on prisons and courts and other benefits. I think that's very clear, and we should be able to learn from that.
So I really appreciate my colleague's comments. First of all, I do agree that we need to have a proper, respectful dialogue. And I just want to backtrack to the question from the Conservative Party. Every person incarcerated deserves health and treatment. Everybody. That is actually the law in this land. It's not being delivered by this government. So that bill is ineffective in what it was asking for. It's actually just an action. And again, they're failing people that aren't incarcerated as well. In terms of what he's saying about safe supply, well, the evidence speaks for itself. And we need to continue to be evidence and science driven in how we design our policies. But the expert task force on substance use, Madam Speaker, they guided my bill, which was voted against by Conservatives in this House. They voted against the government's own expert task force. They don't want to hear from the experts. They call them activists. They call the police chiefs activists, chief coroners activists, public health officers activists, moms who've lost their kids activists. They're not activists, Madam Speaker. Those are people with lived experience and understand this issue and have actually done the work.
Member for Peace River Westwalk.
After 8 years of this Liberal government under Justin Trudeau, we have seen a dramatic increase in opioid deaths.
Use names in the House.
Apologize, Madam Chair. After 8 years of this Liberal government, we have seen a dramatic increase in opioid overdoses across the country. Obviously, whatever they're doing right now is not working. And even in the last 2 years, we've seen dramatic year-over-year increases in overdoses. It is obvious that handing out free drugs to people who are addicted to drugs is not solving the problem. Will the member not agree that this is a failed approach and that we need to return to treatment and to get people off of using drugs? Thank you, Madam Chair.
A member for Courtney Alberni.
Well, this is the false dichotomy, Madam Speaker, that you can't have harm reduction and you have to have treatment. We need both. We need to meet people where they're at. Now, this notion that it's failing, well, it hasn't even got off the ground. It's in its infancy. It's like basically just started, Madam Speaker, and the results and the evidence are staggering, that it's lowering people in criminal activity, less people using the deadly fentanyl, and they're not going to organized crime to get their drugs, which are everywhere in this country. Is this government failing? Yes, but the war on drugs approach that the Conservatives are bringing forward, that is a disaster, Madam Speaker. We know that.
For Cowichan, Malahat, Langford.
Thank you very much, Madam Speaker. You know, when I was listening to the Leader of the Official Opposition give his remarks today, I felt sadness because, you know, I felt it was quite insulting when he uses the terms woke academics or people who are employed in the misery industry. I mean, how insulting to my constituents who have dedicated their life's work to helping people with very real problems. I've taken the time to tour the streets of my community and speak to those people, to meet people who are suffering from trauma. And overwhelmingly, the result is that people who are taking chances with buying their drugs on the street are playing Russian roulette with their lives. And they are not mutually exclusive, having safe supply and treatment options. You have to meet people where they're at, or it's going to be unsuccessful. I just really want my colleague to underline that point, because I think that's central in today's debate. This trauma-informed approach, meeting people where they're at, keeping them alive long enough so that they can come into contact with the services and help and treatment eventually down the line that will actually help them.
Courtney Alberni.
Madam Speaker, and I really appreciate the comment from my colleague. And like I said, he brought me to his riding, and I got to see firsthand some of the really great work that people in his community are doing, especially around no barrier housing, ensuring people have a safe place to live while they're working on getting away from the toxic drug supply, using safe supply or OAT, Madam Speaker. Now, the difference is right now, if they go to the street supply, it's a toxic concoction. They don't even know what they're getting. By using a safer supply of substances, it means they can stay alive, Madam Speaker. We are not seeing people dying from a safer supply. They're dying from fentanyl, Madam Speaker. That's what's happening. So it needs to be evidence-based. The Chief Coroner of BC has said that safe supply is not killing people, that over 87% of people that are dying have fentanyl, made from the street, sold on the street, marketed and manufactured on the street. It's unacceptable, Madam Speaker.
Resuming debate, the honourable member for Edmonton Millwoods.
Thank you, Madam Speaker. And Madam Speaker, I will be splitting my time from the honourable member from Peterborough, Kawartha. Madam Speaker, after 8 years of this Prime Minister, everything feels broken. Life costs more. Work does not pay. Housing costs have doubled. The Prime Minister divides to control people. Worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is it worse than the opioid overdose crisis that has expanded so dramatically in the last several years. Madam Speaker, this is an important debate that we are having today. The opioid addiction crisis, it's real, and it's costing Canadian lives. The unimaginable pain that those that are suffering from addictions are going through, their families, their friends, and their loved ones cannot be understated. And I know that many of us here have probably gone, and I know I have, gone to too many funerals of those that were suffering from this addiction because of this crisis. And many times when we talk about those that are addicted or people who are struggling with addiction, we think about people who might be in downtown, that we see in downtown, or those that might be homeless. And that's true, some of them are. But very often, there are also people that we know, people that we may not have expected, people that might be family members, co-workers, or friends, or neighbors, people that would not expect to be in that situation, but are in this crisis, that are suffering from addiction. And Madam Speaker, we know that there is no simple solution, that the issue here is very complex, and there are many factors that affect it. But what we can see is that the Liberal government approach, that their plan, it's not working. It's not helping those that are struggling to get past their addiction and fully recover. And in fact, Madam Speaker, those Liberal policies have actually made the situation worse. I just want to read from the text of the motion today, that Canada is in the midst of an opioid crisis that has killed over 35,000 people since 2016. 35,000, Madam Speaker. Since 2017, the federal government has spent over $800 million on its failed Canadian drugs and substances strategy, including over $100 million in funding for hard drug supply projects across the country, and plans to spend an additional $74 million to scale up these projects over the next 5 years. Since tax-funded drug supply was ramped up in 2020, opioid deaths have only gone up, according to the Public Health Agency of Canada. In 2020, almost 7,000 people died of opioid overdoses, while only 3,000 had died of the overdoses in 2016, according to the Library of Parliament. In British Columbia alone, yearly drug overdose deaths have increased by 330% between 2015 and 2023. 330%. Recently, a global news reporter in East Vancouver was able to buy 26 hits for $30 in just 30 minutes of a dangerous and highly addictive opioid that is distributed in tax-funded drug supply programs and flooding our streets with cheap opioids. So, Madam Speaker, we have called on the House, on this government, to immediately reverse its deadly policies and redirect all funds from taxpayer-funded hard drug programs to addiction, treatment, and recovery programs. Now, what will Conservatives do? Under a Conservative government, Madam Speaker, we believe that addiction is a health condition and that it should be treated as such. We believe that there should be a recovery-oriented system of care that helps people on their journey. This means prevention, intervention, treatment, and recovery. Madam Speaker, Conservatives believe that you have to meet people where they're at. But that needs to stop. But we need to stop leaving them there. We should be helping them get their life back, get their family back, and help them fully recover. So it's not just that the Liberal program is a failed experiment that they've tried and failed, that has failed in other cities, other parts of the world. The scary part is that their program is actually adding more drugs to the streets and making the drug supply cheaper. So there's more drugs on the streets now, and it's become more affordable for those trying to purchase them. Just want to, Madam Speaker, there's a BC-based physician who says that before safe supply, so before this government's program, 8 milligrams of hydromorphone tablets sold for $10 on Vancouver's downtown east side. Now the doctor says it costs between 50 cents and $1. Dr. Vincent Lamb, the medical director of Coderic's Addiction Therapy, provided insight into the situation in downtown Toronto, so from Vancouver to Toronto. According to his patients, 8 milligrams of the same drug tablets that used to go for $20 on the street now sell for between $2 and $5, and sometimes as little as $1. Doctor in Ottawa said that 24 milligrams of hydromorphone, which they believe came from the city's safe supply facilities, sells for $2 on the street. Before safe supply, before safe supply, they were selling for $20 to $30. And a representative from the Nanaimo network of drug users said that the system is broken and estimated that up to 80% of safer supply drugs in Nanaimo, BC are currently being diverted. So, Madam Speaker, the system definitely is broken. It's not working. What's happening is that those that are struggling with these addictions are selling the drugs that they're receiving from the government. They're selling them because they need stronger drugs. These ones don't work anymore. And they're selling them at such a low cost that even our young Canadians, children, youth, are able to buy them for $1, $2 a hit. And so we are creating a cycle where more and more Canadians are actually getting more addicted rather than breaking that addiction. And Madam Speaker, this crisis has left Canadians struggling right across the country, and it doesn't see background or any religion. I have talked to many parents in South Asian communities who have seen their children go through these addictions, go through the struggle. I visited a Gurdwara in Surrey, where the head of the Gurdwara is saying that they have sent home international students. Now, many, many international students, and we're talking hundreds across the country, they've had to send home their bodies because many of them, with the stresses, the pressures that they face, have come to Canada young. They're young. It's different. There's loneliness. There's pressures on them for financial stress, pressures. And many of them have become addicted on drugs, and many of them have overdosed. And this itself has become a pandemic and a serious crisis in the community itself. And all of this addictions and use of drugs and supply of drugs has also led to more gang activity as well, which has led to more of our young people dying, being killed in gang activity. So, Madam Speaker, Conservatives' common sense plan will end taxpayer dollars for drugs and put people in addiction treatment and recovery programs. Conservatives will bring our loved ones home drug-free. Thank you, Madam Speaker.
Questions and comments. The Honourable Parliamentary Secretary to the Minister of Natural Resources.
I thank the member opposite for his speech. There's a lot of conflating between issues.
Can I ask that the person who is on Zoom without muting, thank you, the Honourable Parliamentary Secretary.
Thank you, Madam Speaker. I was just saying, it seems like there's a conflating of a lot of issues when I hear the member opposite speak. So I was looking at a study from U of T about safe consumption sites, and it says that there was a citywide overdose mortality reduction of 42% between the time when we started, before we had safe consumption sites, and now. And not only that, but in the neighborhoods around a safe consumption site, 500 meters around, the overdose mortality rate decreased by 67%. In the Canadian Medical Journal, there was also a study from London, Ontario, that showed that mortalities decreased with safe supply. So while I'm not denying that there is in fact an opioid crisis and that there are fentanyl deaths, does a member opposite not agree that there is evidence, medical evidence, that it's actually saving lives with safe supply?
The Honourable Member for Edmonton Millwoods.
Mr. Speaker, that is the unfortunate part of this debate, especially with the government, that they have chosen to pick certain facts that they will go on and they ignore other facts. The fact of the matter is, Madam Speaker, that deaths have been going up. Opioid overdoses have gone up. Drugs supplied by this government to those struggling with addiction are now available on the streets, have reduced the cost of drugs so they can be purchased by our young people. That is the reality. That is what's happening across our country, and that is what's making this crisis worse, Madam Speaker. And that is why we were saying that we need to stop the taxpayer-funded drugs and help these Canadians suffering with addictions with treatment.
Questions and comments, the Honourable Member for Drummond. Thank you very much, Madam Speaker. I am hearing what the Conservatives are saying, and as my colleague said earlier, we're talking about a very sensitive and important issue, but they're not bringing effective solutions forward. The Conservatives' approach is very similar to that of the U.S., as we said this morning, and we saw that in the U.S. The results are absolutely not encouraging. On the contrary, deaths because of opioids have skyrocketed since 2015. But the Conservatives' proposal would be to focus more on rehabilitation centers to help drug addicts. We already have them. This is something that is working, but the crisis is still getting worse. Does my colleague not think that it would be exactly the time to focus on new ways of doing things and new approaches to fight drug abuse, like we're seeing elsewhere in the world successfully, unlike the U.S. approach, which conversely is not shown to be efficient at all?
Edmonton Millwoods.
Madam Speaker, it's true that we do have recovery programs in Canada, but the problem is that we need more of them. They need to be more available. When you talk to many parents of those that are suffering from their children are suffering from these addictions, and you talk to them about recovery programs, there's longer wait times. Some of these programs are extremely expensive, and so they're not able to get their children into these programs, their children, family members, or their friends, whoever it may be. So, Madam Speaker, our plan is to stop the taxpayer-funded hard drugs, giving them to those with addictions, and is to put that money, all of that money that this government has been providing to that, and putting it into addiction programs to help those struggling with addictions through treatment, Madam Speaker, and that's what will help Canadians right across the country.
Honourable Member for London Fanshawe.
Madam Speaker, the member across in his speech, he said that Conservatives wanted to meet people where they're at. However, repeatedly, we have said that people need options. Safe supply, treatment, and abstinence programs offer different approaches and services, but it gives people in those situations choices in order to save lives. It's about the choice that they need. Now, supporters of Safe Supply don't think that Safe Supply is a panacea, by all means, to solve all their addiction programs. But again, in this place of privilege in which we sit, it is our obligation to provide choices. So how can he possibly say that he and his party are working to meet people where they're at when they don't provide all the choices that we know consistently with facts and statistics do just that?
The Honourable Member for Edmonton Millwoods, 20 seconds.
Madam Speaker, this is about facts and statistics, and the very, very sad fact is that opioid deaths are going up, especially after this government has started this program of their so-called safe supply. Just in BC alone, Madam Speaker, 330% increase in overdose deaths. Those are the facts. That's why we need to change this system. It is not working. Their plan does not work. We need a better plan. A Conservative plan will focus on treatment and compassionate care. Thank you, Madam Speaker.
Resuming debate, the Honourable Member for Peterborough-Kawartha.
After 8 years of this Prime Minister, everything feels broken. Life costs more, work doesn't pay, housing costs have doubled, the Prime Minister divides to control the people, worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is this worse than the opioid overdose crisis that has expanded so dramatically in the last several years. This is a really tough subject, Madam Speaker, and it is very tough when we are challenging what many people thought they knew. Addiction is a ruthless, cold-blooded thief. It is a vile disease that destroys families and lives. It is a disease that preys on its innocent host in unimaginable ways. Addiction will make the victim say and do anything to anyone in order to eliminate the pain. And that is where we need to focus our efforts, Madam Speaker. And that is what our opposition motion today does. Instead of putting a Band-Aid on the gushing wound, Conservatives are saying, let's treat the trauma, let's destroy the predator, and save the host. Conservatives are calling on the Liberals to redirect their taxpayer money of safe supply into treatment and recovery and bring our loved ones home. Conservatives are asking to understand why, to invest in understanding why, and to fund recovery. Conservatives want to give people suffering with addiction back their life, their family, and their body. I believe Safe Supply is one of the most powerful marketing campaigns ever released. Let's be honest. If someone you loved had a life-threatening disease, you would buy or agree to anything that would keep them alive. You wouldn't ask questions. You would just hear it, that it would keep them alive, and you would sign the dotted line. The idea of Safe Supply has sold a whole culture of people a falsehood, a hope that they will save your loved one. But the reality is, Safe Supply just keeps them where they are. It allows addiction to continue to prey on its innocent host. And honestly, it's a hell of a business model. Why not keep your customer coming back for more? There is a distinct difference between OAT and Safe Supply, and it is critical that everyone watching listens to the difference. Because once they do, I believe they will understand that Conservatives are the only party offering a compassionate solution to the biggest crisis our country has ever suffered. Evidence-based medication refers to opioid agonist therapy, OAT. It includes drugs such as Suboxone, Sublocade, and Methadone. This is different than Canada's Safe Supply, which includes drugs like hydromorphone. Hydromorphone is equivalent to heroin. OAT is a recovery-oriented therapy which addresses the torturous, sometimes deadly withdrawal symptoms that opioid addicts experience when they stop using their drugs. And these symptoms are a major barrier to recovery if left untreated. I highly recommend everyone watch Dope Sick. It is one of the best public education tools out there to understand this. I have many friends who have lived a full life and live a full life in recovery thanks to OAT. With OAT, those in recovery are given long-lasting, milder opioids that stave off withdrawal without providing any high or euphoria, helping patients live free of narcotic impairment. The administration of OAT is tightly controlled. Patients generally must come to a clinic every day for supervised consumption. Take-home use is strictly monitored. In contrast to OAT, safe supply drugs are intended to mimic the highs of illicit substance use, not manage withdrawal. Safer supply doesn't move patients toward a drug-free life. It is, in theory, intended to prevent overdoses and death until one is ready to begin their recovery journey. So many people who are not on board with our solutions will tell you that it is the deadly supply of fentanyl on the streets that is killing the people. And they are absolutely correct. But guess how those dealing with addiction are getting that deadly, toxic dose of fentanyl? Because they are selling their government-funded safe supply. Why are they selling their government-funded safe supply? Because they need a stronger high. Never before have we had such powerful drugs. The physiological dependence on these drugs cannot be understated, Madam Speaker. It turns out that hydromorphone is too weak to get fentanyl users high, and for this reason, many safer supply recipients simply sell or divert their government-provided hydromorphone on the street at rock-bottom prices to purchase more street fentanyl. Safer supply doesn't dissuade illicit fentanyl consumption, it subsidizes it. That is a direct quote from Adam Zivo from the National Post. The type of studies they, safer supply advocates, are doing are the weakest. The bottom line is they're not comparing. That is the unethical part. They're not comparing hydromorphone programs to the standard of care, which is methadone. That would be more ethical. That's Dr. Lori Regenstreif. It's very common for my patients to tell me that they know people who sold most, if not all, of their prescriptions for public supply of addictive drugs. Unfortunately, that means that hydromorphone is going somewhere else. Dr. Vincent Lamb. So how do we prevent overdoses? We must invest in prevention, naloxone, and we must invest in programs that treat the why in addiction. Until the person who is addicted understands why they are using, they will never be free. Until the person has the support they need, they are stuck. Conservatives are asking this House, they are asking and demanding the Liberals redirect funding of safe supply to treatment and recovery. Canada is in the midst of an opioid crisis that has killed over 35,000 people since 2016. And that number doesn't account for the collateral damage that addiction leaves for families. How many kids are traumatized because their parent is stuck in the grips of addiction or has lost a parent, a sister, a mother, a daughter, a brother, an aunt to addiction? Since 2017, the federal government has spent over $800 million on its failed Canadian drugs and substances strategies, including over $100 million in funding for hard drug supply projects across Canada, and plans to spend an additional $74 million to scale up these projects over the next 5 years. Since tax-funded drug supply was ramped up in 2020, opioid deaths have only gone up. According to Public Health Agency of Canada, in 2021, more than 8,000 people died of opioid overdoses, while less than 3,000 died of overdoses in 2016. It is not working. How much time do I have, Madam Speaker? I just can't explain a more horrible disease than addiction. I just can't. There are parents at home right now who are waiting for a phone call because they had a bright, amazing child, and maybe that child got hurt and they got prescribed opioids. Maybe they have trauma and they use drugs to escape the pain, and they're waiting for a phone call that their child has died. Imagine if the Liberals committed to spending $800 million on treatment and recovery instead of drugs that are funding drug dealers. I know this is hard, Madam Speaker. So many people got sold an idea and it was wrong. Again, we see an example of this government spending money in all the wrong places. The path out of addiction takes full commitment, and access to treatment and recovery must be available instantly. Seconds matter, and we need housing away from the life that will not put them back where they were, and we need to invest in prevention. Mentally healthy, resilient kids turn into mentally healthy, resilient adults. Treating the problem with the problem is not a solution. Safe supply is killing our children. The data is in, overdoses are up 300%. Today, the Conservatives are asking the House call on the government to immediately reverse its deadly policies and redirect all funds from taxpayer-funded hard drug programs to addiction, treatment, and recovery programs. Let's be leaders and invest in recovery and treatment, and let's bring everyone's children home safely. Thank you, Madam Speaker.
Questions and comments. The Honourable Parliamentary Secretary to the Minister of Natural Resources.
Thank you, Madam Speaker. And look, I will agree with the member opposite that there is much more beyond prescribed harm reduction to resolve these issues that we're facing with the opioid crisis. But where I disagree is that the British Columbia Coroner's Office specifically stated, and I quote, "There is no indication that prescribed safe supply is contributing to illicit drug deaths." Now that's the coroner, the British Columbia's coroner that said that. So how does a member opposite respond to that fact from what I would think is a respected source?
Member for Peterborough Quarta.
Again, the stats speak for themselves, Madam Speaker, but I really think it's really important. Overdoses are up 300%. That's just the reality of it. I really want to touch on a point that's critical, and that is the fear that has been instilled in experts who are on the ground. And I'm going to read something from somebody who's worked for 3 decades in treatment and recovery. I have to agree with the leader 100%, and this person, for the record, is not a Conservative at all. And this person goes on to say, "But for people speaking out against it, you become vilified, like we don't care about people. Hydromorphone doesn't even come close to the strength of fentanyl. I had one young fellow tell me, if someone dies from an overdose, people are trying to find out who the dealer is so they can purchase from them because of the strength. We are just throwing..."
I have to give the same time for the question and the answer. Questions et commentaires, l'honorable député de Beauport-Limoilou.
The honourable member for Beauport-Limoilou. Thank you, Madam Speaker. I'd like to come back to what my colleague was reading from. I think it's important to have a holistic, comprehensive view of the situation in order to be able to support people with addictions and help them get out of those addictions. And so we need to deal with the black market and dealers and so on. So I'd like my colleague's opinion on the importance of investing in mental health and supports for addicts and investments to fight the black market.
Thank you, Madam Speaker. That is such a great question because it's exactly what we're saying, and that's why we really hope we get the Bloc's support on this. Imagine we redirected the funds that are going into funding drug dealers, because that's ultimately what Safe Supply is doing, and put it into mental health supports. There is a mental health commission report from 2016. Do you know how much has been done on that? Nothing. Nothing. We have people with mental disorders living on the streets. Why? Because we have nothing from this government to help people with mental disorders and addiction. That's the reality. That is what we're asking for today, Madam Speaker.
Yeah. The honourable member for Courtenay Alberni.
What the Conservative motion today would do is everybody would have to go to the street that uses drugs. So they would get unregulated toxic drugs, which are flooding our streets, Madam Speaker. It's not Safe Supply that's killing people. Safe Supply is still in its infancy. Very few people are on it or can even access it, Madam Speaker. Now, again, I want to go back to the OAT and the Safe Supply conversation. I really appreciated her talking about that because OAT is critical, absolutely essential. But people that it's not strong enough, Madam Speaker, they're going to the street to top up. This is where we need to have Safe Supply work with OAT in cohesion. But also, Madam Speaker, this is supported by the police chiefs of Canada. This is supported by Gwen Boniface, the former OPP police chief who's got a bill in the Senate. This is supported by the Vancouver Police who called out the leader of the Conservative Party this morning in the Globe and Mail for misinformation. Why are they railing against the police when they're the tough on crime party?
Member for Peterborough, Kawartha.
I hope my colleague votes in favor of this today because I know how much he cares about this. Dr. Koivu said that several patients, this is a doctor who was a massive advocate for Safe Supply, said that several patients voluntarily left their homes to move into tents located in a parking lot near a pharmacy that dispenses Safer Supply drugs. They wanted to be close to the action, to buy hydromorphone early in the morning when it was the cheapest on the black market for consumption and profitable resale. She is now convinced that Safer Supply exasperates homelessness. If this House, if the NDP and the Liberals care about homelessness, mental health, and helping people, then vote in support of this motion.
Resuming debate, reprise du débat, l'honorable député de London.
The honourable member for London West.
Bonjour, Madame la Présidente.
Good morning, Madam Speaker.
The member from Winnipeg North. Madam Speaker, I'm grateful for this opportunity to speak today to discuss on the ongoing toxic drug and overdose crisis. And while I do that, Madam Speaker, I want to hold thought for the many people who we've lost in London, Ontario, lots of friends, family, to this overdose crisis, which continues to exact a heartbreaking toll on individuals, families, and communities across the country. As the representative for London West, the former municipal representative for the downtown core of London, I've had the opportunity to see firsthand the hard work and dedication that our frontline workers have to put in saving lives and improving the outcome for Londoners experiencing addiction. So I want to take this opportunity to thank them, to thank the Middlesex London Health Unit, the Regional HIV/AIDS, the London Intercommunity Healthcare Centre, and anyone else that has dedicated their time, our volunteers, to helping the most vulnerable people experiencing this disease that has put them through unimaginable situations. This dual pandemic has impacted people from all walks, life, ages, education levels, and party lines, including many of us in the House today. We can no longer say that it's a stranger or that it's happening over there because it's happening in all our communities, Madam Speaker. We're talking about children, our friends, our parents, our neighbors, which is why I cannot understate the importance of a compassionate, collaborative, and integrated response to reducing substance harms and saving lives. Since 2016, Dr. Andrea Sarita of London Intercommunity Health Centre has been running a Safer Supply program that has saved countless lives. And thank God, Madam Speaker, that she's doing this work as a doctor who's experienced, and we're not taking opinions from op-eds or online news. We're actually taking this from studies that have been conducted by experts in the field. The program received federal funding in March of 2020 between April 1st of 2020 and March 31st of 2021. Overdoses in the area dropped from 59% to 23% to 44% of the clients that had not committed a crime to pay for the drugs since the beginning of the program, and 1/3 of the clients stopped using IV drugs. This is only one small piece of the empirical evidence that Safer Supply actually works. Prevention, harm reduction, treatment, and enforcement make up the 4 internationally recognized pillars of drug policy. Sadly, today we hear from the Conservative Party that does not understand the importance of harm reduction pillar, preferring instead to ignore hard evidence and research and take us back to a failed ideology of Harper-era drug policy, which was costly, ineffective, and deadly. And we're hearing from experts themselves, especially in communities like London, Ontario, where we know that Safer Supply is working and that we need to continue to explore all avenues to address this ongoing crisis. Our government, on the other hand, is committed to responding to this crisis, Madam Speaker, from a whole system and evidence-based approach. To date, we've launched many actions and investments to address the overdose crisis, including increased naloxone access, increased options for opioid agonist treatment, supervised consumption sites, which we have in the community of London, Ontario, and safer supply programs whose importance sadly continues to be negated by the opposition. An integral part of our response is ensuring that we have the best research evidence to inform our health policies and practices and ultimately lead to better health and safer outcomes for all Canadians. And this is where the incredible work of the Canadian Institute of Health Research comes in. Over the last 5 years, CIHR has invested more than $179 million in research related to substance use, including $75 million in research related to opioid crisis use alone. And with their help, our government is supporting priority research initiatives that are now helping policymakers and healthcare providers in identifying effective solutions for addressing overdose crises. I want to begin by highlighting a pan-Canadian research network that's focused on substance use, which is the Canadian Research Initiative in Substance Misuse, which connects the researchers, services providers, decision makers, and people that have lived experiences of substance use from across Canada. And CRISM's overall objective is to translate evidence-based interventions for substance use into clinical practice, community-based prevention, harm reduction, and health system changes. So this network is now recognized as a critical network that responds to the policy and evidence needs decision makers. With ongoing support from the federal government, CRISM is able to conduct clinical trials, develop national treatment guidelines, promote the effective implementation of evidence-based interventions into clinical and community settings, and provide key evidence for decision makers like ourselves. In June 2022, our government announced that it would be renewing the CRISM with an investment of $17 million over 6 years to build and expand on the success of the initiative's first phase, including by increasing the number of regional nodes from 4 to 5 in order to enhance geographic coverage, Madam Speaker. This renewed investment also includes $5 million over 4 years for CRISM to undertake a national control trial in the management of methamphetamine use disorder. And the expertise and guidance that CRISM provides is integral to improving the quality of care and the quality of life for people in Canada who use substances. So outside of this investment, in 2019, CIHR also invested $1.5 million to support the evaluation of interventions implemented across Canada in response to this opioid crisis. This included evaluation of overdose prevention sites, rapid access addiction medicine models of care, and naloxone programs, just to name a few. And it also included research to evaluate pharmacological interventions for pain management. Research to address the toxic drug and overdose crisis became even more critical during COVID-19, which exacerbated the existing crisis to devastating extent, Madam Speaker. As part of this pandemic response, we're committed to, our government's committed through CIHR in launching a funding opportunity in 2019 to support the evaluation research into harm reduction approaches and to also address the opioid crisis in the context of COVID-19, because we know that this has grown since COVID-19. So this funding opportunity provided $2.2 million to support 5 research projects to assess the implementation and the impact of safer supply interventions and supervise consumption sites, and thereby addressing pressing evidence needs of decision makers and knowledge users in the area of harm reduction. Additionally, CIHR mobilized CRISM to rapidly develop 6 national guidance documents to support people who use drugs, decision makers, care providers during COVID-19. For example, guidance on telemedicine support for addiction services is one of them. We're also prioritizing bold policy changes to help people who use substance in their journey. Last year, our government announced a time-limited exemption from the Controlled Drugs and Substance Act to the provinces of British Columbia, allowing for the personal possession of small amounts of certain illegal substances. And through this exemption, we will be able to reduce the stigma, the fear, and the shame that keeps people who use drugs silent about their use and using alone, and helping more people access life-saving support and treatment. Life-saving support and treatment, Madam Speaker. Notably, the exemption included requirements related to comprehensive monitoring and evaluation. In addition to efforts led by BC, our government is supporting arm's-length evaluation of this exemption to 5-year evaluation project led by CRSM, and will study the impacts of the exemption and help us understand the full impact of decriminalization in BC, including the health and socioeconomic impacts. So this scientific evidence will be critical to ongoing decision-making as it relates to overdose crisis. And we are also supporting critical research through CIHR's investigator-led programs, which support world-class research submitted by scientists and universities and research institutions across Canada. In addition to supporting the translation of research into improved programs and policies related to substance use, treatment, and prevention, we will also be supporting research focused on improving the health, human resources-related substance use. Another example, CIHR is currently funding a project led by Dr. Kathleen Leslie and Dr. Mary Bartram at Athabasca University that will provide better information about policy options and stakeholder priorities to help create a pan-Canadian mental health and substance use workforce strategy. This is the strategy that will support the development of high-quality, sustainable, diverse, and culturally competent workforce that will have the capacity to provide equitable access to mental health and substance use for all Canadians.
And time is up. Questions and comments. The Honourable Member for Battlefords Lloydminster.
Thank you very much, Madam Speaker. I am disappointed to hear partisan rhetoric coming across the way from that member. When the member for Cumberland-Colchester gave his remarks this morning, he actually has experience as specializing in chronic pain. He's a doctor. He talked about these people struggling with addictions as real people, people who need community, who need connectedness, who need hope. I didn't hear the member talk about wraparound services. I'm just wondering if she sees a value in the importance, like the Conservatives do here, on housing, counseling, even psychotherapy for people that are struggling with addictions. If she can let us know if that is an importance to her, and not just that Conservatives don't care about people, because we do.
For London West.
Madam Speaker, I would like to start by saying that as I stand in this House to speak on behalf of people in London, Ontario, who have lost their lives to this crisis, it's tone deaf for the member opposite to say that we're making this a rhetoric when they are the ones that are making this a very partisan issue when we have people from across the country. This is an issue that has no party lines, Madam Speaker, and they've chosen to make it a partisan issue. Unfortunately for this member, we are here, we're sent here to make sure that the voices of those who can no longer speak on their behalf, we can speak on their behalf, Madam Speaker, and it's important that we continue to talk about how Safe Supply has saved lives in London, Ontario. Thank you, Madam Speaker.
Questions et commentaires. L'honorable député de Longueuil.
The Honourable Member for Longueuil-Saint-Hubert. My colleague quoted 1 million programs to help people, for example, in connection with this issue. But when I tour around Quebec on the housing crisis, post-pandemic, we hear that there's more homelessness than there was before. In Shawinigan, Rimouski, smaller towns north of Joliette, where there's absolutely no services available. It's not Montreal, it's not Toronto. These are small towns, and the problem is visible, not hidden like it might have been before. In small places, there's a real lack of funding for supports, and my colleague knows there's a real housing crisis. So I don't think the Conservatives are actually taking this issue in hand, and they don't have a big Marshall Plan to deal with the housing crisis. The Honourable Member for London West. Thank you, Madam Speaker. I'd like to commend the colleague for mentioning all the work we've been doing all across the country for everyone, including kids with families, people who are suffering through this crisis, but they understand everything we are doing. But I think there's always an opportunity to do more to ensure that in places where the need is still there, we need to keep at it. Now, obviously, I'd like to repeat that we are willing to keep making the investments to help Canadians through these crises.
Thank you, Madam Speaker, and I want to thank the Honourable colleague for her speech. Being from London, I am so incredibly grateful that she talked about the incredible work of Dr. Andrea Serrata. She is doing fantastic and life-saving work in London, Ontario. One of the things that she and I spoke about, she said, harm reduction has to be more about safe supply. It needs to be about the conversations in terms of why people turn to things that dull the pain that they feel. And one of the examples she gave, of course, was housing. So I'd like to hear from this member when her government, the Liberal government, will place a moratorium on the financialization of housing, as New Democrats have been asking for, when their government will directly return back to the original mandate of the CMHC to build and create truly affordable housing as dictated by that 30% of income and rent-based geared to income, and when we can expect the Liberal Party to come out and support my colleague's private member's bill on a guaranteed basic livable income. Thank you, Madam Speaker.
The Honourable Member for London West, 20 seconds.
Madam Speaker, I'm very grateful to get a question from my colleague. And when I talk about how this is an issue that has no party lines, I think my colleague from London, Fanshawe, and I can agree that we've worked together to respond to this crisis when I was a city councillor, even now as a member of parliament. Madam Speaker, not too long ago, my colleague from London, Fanshawe, and I were at a wraparound service housing initiative that was investing from the government. We invested in Indwell just recently. We made an announcement together at Indwell. And this is a show, Madam Speaker, that we continue to care about investing, not just in this crisis, responding to this crisis, but also responding to the entire system, the ecosystem that responds to care for all.
And we have to resume debate. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Madam Speaker. You know, we're hearing a lot about stats. We're hearing a lot about numbers. The one that really sinks in for me personally, Madam Speaker, is the fact that we have seen through safe consumption sites reversed overdoses in the tune of over 45,000. That's since 2017, Madam Speaker. Think of the profound impact that it has had on thousands of lives, Madam Speaker. That's the number that comes to my mind. And that's a very real and tangible number, Madam Speaker. You know, all one needs to do is look in terms of what it is that the people that are surrounding the safe consumption sites have to say. Listen to what the first responders are saying, and the many different experts, Madam Speaker. You know, a number of years ago, when I was sitting in a third-party status, we had this big debate about consumption sites back then. And the reason we were debating it then, Madam Speaker, is because there was a Conservative Party that wanted to shut down Insight, which is a consumption site located in downtown East Vancouver, Madam Speaker. They wanted to shut it down. And if it wasn't for a Supreme Court of Canada decision, they might have been successful at shutting it down, Madam Speaker. But because of the Supreme Court having to give a wake-up call to Stephen Harper, ultimately that site was able to survive. And if you take a look at how that site came into being, Madam Speaker, I think it amplifies or exemplifies why it is that we need to recognize that it is not just one government alone, that it takes a community, it takes individuals, it takes the province, the municipality, the the first responders, all of which came to the table and articulated on a wide spectrum of reasons and rationale as to why consumption sites are important. That happened many, many, many years ago, Madam Speaker. We're talking about 2 decades. And what we have seen is that Stephen Harper attempted to shut it down, well, because Stephen Harper was the Prime Minister when it was attempted and he attempted to shut it down. Madam Speaker, that is...
Remind the honourable members that this is not a conversation. There's a speech and there will be questions and comments. The Honourable Parliamentary Secretary.
And Madam Speaker, the then Prime Minister was unsuccessful. And now we take a look at the current leader of the Conservative Party. And I've argued in the past that this party is more to the right. This is about as extreme as you can get in terms of the right wing, Madam Speaker. You listen to some of the things that they say. You know, just yesterday they were being accused of misrepresentation of facts, Madam Speaker. Once again, what we see is opposition parties outside of the Conservatives and the government correcting the opposition. This is, you know, the previous question to my colleague was, well, we're politicizing it. Really? Read the motion. Read the motion, Madam Speaker. Listen to what some of these speeches are. You've had now several Conservatives stand up, and what are they saying? They're following the lead of the leader, Madam Speaker. And I actually printed what it is that the leader said. Here's how the leader started off his comments in moving the motion. After 8 years of the Prime Minister, everything feels broken. Life costs more, work doesn't pay, housing costs have doubled. The Prime Minister's divides to control the people. Other members, Madam Speaker, have stood up and said the same thing. And that's right, like a bunch of lemmings and seals, they follow suit and support whatever it is the Conservative leader says. Facts don't mean anything. Madam Speaker, yes, that is true. Madam Speaker, at the end of the day, recognizing the impact that this is having in our communities, you know, even without the provincial government, the federal government actually went with and worked with Sunshine House in Manitoba so we would have a mobile overdose prevention unit, Madam Speaker, for the city of Winnipeg. You know, I could talk about areas in Winnipeg North like Point Douglas or some other areas in North Winnipeg where there is a need that's there. It's real. It's tangible. We talked about the impact that it has on real people. And the Conservatives want to throw all of it away, even though they know full well that it has been successful in saving lives, Madam Speaker. And they try to tie in other things to it in order to try to complicate and simplify in one way and make it complicated in another way, Madam Speaker. For the bumper stickers. That's where their concern is. You know, it's interesting. A couple of quotes. And these quotes aren't from me, Madam Speaker, obviously. They're actually from Ben Perrin. Now, many of the current group of Conservatives might not know who Ben Perrin is. You can do a quick Google search if you want to confirm it. You'll find he was a senior, Madam Speaker, he was a senior policy advisor to the Prime Minister's office when Stephen Harper was the Prime Minister. He dealt with issues like public safety, immigration, justice. Those are the type of issues that he dealt. He was the primary advisor for Stephen Harper. What does he have to say about the Conservative Party today? Ben Perrin has said that the approach of the leader of the opposition is rehashing Conservative war on drugs, tropes that have been long since discredited and have been found to be not only ineffective, but costly and deadly. He has also stated that there is no indication that prescribed safe supply is contributing to illicit drug deaths. Madam Speaker, this is someone that advised, a senior policy advisor to Stephen Harper. You gotta love this one. This one was in the Hill Times, again from Ben Perrin. No public figure should use real human misery as a backdrop for a political pitch. If he insisted on doing so, how much better it would have been if he had stayed a night in the tent city and talked to people who live there. That way, he could have told them how he would improve their lives and perhaps gain a better understanding of their problems. Using them as props to peddle his snake oil was disgraceful. Madam Speaker, that's from Ben Perrin, a significant policy advisor under Stephen Harper. Madam Speaker, so you've got things like the Supreme Court of Canada. You have even top conservatives, advisors, real people. You have law agencies. You have other jurisdictions, like levels of government, the province of BC. Do they not understand everything that's gone into place in order to make those consumption sites a reality? It's not just the federal government says, well, we're going to pop one here, there, and there, and there. There's a great deal of effort, Madam Speaker, that's put into these sites that are actually located in different places in Canada, Madam Speaker. And let there be no doubt, as I started off my comments, 45,000 plus, Madam Speaker, where we have actually seen a reverse. Someone's literally dying, and because of getting the medical attention, Madam Speaker, they were able to reverse that overdose, saving thousands of lives. And the Conservative Party wants to say, let's get rid of them. That's what they are saying today, Madam Speaker. And then they try to say, well, there's other aspects that we want to invest in. Well, the government is already investing in those. The Government of Canada is working with provinces, municipalities, and other stakeholders to ensure that as much as possible, there's a coordinated approach at dealing with these very serious issues, Madam Speaker. I only wish I had enough time to be able to talk about the impact, whether it's the individual that's addicted, to the family members, to the communities, to the many different systems. This is very much a health issue, Madam Speaker, and needs to be treated as that, and individuals need to be supported. And this government, with at least cooperation of some of the opposition parties, will be able to continue to move in that direction. Thank you.
Questions and comments. The Honourable Member for Caribou Prince George.
Thank you, Madam Speaker. Madam Speaker, I listened to this debate intently for the last couple of hours, and this is controlled frustration, anger, seething. Madam Speaker, I've been very vocal, very upfront about how this crisis has impacted my family personally. Lost a brother-in-law. My brother's on the street, gripped with addictions. Madam Speaker, the Liberal Party's talking points today is that their program has saved 45,000 people. Madam Speaker, safe consumption sites and safe supply are two different things. There are many tools in the toolbox. Of those 45,000 deaths that are overdoses that the people were brought back, how many people are still alive today? Because the first responders that I'm meeting with, Madam Speaker, are saying they will save somebody in the morning. And then a few hours later, that very same person is overdosing again. So, Madam Speaker, those numbers are false because it does not take into account if those people are still alive. What we're saying today is that we have to do more to save these people. Safe supply is one tool in the toolbox, but it's not working. You can't do one or prescribe one without the whole toolbox, Madam Speaker.
The Honourable Parliamentary Secretary.
Madam Speaker, the member is looking for a hard, fast number. What I know and I feel very confident is that thousands of lives have in fact been saved, not just for a 24-hour period of time. And what we hear from the Conservatives is that those lives don't matter. Yes, that's what you're saying. You're saying shut down the consumption site.
Order. invite the Honourable Parliamentary Secretary to be a little moderate with accusations.
Speaker, I'll tell you what, if they're all that offended, stand up and say that they will support the consumption sites. If you're not prepared to say that, then bite your words, bite your tongue.
Prise du débat. Alors, questions et commentaires, questions and comments. Questions et commentaires, l'honorable député d'Abitibi.
The Honourable Member for Abitibi, Bay James, Nunavik.
Merci, Madame la Présidente.
Thank you, Madam Speaker. This motion is not for further safe supply. What we've heard this morning with all of the eloquent speeches and some speeches that may not have been as important, I think the clear thing that we see is that we need the health transfers. Recently, the Quebec Psychologists Coalition said that it is impossible to meet mental health needs. People who are facing addictions issues need support and adequate services. How will the government commit to transferring the appropriate amount of money to the provinces?
Yes, Madam Speaker, and that's one of the reasons why I say a part of this is recognizing that it's just not the federal government alone. And that's what I like about the Insight. With Insight, what you saw was the province of British Columbia, the city of Vancouver, and Ottawa working with the many different stakeholders and making sure that we'd be able to have a successful consumption site, and it has been exceptionally successful over the last couple of decades. There needs to go beyond that, because we can talk about health treatment, and that's why you've seen a national government invest in mental health, give generational support, somewhere close to $200 billion over the next 10 years, so that we will be able to have a quality healthcare system. It is very much a healthcare issue. We have a national government that's investing billions of dollars into housing and supporting provinces in being able to provide appropriate housing. There's all sorts of...
Have to have one more question. The Honourable Member for Couch and Malahat-Lake first.
Thank you, Madam Speaker. Where I disagree with the Conservatives on this issue is I personally believe, and backed up by evidence in the field, is that safe supply, safe consumption have to work in conjunction with treatment and recovery programs. They are part of a continuum of care. We have to meet patients with where they're at. Where I do agree with the Conservatives, though, is with their sense of frustration. That is very real. The situation is not getting better. The numbers on the ground are a stark reminder of how this government has failed to step up to the plate. Numerous people who are working on the streets trying to combat this situation have repeatedly asked the government to step up, commit the funding, commit the resources necessary to fight this epidemic on par with COVID-19 and with the AIDS crisis. So that is the criticism that is being leveled to the government today. Why have they not stepped up and at the very least declared this a national health emergency?
Honourable Parliamentary Secretary, 20 seconds.
Yes, Madam Speaker, the government has stepped up in working with the different stakeholders. We deal with prevention, enforcement, treatment, and harm reduction, Madam Speaker, and we're working best we can, not only from a financial point of view, but also from a legislative point of view, in order to save lives and do the right thing. And I'm still await for one Conservative to stand up and say that they actually support consumption sites. Thank you, Madam Speaker.
Debate, the Honourable Member for Kelowna Lake Country.
Madam Speaker, I'll be splitting my time with the member from Caribou, Prince George. Madam Speaker, today I stand before you to express my deep concerns about Canada's mental health and addiction crisis. After 8 years of the Prime Minister, everything feels broken. Life costs more, work does not pay, housing costs have doubled, the Prime Minister divides to control the people, and worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is it worse than the opioid overdose crisis that has expanded so dramatically in the last several years. Many Canadians continue to be repeatedly traumatized by this Liberal government and their failed policies. As a result, we're dealing with a mental health and addiction crisis. Canadians struggling with addiction deserve compassion, with access to appropriate treatments and a plan to recovery. Addiction is a public health issue, and Canada's drug laws must target individuals who prey on Canadians struggling with addictions, more specifically those who engage in trafficking and the sale of illegal drugs. My Conservative colleagues and I oppose removing deterrence measures for those who exploit Canadians struggling with addiction. Expanding access to treatments and recovery programs should be a health care priority to get help to people struggling with addiction. Madam Speaker, while the Liberals continue to push their own narrative, there isn't even one real definition of safe supply. And how are dangerous, toxic drugs safe? The safe supply is continuing to destroy lives. It has led to more addiction, more deaths, and more despair. We believe that we must stop taxpayer-funded hard drugs and fund treatments and recovery and bring home our people drug-free. Liberals' safe supply policies do nothing to bridge people towards recovery. Instead, people are being trapped in a cycle of addiction. In March of 2020, an article titled, "Is All Safe Supply Safe?" was published by the Canadian Society of Addiction Medicine. The Liberal NDP coalition has given up on Canadians struggling with addiction and has essentially put them straight into palliative care. The greater societal cost is playing out with this experiment in British Columbia. The Minister of Mental Health and Addiction referred in this place to following proper indicators without saying what those are. I'm not sure what those indicators are, because according to the Public Health Agency of Canada, since tax-funded drug supply was ramped up in 2020, opioid deaths have only gone up, according to the Public Health Agency of Canada. In 2021, more than 8,000 people died of opioid overdoses, while less than 3,000 died of overdoses in 2016. In British Columbia alone, yearly drug overdose deaths have increased by 330% between 2015 and 2023. In addition, just ahead of the 7th anniversary of British Columbia declaring a public health emergency, BC Emergency Health Services released grim statistics last month. BC set records in March, 2 months ago, for the most overdose calls in one day, the highest 30-day average of overdose calls, and the most consecutive days where paramedics attended 100 or more poisonings. Our first responders are overburdened and exhausted. This is with drug decriminalization and so-called safe supply in place. BC is apparently also on pace to set a new record for poisoning calls in a year and match its annual record for the most naloxone doses administered to reverse the effects of opioids. Those are the facts. Recently, a Global News reporter in East Vancouver was able to buy 26 hits for $30 in just 30 minutes of a dangerous and highly addictive opioid that is distributed in tax-funded drug supply programs and flooding our streets with cheap opioids. A new black market has been created, and this is perpetuating the cycle of addiction. It's been reported that physicians are saying this is even leading to a rise in new addictions, particularly among youth and those recovering from addictions. Those are the facts. These are the results of the Liberal drug policies. These are more lives lost. Our streets are less safe, and people are dying. The other day here in the House of Commons, I was appalled by the shouting and applause that the Liberal and NDP MP showed as I mentioned the terrible effects of open drug use in parks and playgrounds, which they support. I had to start my question 3 times because of the disruption. These are policies which harm children's safety as people are getting high and leaving syringes and other drug paraphernalia in playgrounds. Open drug use in parks and playgrounds where children play is unacceptable, and is evident that this federal Liberal government is not taking public safety seriously. Mr. Speaker, or Madam Speaker, on this side of the House, we do take this issue very seriously. We recognize the need to approach these issues with compassion. That is why we will continue to advocate for stopping the flood of dangerous drugs on our streets and also advocate for recovery, treatment, and rehabilitation. This is some of what my private member's bill, Bill C-283, the End the Revolving Door Act, sought to do. It sought to create a common-sense framework for the Commissioner of Correctional Service of Canada to be able to designate all or part of a federal correctional facility as an addiction treatment facility. If individuals met certain parameters at the time of sentencing, a judge could offer the choice to be sentenced to participate in a mental health assessment and an addictions treatment inside a federal penitentiary while they served out their sentence. Bill C-283 was in line with the House of Commons' support of Bill C-228 in the previous Parliament to establish a federal framework to reduce recidivism where healing is the best path forward, reducing recidivism in Canada. I received much positive feedback and support on this bill from across the country, from business groups, those working in criminal justice, and from those who work in recovery, like the founder of Freedom's Door. And I also received unanimous support through a resolution in the City of Kelowna. This common sense legislation was voted down by the Liberal and NDP members. They are not focusing on recovery and treatment and are quite fine with the status quo. After 8 years of Liberal incompetence, Canadians are suffering. And I hear from parents in my riding all the time who want their child to access support and rehabilitation. It is heartbreaking that this government has given up on some of the most vulnerable in our society and putting them straight into what you could consider perpetual addiction and palliative care. In BC, it's unbelievable that due to how open drug use is now rampant and playing out in our communities, that we even need to have a conversation that open drug use should be banned from playgrounds and parks. These drug decriminalization policies have affected neighbourhoods in BC as this 3-year drug decriminalization experiment is playing out. Municipal governments across BC have been forced to look at how to make their communities more safe for their citizens, and in particular in parks and playgrounds. Municipalities who have either already implemented bylaws, were looking at bylaws and or have advocated to the provincial government include Kamloops, Kelowna, Sicamous, Campbell River, Nanaimo, Maple Ridge, Prince George, and there may be others. However, this is not just at the human level that the Liberals refuse to show compassion. The Prime Minister refuses to stand up to the greedy pharmaceutical companies who cynically marketed addictive drugs as pain medication. And that is why we in the official opposition are committed to bringing home justice for the victims of addiction. Our Conservative leader announced months ago a commitment to launching a massive federal lawsuit against Big Pharma and their consultants and joining the Active BC lawsuit to cover the costs of the epidemic to our border security. Courts, the criminal justice system, Indigenous programs, lost federal tax revenue, and massively expanded treatment programs. The intention with this is that the money recovered from this massive lawsuit will fund treatment and recovery programs for people struggling with addiction. It's from Big Pharma that originally Safe Supply came from. Conservatives are focused on turning hurt into hope by presenting common sense solutions to address the addictions crisis facing our communities and the revolving door in our justice system. While the Liberal NDP group has turned its back on society's most vulnerable, Conservatives will continue to advocate for support, compassion, and rehabilitation so we can bring home our family members and bring them back against this horrible addiction crisis, which the Liberals have fueled by their failed policies. Thank you very much, Madam Speaker.
Questions and comments? The Honourable Parliamentary Secretary to the Minister of Natural Resources.
Thank you, Madam Speaker. And one of the pieces that I've been having trouble with in the debate today is that there are certain elements of an entire spectrum of care that's required for the opioid crisis that's being pulled out as if it's the only one that's being proposed by the government, which is not true. But also, what I'm curious about, because the experience in my community seems to be very different from what I'm hearing from the members opposite. So in 2022 in Toronto, 1,900 overdoses were reversed because of safe consumption sites. They actually saved the lives of almost 2,000 people in my home city, and I have a safe consumption site in my own community. I can tell you that our experience with it is that, in fact, it's provided a place of safety to people in need, and we are not seeing the same impacts that are being described. So does a member opposite not see any value in saving lives, as I've said in Toronto, are being saved, and in making sure that we provide an entire continuum of services?
For Kelowna Lake Country.
Thank you, Madam Speaker, and I thank the member for her question. What we're talking about here today is safe supply. And what we have seen happen for those of us that are in British Columbia, as I spoke about in my intervention, is what we are seeing playing out in our streets between safe supply and also then tying in the decriminalization. So what we're seeing, as I mentioned, is we have mayors from all over the province having to come forth to put together bylaws in order to attempt to make their cities less or more safe, because people are afraid to take their kids to parks and playgrounds. That's what's actually playing out on the streets. And as I was mentioning, we're seeing with this safe supply that people are taking that safe supply, they're selling them out on the streets, and it's creating this whole black market where therefore then people are taking that money and then buying more dangerous drugs. They're buying fentanyl. It is perpetuating a more difficult situation, and the numbers are increasing. The facts are what they are.
Questions et commentaires, l'honorable.
Questions and comments, the honourable member for Timiskaming. Thank you, Madam Speaker. I'd like to take a moment to underscore the presence of students from Rivière-des-Quinze School. They have come from Timiskaming, and we cannot draw the attention to people in the chamber. My apologies. Perfect. Thank you, Madam Speaker. I couldn't imagine that of presence such as the mayor who have come here to learn. Nevertheless, in a context such as the opioid crisis, I have the opportunity to have a conversation with these students, and we were wondering, I'd like to ask my colleague, I was with at the caucus yesterday. I know there are many issues that affect the development of issues. There are many issues involved, such as housing and development. If we could offer housing, could we better have an impact on the opioid crisis? I'd like to hear what my colleague has to say about that.
Thank you, Madam Speaker, and I thank my colleague for his question. As I mentioned at the very onset of my speech, that people are in a real desperate space. And it is leading to this addiction crisis and mental health crisis that we're having in the country. People can't afford to live. They can't afford to feed themselves. They can't afford medicines. And the price of everything goes up. We've got inflation that is affecting people's everyday lives. I mean, I hear about it in my riding where people can't even afford their rent and their mortgages. Everything has doubled. Rents have doubled, mortgages have doubled. People are getting into a very desperate space. And this is fueling the addiction and mental health crisis. So we need to deal with the economic side while we're also dealing with this very serious addiction issue as well.
Questions and comments. The honourable member for Nunavut.
From my understanding, there are medical practitioners, the Canadian chiefs of police, and other experts that support safe supply. And I wonder if the member can explain in this House who it is that the Conservatives are hearing from that don't support safe supply, which we know is a vitally important life-saving service for Canadians.
The honourable member for Kelowna Lake Country.
Well, thank you, Madam Speaker. And I've got people reaching out to me all the time that are boots on the ground that are seeing the results of this, where they're reviving people that are taking safe supply over and over and over again. And there's lots written on this. I know that people can be sort of selective in what they're reading, but I mentioned one of the articles about safe supply in my intervention. There's many articles about this. I mean, I have... My time is up, but there's a lot of...
Oh, not only the time is up, but we cannot use props. Resuming debate, the honourable member for Caribou Prince George.
Thank you, Madam Speaker. Madam Speaker, I have to take a breath and calm down a bit. I think this debate is one that is it's a powder keg. It is. There are people on all sides of this House that have incredible feelings towards it. Our colleague from the bloc, from Beauport, Limoilou, that spoke so passionately about this. Our colleague from Saskatchewan that spoke so passionately about my colleague from Kelowna Lake Country that spoke so passionately about this. We all know someone perhaps very close to us that has been impacted by this. What is very clear, Madam Speaker, is what is taking place today is not working. It's broken. After 8 years of trial and error, the records show that this government has broken the system. Well, that shouldn't surprise us. Everything this Prime Minister touches, he breaks. And what he does, Madam Speaker, is he divides Canadians. Why does he divide Canadians on issues, whether it's vaccine, whether it's the opioid crisis, other things? Why does he do that? Because if we're fighting amongst each other, we're not focused on his blunders. Dodge and deflect, Madam Speaker. Here's the facts. Since 2016, over 35,000 Canadians have lost their lives because of the opioid crisis. And in a crisis of incomprehensible scale, the death toll due to illicit drug overdoses rose 300% in my province of British Columbia during the first 3 months of 2023. That's 596 lives lost in just 3 months of this year, Madam Speaker. 596 sons, daughters, mothers, fathers, sisters, brothers, dreams, hopes lost. And we as parliamentarians have failed them. Canadians are suffering. Canadians are dying. And we've done nothing. What is the real issue that we're talking about today? It's the opioid crisis, the fentanyl crisis. This drug is seemingly floods through our borders, and we're powerless to stop it. I've stood in this House so many times, Madam Speaker, over the last 7.5 years to talk about the opioid crisis, a crisis that at least this side of the House, all across the way, can agree on. It is a national crisis, but this government fails to declare it so. Why are we so angry, Madam Speaker, and frustrated? Because they like to conflate things. We're talking about safe supply. What are they talking about? Supervised consumption sites. Madam Speaker, it is so frustrating. They make promises in the mental health side of things. Before getting elected in 2021, they're going to pledge $4.6 billion of mental health transfer to provinces to help combat mental health and addictions. What happens when they get into government? Well, they renege on that, Madam Speaker. They rethink their promise. This is impacting real people, Madam Speaker. In a period of great economic uncertainty, this Prime Minister is spending hundreds and hundreds of millions of dollars giving out free drugs. Since 2017, the federal government has spent over $800 million on its failed Canadian drugs and substances strategy, including $100 million in funding for hard drug supply projects across Canada, an additional $74 million to scale up these projects over the next 5 years. Mr. Speaker, that's nearly $1 billion spent on this pilot project. But what has this emphasis on safe supply achieved? There are 20 opioid deaths in Canada a day, a 173% increase from where the opioid epidemic began in 2016. But where is the investment on recovery? The Minister of Mental Health and Addictions has placed that financial burden purely on the provinces and territories. What she said earlier today in her speech, we hope that the provinces will see their way to support the recovery and create those beds, Madam Speaker. We hope. There are no new treatment centers or beds. Well, an addict is waiting, or somebody that is addicted to drugs that is waiting for recovery up to a year or more, they can go to a vending unit and get the drugs that they want, Madam Speaker, a vending unit. Now, let's talk about vending units for a second. During the gun debate, the Liberals will have you believe that the Conservatives, through the Conservatives' reckless gun laws and policy that you can go to a vending unit and get guns and you can get ammo, Madam Speaker. That's pretty simple terms. That's exactly what this Prime Minister tells Canadians and tells the world. But in actual fact, they have created a system where pop-up booths in my province selling crack, selling cocaine, selling drugs on the street are taking place. Health Canada approved an organization to produce and distribute cocaine. That is true, Madam Speaker. Not only that vending units are popping up all across our province where people that are struggling with addictions can go plunk in their coins and get drugs. But wait, Madam Speaker, the drugs that they're getting aren't strong enough for them, so they peel off the labels and they're selling them so that they can get the money and the dollars so that they can get the harder drugs that they want. Fentanyl. Fentanyl is 50 to 100 times stronger than morphine, Madam Speaker. A grain of sand, a dose the size of a grain of sand can kill 1,000 people. And it's flooding our streets, and it's killing our sons, our daughters, our fathers, our mothers. And we're doing nothing about it. Why are we frustrated? I heard the Bloc say that dogmatic approach and comments like that. This is a nonpartisan issue for me, Madam Speaker, but I get frustrated when all we do is we stand up here, we pour our hearts out. We want to do better for Canadians. The legacy, I've talked about our legacy in mental health and addictions time and again in this House. What do you want your legacy to be, Madam Speaker, when you leave this House? I know what I want my legacy to be, is that I've made a difference each and every day in the mental health and well-being of Canadians. That I've used my time here so that we can save lives, Madam Speaker. I believe hope is always possible. I believe recovery is possible. I don't believe in giving up on someone by just handing them another drug. The Liberals are saying, aren't we keeping them alive? We're perpetuating their addiction. My brother shot twice in June of 2021 with a shotgun. You would think that that would keep him, that would knock him straight, Madam Speaker. But that addiction is so strong. 2 days later, he was back on the streets. My brother-in-law killed with an overdose. A player I coached, Chad Staley, from the Prince George Spruce Kings, got his tooth knocked out in a hockey game. One of his players, his co-players, thought he was giving him oxycodone to help with the pain. Chad was at home with his family, took this pill, and was dead within an hour. That is why we're angry. And we're doing nothing, Madam Speaker. We will bring hope to these families. We will bring our families home safe, sound, and healthy. Thank you.
Questions and comments? L'honorable député de Longueuil-Saint-Hubert.
The honourable member for Longueuil-Saint-Hubert. Oh, is it me? Okay, thank you. Thank you, Madam Speaker, and I'd like to thank my colleague for his speech. It's a bit strange because at one point he said it's a non-partisan issue, but then he spent 10 minutes criticizing all the other parties. So that's a bit partisan. But we think it's mostly a public health crisis, so mental health and addiction, so it's health. So whenever you talk about health, you have to talk about funding for health. The federal government doesn't pay any doctors, it doesn't run any hospitals, but they do have the means to finance the healthcare system, to fund the provinces. I don't hear too much from the Conservatives on funding and on the province's demands for health transfers. I'd like to hear what my colleague has to say about those issues. The Honourable member.
Only had selective hearing. I talked about this being nonpartisan, and then I took offense to the dogmatic comments that we heard from the bloc. And I did, Madam Speaker, talk about the promises from this government prior to the election for the $4.6 billion healthcare or mental health funding transfer that they forgot about once they became government, Madam Speaker. This is about doing the right thing for Canadians, and the right thing, and I've said this so many times, there's so many tools in the toolbox, but it doesn't work if you just do one part of it, Madam Speaker. And providing and perpetuating addictions is not helping without any avenue for recovery. There has to always be that roadway or avenue for recovery, and we're not seeing it. The jurisdictions that people talk about, Portland, Seattle, Portugal. Well, Portugal didn't have a fentanyl crisis or an opioid crisis when they launched their decriminalization. And Portland and Seattle are failing because they did exactly what Canada did. They did nothing. They put no services in place for recovery. And that's the honest-to-goodness truth.
Comments. The Honourable Minister for Mental Health and Addictions.
Thank you, Madam Speaker, and I thank the member, as always, for his very poignant explanation of the importance of this mental health crisis to Canada. I think that there's no disagreement that there needs to be the four pillars of a drug policy, including treatment. I was wondering if the member would help us as we develop the bilateral agreements with the provinces and territories on the $25 billion that will be there for that third pillar on mental health and substance use. Other than just wait times and unmet mental health needs, are there other indicators that the member would think would be helpful, like treatment beds or adequate aftercare, the kinds of complex care where we know that people who have serious mental illness and substance use, what would be some of the indicators you think that we should be in the action plan of the provinces and territories so we can work through all orders of government to address this crisis?
Member for Caribou Prince George.
Our honourable colleague talks about indicators. Well, indicators, there's two different things. Indicators are what's working, what's not working. But measures that we can take that will help, well, let's put dollars and cents into recovery, making sure those beds are available when they need it, wherever they need it, Madam Speaker. Let's make sure that we have trained professionals that are there at all times, whether it's the first point of contact with our primary care physicians, to make sure that they have a team approach. So if somebody is facing a mental health issue, whether it is suicide prevention or a mental illness issue or addictions issue, well, they've got somebody right there that our primary care physicians are not getting burnt out right away. We have a team approach. She knows this. We've talked about this specifically, but where I have issues, Madam Speaker, and again, my honourable colleague knows this because we have great discussions on this, I differ with her because I think that we should be spending more money on recovery rather than just safe supply, diverting. Perpetuating addiction does nothing, Madam Speaker. It may keep somebody alive today, but what about the next day? And what about the next day? And what about the next day? Madam Speaker, we have to get these people into recovery.
Very brief question from the Honourable Member for Nunavut.
And I'd like to thank the member for his thoughtful intervention. I always find that he cares genuinely, and I always appreciate his interventions. I think one of the areas that I wonder if he agrees on is that we need to do better services for Indigenous peoples. I think that Indigenous peoples are overrepresented in the opioid crisis, and I wonder if the member agrees that we need to have better healing programs, better reconciliation programs, so that we're helping to uplift Indigenous people so that they're not entering this crisis too much.
A brief answer from the Honourable Member for Caribou Prince.
Thank you, Madam Speaker. And the feelings are likewise. I truly appreciate when the member from Nunavut stands up and represents her community. Madam Speaker, in our previous election, our platform talked about culturally based treatment programs, working within our Indigenous communities, funding beds and treatment centres within these that were culturally related, and working with our Indigenous leaders and elders to make sure that we are doing this where it's needed and helping those who are less fortunate. Thank you.
Debate, the honourable member for Yukon.
Thank you, Madam Speaker. And I'm splitting my time with the member from Richmond Centre, and I'm pleased to speak in the House once again on the opioid epidemic in Canada, an issue that's long been close to me personally, as both as a Northern public health physician and as Yukon's former Chief Medical Officer of Health. And I always appreciate the opportunity to bring the issue to Parliament, so I appreciate the efforts of the official opposition to bring this, although I can't agree with the motion itself at hand. It's blatantly ignoring the recommendations made by health and social service professionals, law enforcement leaders, and both national and international best practices. Now, I know how busy the Honourable Leader of the Opposition has been of late, and perhaps the Honourable Leader has not found the time in his schedule to review the most up-to-date data on best practices to respond to the opioid crisis. And we know he's had trouble with scheduling of late. But I am happy to take some time to give him a bit more information on the subject matter. Let's start with the beginning of this motion. Yes, Canada, we are in the midst of a devastating toxic drug crisis, and one that hits my territory of the Yukon particularly hard. In the Yukon, we're struggling with the highest per capita rate of toxic drug-related deaths in Canada. And while the loss of any life is keenly felt around them in smaller and remote communities, when not only one person, but sometimes two or more are succumbing at once, it hits all of us in a way that's difficult to describe. Yukon's chief coroner reported 25 deaths last year attributed to toxic substances per capita, worse than BC, and about 2/3 identified as First Nations, so greatly overrepresented in these tragic figures. Our government did introduce the substance use and addiction strategy in 2017, and we've invested heavily in it, including in harm reduction, which was excluded in the drug strategy of the previous Conservative government in which the honourable member served as a minister. So the approach our government has taken to the crisis is much more comprehensive and multifaceted than simply handing out legal drugs. The approach has been to support all pillars of the response: prevention, harm reduction, including safe supply, treatment, and enforcement. And a multiplex approach like this is far more effective at saving lives than simply locking people up. Treatment is one important part of the solution, but not the entire solution. And while a comprehensive approach includes harm reduction, including safe supply, it also focuses on education, access to life-saving treatments such as naloxone, reducing stigma, and connected to investments made in culturally appropriate treatment and prevention programs across multiple government departments, including working with public safety to ensure border services and law enforcement to identify and detect toxic drugs illegally before they get onto our streets. Is it enough? No. Clearly not why we continue to lose 20 Canadians per day from toxic drug overdoses. But let me be clear, Canadians are dying from a market awash in illegal drugs. Safe supply is not causing deaths. Safe supply is part of a life-saving treatment. Data from coroners in both BC and Ontario have found no link between prescribed hydromorphone and drug-related overdose deaths. The opposition leader's story on a link appears to be entirely speculative, and we know that this speculative tendency is often within his purview. What safe supply, as one of the many responses to the crisis, achieves is, for those people who use, diverting use of the drugs from the unregulated street supply and thereby reducing overdose risk. What else is achieved? Here are many, according to a recent review: improve control for that person over drug use so that they can control their dosing, avoid withdrawal symptoms, and manage pain, lower costs for healthcare, better engagement and retention in healthcare programs and housing, improve physical and mental health, fewer emergency department visits and hospitalizations, decreased infectious complications, improvements in social well-being, and guess what? Decline in healthcare costs. So it all works, but we need to scale up the efforts along with all the other pillars to match the scale of this epidemic. During this debate and others, there's also far too little consideration of prevention, of the urgency that we need to apply to prevention. And what does that mean? It means equipping our children, our youth, our citizens to avoid dangerous risk-taking and addictive behaviors, not by saying no to drugs, but by starting life with quality early childcare and parental support, avenues for organized physical activity and recreation throughout life, cultural connection, mental health support at all transition points in life. And in this vein, our government's investment in quality early learning and childcare is transformational and when combined with other aspects of prevention will have an enduring impact. Now some words about decriminalization. I was proud last year to support the Honourable Member for Courtenay Alberni's Bill C-216, which called for a national drug strategy and called for Canada to move towards decriminalization. That bill didn't pass, but I still support its intent. And the other day, the Honourable Leader of the Opposition referenced the Portuguese model quite favourably, and he's quite right. Portugal's drug-related deaths have been below the EU average since 2001, and there are many other markers of success. It's a model, but its success hinged upon decriminalization of simple possession of drugs, non-mandatory access to treatment, and harm reduction. So I'm wondering if the Leader of the Opposition endorses, through his fondness for the Portuguese model, the central tenets of decriminalization of personal possession of substance use, harm reduction including opioid substitution, and needle exchanges. I'd suggest the answer is no. Decriminalization is another one of those concepts that members of the opposition want to weaponize and use it to make it seem like those who support decriminalization want to let criminals run amok. But that simplistic reasoning is not the case. Portugal pursued decrim in the early 2000s. Illegal drugs in Portugal are still confiscated, and possessions still result in penalties like fines, community services, or recommended intervention. But penalties for simple possession are redirected from the criminal justice system to district-level panels to determine the best course forward for the individuals. And there are 30 countries around the world which have adopted aspects of decriminalization, including Australia and Chile, in addition to Portugal. Public health experts have long called for fundamentally changing our approach to the criminal justice approach. The Canadian Association of Chiefs of Police noted in 2020 that evidence from around the world suggests our current criminal justice approach to substance use could be enhanced using healthcare diversion approaches proven to be effective. So I wonder if the Canadian Association of Chiefs of Police are among the Honourable Leader of the Opposition's pie-in-the-sky theorists or purveyors of the misery industry. I think parents and children and first responders who have witnessed loved ones and patients die of toxic drugs before their eyes might have another opinion. But I know there are conservative Canadians who do get it. I'd, for example, refer my colleagues to the fact check that Ben Perrin has been doing on the Leader of the Opposition's motion this morning. Mr. Perrin's a lawyer and UBC law professor and former Prime Minister Harper's advisor on justice-related issues. And over the past number of years, he's written extensively about why and how his position on decriminalization has changed. As Perrin notes in a 2022 article in a Calgary Herald, there isn't any evidence to back Henny and Poilievre's war on drug policies. Their ideologically driven crusade is cruel, costly, ineffective, and deadly. So under a system of decriminalization, those who are using can get help. And under safe supply, drug users are at least using substances less likely to lead to death, offering a chance for intervention when they're ready and better health outcomes. So let's not go back to the 1980s and the days of just say no, which sounds so simple and tempting. Mr. Speaker, the war on drugs, a gauntlet with this motion the Leader of the Opposition wants to take up again, has long been lost, and we need to look to evidence, not emotion and rhetoric, to address it. Some months ago in the Health Committee, I brought forward a motion to study the opioid epidemic in Canada, specifically responses to it, including BC's trial focused on decriminalization. I hope to see the study move forward in the fall, as perhaps bringing together some of the evidence in one place will help adjust the hearts and minds of those across the aisle on this issue. The honourable members opposite know they are misleading Canadians by trying to connect the government's policies to the toxic drug crisis. And this approach is frankly shameful. I suggest that in the interest of defending the lives and families of Canadians, that the opposition party seriously reconsider their ill-founded approach. Mr. Speaker, as devastating as the toxic drug crisis is, there is another issue at play here, and that's the dismissing of evidence and scientific analysis when the evidence is not convenient. Our job as politicians is to make decisions based on what the evidence in its ever-evolving journey is telling us and adapt our decisions when the evidence changes. If we're changing science on a political whim, then we're heading into a dangerous world. We've seen the regime of science under a previous conservative, the shuttering of science under a previous conservative regime, especially in an age when false information is so cheap. We must not let that happen again. Thank you, Mr. Speaker.
Quick question.
We have time for one quick question, and then we'll go to the statements. The Honourable Member for Cumberland-Colchester has a question.
Thank you, Mr. Speaker, and thank you, my colleague, for his comments.
It's interesting that once again our colleagues across the aisle are trying to make this a crazy partisan issue with their inflammatory language. This study is actually what this member is quoting from, Mr. Speaker, and this is very different from the $3.5 million this Liberal government has spent on dispensing machines for hydromorphone, and 3 in Vancouver and 1 in Victoria. And I wonder if the member has a comment, because this paper that he's quoting from actually talks about comprehensive social services, medical care, and housing supports and social supports. And it's interesting, Mr. Speaker, because on this side of the House, that's what we're talking about. On that side of the House, Mr. Speaker, they're talking about giving away drugs to people without any accountability, and people can use fake names. What does the member have to say about that?
The honourable member for Yukon.
Thank you. My friend and medical colleague from across the aisle knows well. I think we can agree on the need for a comprehensive approach, which I spoke to in my speech. The question is that harm reduction, including safe supply, is part of those pillars of the approach. We need to support scale up safe supply to use it when it is indicated, and that's part of the overall approach.
The honourable member will have 3 minutes and 45 seconds remaining for questions upon return to this item. Now we'll go to statements by members. Déclaration de député. The honourable member for Milton.
Thank you, Mr. Speaker. It's shameful how misinformation is being peddled by the leader of the Conservative Party. Last week, when the Minister of Families, Children and Social Development spoke to the horrible wildfires in Alberta, the leader of the Conservative Party of Canada, the Member of Parliament for Carleton, yelled across the aisle, "Fires started by your government." The former leader of the Conservative Party of Canada said not that long ago that it seemed as though members of his party had gone a little too far down the rabbit hole of conspiracy theories during the pandemic, referring to comments by some of his MPs as not helpful and spreading a lot of uncertainty. Sadly, Mr. Speaker, it seems that the member from Carleton is doing the same thing, spreading distrust and fact-free conspiracy rhetoric with respect to the deadly opioid epidemic. This week, when the Minister of Addictions and Mental Health, a physician standing up for science and an evidence-based approach to saving lives with harm reduction, supervised consumption and safe supply, the leader of the Conservative Party aggressively repeated, "You're killing people," to a doctor who has taken the Hippocratic Oath. It's beyond the pale, Mr. Speaker. Canadians deserve honest representation and leadership. I'd say the leader of the Conservative Party should be ashamed of himself, Mr. Speaker, but it's clear he has no shame.
The honourable member for Essex.
Mr. Speaker, hockey is Canada's game. Men and women's hockey bring families together at rinks and around televisions across country to cheer on our favorite teams. These athletes have dedicated parents, team owners, great coaches, fantastic teammates, dedicated fans, and fabulous volunteers to support them on their journey. Speaker, the Provincial Junior Hockey League of Ontario provides an opportunity to showcase our amazing young athletes. 17 hockey clubs make up the Western Division of the PJHL, including 3 from my riding of Essex, the Amherstburg Admirals, Essex 73s, and the Lakeshore Canadiens. Although I am dating myself, Speaker, I was proud goaltender for the Kingsville Comets Junior C Hockey Club back in the day. These clubs were my rivals. Today, I stand to congratulate the Lakeshore Canadiens for winning the Western Conference Championship. Although the Schmalz Cup wasn't in the cards this year, we're all proud of you. Let's bring it home next year.
Let's go Hurricanes! Let's go!
The honourable member for Courtney Alberni.
Speaker, Parksville has lost a legend. Phil St. Luke was lovingly known throughout the community as Flying Phil, and he brought joy to all who knew him, and most people did, whether through a wave during his daily walk through the streets of Parksville, through working with him as a community volunteer, cheering him on during the annual Canada Day Parade, or chatting with him at a local coffee shop or at community events. Flying Phil represented the very best in humanity, and his kind and loving and uplifting spirit is greatly missed. He succumbed to cancer in January at the age of 70, and our community will gather to celebrate his life next month, and funds are being raised for a public statue so his spirit will live on. Rest in peace, Flying Phil. You enriched the lives of an entire community, and for this, we are forever grateful.
L'honorable député de Drummond.
The honourable member for Drummond. Thank you. 2023 is a historic year for the Circle of Farmers of Saint-Cyril. Female farmers These are 36 extraordinary volunteers who care about improving conditions for women and families, as well as producing artisanal products. These generous women whose actions are known throughout the community. I'd like to also underscore the participation of emeritus members of the Circle. Cécile Langelier, the oldest, who's been a member since 1975, Jeanne Descoteaux, Annette Fauché, Gisèle Boudreau, and others. Without these women and newer farmers, our traditions would surely disappear. I am very happy to see that Quebec's rich history and our ongoing artisanal heritage rests in good hands. Tonight, we are kicking off the festivities at Lausière Heritage Home. I would like to wish the female farmers of Saint-Cyril a happy 85th anniversary.
On May 18th, the Tamil community celebrates the Day of Remembrance, Mali Vaikal, which commemorates the lives lost during the 25-year-long civil war in Sri Lanka. As we honor the victims of this tragedy, we are reminded of the strength and resilience of the Tamil community in Canada and around the world. During the Mali Vaikal massacre in 2009, Tamils held rallies and protests in Canadian cities, raising awareness of the violence taking place and calling for action to prevent further death and destruction. J'ai rencontré de nombreux Canadiens d'origine.
I have met with a number of Canadians of Tamil origin who survived the Sri Lankan Civil War or who lost loved ones in the war, despite all the adversity that the Tamil community faced. Their contributions have changed our country for the better.
Thank you to the Tamil community for your commitment to denouncing the human rights abuses and atrocities committed. As we reflect on the pain of these events, we continue to look towards healing and making the world a safer place for all.
The Honourable Member for Calgary Centre.
Mr. Speaker, this week Alberta's NDP MPs in this House teamed up with their Liberal partners to amend Canada's Environmental Protection Act, creating a duplication of regulations on tailings ponds and hydraulic fracturing. Going forward, the resource industry will need to go through two regulatory bodies. So much for reducing regulations of the mining industry to get mines producing in less than 20 years. This is a flip-flop by Liberals on their position at the Environment Committee. No surprise, I suppose. But the last thing we need is more jurisdictional clashes caused by the federal government overstepping its constitutional bounds. Shocking is the Alberta NDP working hand-in-hand with these Liberals to override provincial jurisdiction. If it's not obvious, let's be clear. Notley's NDP is colluding with this Liberal government to restrict Alberta's resource development.
Shameful. The Honourable Member for Cloverdale, Langley City.
Thank you, Mr. Speaker. Mr. Speaker, at this time of year, we celebrate the academic achievements of those who have finished their studies for the year. This includes those who are done another year of post-secondary studies, including my daughter Hattie, and those who have convocated. We also celebrate the achievements of elementary and secondary schools in Cloverdale, Langley City. I congratulate all grade 12 students who are preparing to celebrate the significant milestone of graduation, including my daughter Kaylani. As these students pursue post-secondary education, trades training, and enter the workforce, I'd like to acknowledge their hard work and accomplishments in pursuit of their passions and life goals. Congratulations to the graduating and convocating classes of 2023. I look forward to seeing these graduates shape our future ideas, policies, and investments as they become leaders in our country. Thank you, Mr. Speaker.
The Honourable Member for Kings Hants.
Alau Rikia, Shemias Nangal, Aunan, Aupanuag. What I just said, Mr. Speaker, is that May is Gaelic Month in Nova Scotia, which is an opportunity to celebrate Nova Scotia's rich history and connection to Scotland and the Gaelic language. I, like thousands of Nova Scotians, can trace my family's history to Scotland, and the contribution of Scottish Gaels to Canada, and in particular to Nova Scotia, is significant, where the language has been spoken for almost 250 years. Our province is home to one of the largest Gaelic-speaking populations outside of Scotland itself. Gaelic cultural identity continues to be a vibrant part of Nova Scotia's diverse peoples and communities, and I want to thank the Gaelic community that continues to promote the language today. This month and always, we should celebrate the unique connection that exists between Canada and Scotland, especially in Nova Scotia. And this year's theme, Mr. Speaker, is Gaelic Month, Say Yes to Gaelic. And in that spirit, I say, Du os nan Gaelic, sound lisheva aha. Thank you, Mr. Speaker.
The Honourable Member for Pitt Meadows, Maple Ridge.
Mr. Speaker, a
After 8 years of this Prime Minister, everything feels broken. Life is more expensive, work does not pay, housing costs have doubled. The Prime Minister divides to control the people. Worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is this worse than the opioid overdose crises that has so dramatically expanded in the last several years. When I walk outside in Maple Ridge's downtown core, more often than not, I see men and women strung out on drugs. It's tragic, it's heartbreaking, and it's the same in cities across BC. Needles everywhere, thousands are dying. In BC alone, yearly overdose deaths have spiked 300% since the Liberals have come into power. And what is the Liberal NDP solution? More drugs, free drugs, and death. Why does this government so stubbornly cling to its failed drug policies?
Rouge Park.
Mr. Speaker, I rise today to mark Tamil Genocide Remembrance Day. Tamils around the world stand in solidarity with the victims, survivors, and their families in the north and east of Sri Lanka to ensure that we find the truth, hold those responsible for atrocities accountable, attain justice and peace. This past January, our government imposed sanctions on 4 Sri Lankan officials, including Mahinda Rajapaksa and Gotabaya Rajapaksa, both credibly accused of war crimes, crimes against humanity, and genocide. These past presidents of Sri Lanka have blood on their hands and cannot evade justice. As part of our Indo-Pacific strategy, Canada reaffirmed our resolve to ensure accountability on the island. Canada will continue to demand accountability by working with multilateral partners, including the United Nations Human Rights Council. Mr. Speaker, as we mark this day, let us also ensure that the Tamils' inherent right to self-determination in their homeland is entrenched and they attain peace and security. Thank you, Mr. Speaker.
The Honourable Member for Chicoutimi-Le-Fjord. Mr. Speaker, let me draw a picture of Canada after 8 years of this Prime Minister. It's not a pretty picture, even though he thinks that everything is fine. The worst inflation in 40 years, houses that are not affordable, food banks with long lines. The Liberals have been breaking Canada's economy for 8 years. The least they could do would be to abolish the carbon tax, which is already costing 41 cents per litre more. Well, now we see that there's going to be a second tax on gas. These two combined taxes will represent 61 cents a litre on the backs of Quebecers who are already struggling. They're adding insult to injury, and that second tax will apply to Quebec and cost, on average, $406 per year more. And the Bloc Québécois approves of it somehow. But there is hope. The leader of the Conservative Party, when in power, will bring back common sense by cancelling both carbon taxes and giving back control to Canadians, so they no longer need to choose between housing, clothing, or feeding themselves.
This reckless Prime Minister, along with his NDP Liberal Carbon Tax Coalition, are secretly implementing a second carbon tax, Carbon Tax 2. And we all know the sequel is far worse than the original. The first carbon tax will cost Canadians an additional 41 cents per litre at the pumps. Carbon Tax 2 will force Canadians to pay even more for gas, groceries, and home heating. A PBO report released today shows Saskatchewan families will be hit the hardest in the country by Carbon Tax 2, paying more than $1,100 a year, Mr. Speaker.
Shame.
This is on top of the original $1,500 of the original carbon tax. The Liberals are targeting families, farmers, and small businesses while missing every environmental target they have. A Conservative government will make work pay again by putting more money back into the pockets of Canadians. The more this Prime Minister goes woke, the faster Canadians go broke. It's time to bring home common sense and axe the carbon tax.
The Honourable Member for Bourassa. Mr. Speaker.
Monsieur le Président, pour le pays, pour les ancêtres.
For the country, for our forefathers, let us march united for the flag, for our country. To die is a fine thing. Our past cries out to us to have a warrior soul. These words are from the national anthem of the Republic of Haiti, which today is celebrating the 220th anniversary of the creation of its flag. Today, Haiti needs all of its daughters and sons. Today, May 18th, I call upon all in this country to put aside personal interest and to come together to rebuild Haiti with dignity. Today, May 18th, I call upon criminal gangs to lay down their weapons and to put an end to the violence in Haiti. Long live Haiti.
The honourable member for Port Moody, Coquitlam.
Mr. Speaker, in my community of Port Moody, Coquitlam, and Morin Belcarra, we support the work to end period poverty. On May 28th, the Seroptimist International of the Tri-Cities, as part of the Period Promise campaign, will highlight this important cause by hosting a fundraiser and donation drop-off. With a 6% increase in the price of personal health care products, even more Canadians cannot afford menstrual products like pads, tampons, and cups. Lack of hygiene products causes BC residents who experience menstruation to miss school, work, and social gatherings. The United Way's Period Promise campaign is working to address this inequality. I will stop in at the Como Lake Village in Coquitlam on Saturday from 1 to 4 p.m. to support the Seroptimist who collected 700,000 units to end period poverty last year. I raise my hands to the work of every community organization that has taken the Period Promise. Their work is invaluable.
L'honorable député de...
The honourable member for Beauport-Côte-de-Beaupré, Île d'Orléans-Charlevoix. Mr. Speaker, Canada is realizing that before Madonna and Lady Gaga, before they filled stadiums with their incredible voices, there was the great Diane Dufresne. The great Diane Dufresne will be brought into the pantheon of Canadian music this evening after 60 years of her extraordinary career in music. She's the first female Quebecer to enter the pantheon in 45 years. Better late than never, this well-chosen icon of Quebec songwriting will bring some oxygen to the pantheon. On behalf of the Bloc Québécois, I would like to congratulate this great ambassador of our culture and of the Quebec soul. She greatly deserves this honor. Calgary will be shocked to see her put on her Diane Dufresne regalia and go visit the town. Yes, Calgary will be shocked and delighted if it listens to her sing one of the greatest songs from her famous Rose spectacle. Congratulations, Diane Dufresne. Quebec shines every time that you are honored.
The honourable member for King Vaughan.
Mr. Speaker, the Liberal government tried to sell Canadians a bill of goods stating they will get back more than what they pay in carbon tax. But the Liberal government's own study proved them wrong. Now these Liberals want to impose a second carbon tax. These two taxes combined will create approximately $2,000 in net new costs above and beyond any rebates. At this time, many seniors are having to rely on local food banks more and more. A local Toronto food bank has seen their yearly food budget from $1.8 million, which was their previous monthly budget. With this Liberal second tax grab, their annual food budget will increase to $43 million. The PBO report released this morning revealed that the carbon tax will have a greater impact on lower-income households. Our Conservative Party will cut the tax and bring hope back to the seniors.
The honourable member for Canada, Carleton.
When the pandemic impacted our semiconductor supply chain, one thing became very clear. Canada needs to nearshore this critical economic sector. I'm proud that our government is working to do exactly that by building a semiconductor corridor across North America. Canada is in a unique position. We have the resources, the critical minerals, and the talent to get the job done. Just look at the innovators in my riding of Canada Carleton, CMC, Renovis, Marival, Alpha Wave Semi, GAN Systems, just to name a few. who are designing, assembling, and testing semiconductors that are smaller and faster than ever before. Building out this ecosystem promises to be a transformative step for Canada's economy, and we will not let this once-in-a-generation opportunity pass us by. Thank you, Mr. Speaker.
Oral questions. Question orale. The Honourable Leader of the Opposition.
The PBO revealed today that this Prime Minister will apply a second carbon tax on the backs of Quebecers. Beyond all the taxes that Quebecers have to pay on gas already, in addition, he's adding another 17 cents. And he'll apply the sales tax as well, for a total of 20 cents of tax for every liter, for every family, for every farmer, for every company in Quebec. Mr. Speaker, how much will every Quebec family have to pay? The Honourable Minister of the Environment. Thank you, Mr. Speaker. I think that Quebecers who are listening today know how the fight against climate change is a key issue, and they know how the Conservatives on this question have nothing to say. They have no plan or measures, despite the promises they made during their last election campaign. They don't even believe in the reality of climate change, even though there's flooding in Quebec and record fires in Alberta. I think people expect a responsible government on climate change, and that's not happening with the Conservatives. The Honourable Leader of the Opposition, that's absolutely nonsense. The Quebecers are the greenest people in the world, and this Liberal government is preventing construction of dams and other projects for hydroelectricity that is green. At the same time, they want to force Quebecers to pay an additional 20 cents per litre or $500 per family in tax, and they want to do so with the support of the bloc that is wokest, Mr. Speaker. It's only the Conservative Party that has the logic to eliminate this aggressive tax. Mr. Speaker, will the government listen to good sense and axe the tax? The Honourable Minister. Thank you, Mr. Speaker. I will allow my honourable colleagues from the bloc answer that question to know if they are wokest. I think that's not up for me to say, but I would like to say that once again, the Leader of the Opposition is saying something that's absolutely not true. What we're doing is a mechanism to ensure that refineries who have made record profits in recent years, Mr. Speaker, do their fair share with respect to the climate change crisis. And I think that people expect every areas in the country to do their fair share in terms of climate change. The Honourable Leader of the Opposition.
Saying these things, it is the Parliamentary Budget Officer this government appointed, and just yesterday the Finance Minister said we should believe the Parliamentary Budget Officer. What did he say? He revealed that the first carbon tax will cost 41 cents a litre, and now that there's a second carbon tax of 17 cents a litre, and then when you add the HST on those two taxes, you get a total new tax increase of 61 cents a litre, costing $2,000 a family. How are Canadians going to be able to pay their bills after this new and latest Liberal tax hike?
The Honourable Minister of the Environment.
Mr. Speaker, I would like to quote from the Parliamentary Budget Officer's own analysis, which, and I quote, does not attempt to account for the economic and environmental costs of climate change. He's looking, the Parliamentary Budget Officer is looking at one side of the ledger, Mr. Speaker, without looking at the other side of the ledger. And we know that climate change is already costing Canadians billions of dollars every year. In fact, Mr. Speaker, tens of billions of dollars every year. Of course, if you're the Conservative Party of Canada, you don't believe in climate change and you don't care that those costs to Canadians. But unfortunately, facts are facts, Mr. Speaker, and those costs are real to all Canadians.
The Honourable Leader of the Opposition.
Climate costs are real, but they will not be reduced as a result of this tax.
That's right.
And so the minister's argument leads to a dead end. The Parliamentary Budget Officer said carbon tax 1 would cost 41 cents a litre. Now carbon tax 2, 17 cents a litre. And then they want to tax the tax on the tax by putting HST on top of all that. So it's going to be 61 cents a litre in carbon taxes. We already have 1 in 5 Canadians skipping meals because they can't afford the price of food. How many people are going to go hungry when this government imposes this tax hike?
The Honourable Minister.
Thank you, Mr. Speaker. Unfortunately, the Leader of the Opposition is wrong yet again, because our plan is working and has led to reduce in emission in Canada and climate change pollution by more than 50 million tons between 2019 and 2021 beyond COVID. And in fact, Mr. Speaker, it's called a pandemic because it was happening all over the world, and yet Canada in 2021 and 2020 and 2021 has the best performance of all G7 countries, Mr. Speaker. Thank you.
The Honourable Leader of the Opposition.
Emissions only went down when they actually locked down the country for COVID, but they want to do that forever. Mr. Speaker, the Prime Minister decriminalized crack, heroin, and other hard drugs on January the 31st. He's flooded the streets with taxpayer-funded hydromorphine. And today, we have learned the tragic results. The report from British Columbia shows that 7 people are dying every day of overdoses. In April, overdose rates were up 17%. This experiment has failed. When will the Prime Minister get common sense, get drugs off our street, and get our people into treatment?
The Honourable Minister for Mental Health.
Mr. Speaker, our hearts are with all the people the families that have lost a loved one to this terrible crisis caused by a poisoned drug supply. The BC coroner has said there is no evidence that safe supply has been implicated in any of these drug deaths. We have to use every tool in our toolbox to stop this terrible tragedy, and that includes prevention, harm reduction, treatment, and enforcement.
The Honourable Member for La Prairie. Mr. Speaker, every day since February, the Bloc has called for a public and independent inquiry into Chinese interference, because every day the Liberals have hidden the truth. They knew that China was interfering in the election. They hid it. They knew that China had suspicious ties to one of their MPs. They hid it. They knew that China was involved with the Trudeau Foundation. And above all, Mr. Speaker, they knew that China was threatening elected officials and their families, and they hid it. And above all, they did nothing. That's unforgivable, Mr. Speaker. When will we have a public and independent commission of inquiry? The Honourable Minister of Intergovernmental Affairs. Mr. Speaker, I didn't know that hiding something means putting it in a public report of CSIS. On the contrary, Mr. Speaker, as a government, we acted quickly to establish measures to counter foreign interference, including from China, something that didn't exist before we came to power. We are going to strengthen these measures. We have taken measures to make sure, as my colleague said, that there will be no members that will be threatened by this interference, and we're going to continue in that direction. The Honourable Member for La Prairie, Mr. Speaker, his answer shows that we need a public and independent inquiry. A commission needs to be chosen by this House with a broad mandate so that we can shed full light on this with a clear timetable, one that will begin its work quickly and start work now, not in the fall, right now. It's the only acceptable recommendation that can be arrived at by their rapporteur. That is nothing special and really not independent. The Liberals have to stop trying to skirt the issue. Will they commit to this commission immediately? The Honourable Minister. Mr. Speaker, I'm a former fisheries minister, and we know that skirting the issue is a tough one. We need to ask for an independent expert like we have in Mr. Johnston. We know that he will table his report next week, and that's exactly the issue that will be looked at in terms of an independent inquiry into foreign interference. We are looking forward to reading these recommendations of Mr. Johnson, and would ask the member to allow Mr. Johnson the time to provide his opinion.
Member for Courtney Alberni.
Mr. Speaker, the Liberals gave over $100 million worth of federal contracts to their friends at McKinsey since 2015, despite McKinsey playing a major role in pushing opioids to vulnerable people. Mr. Speaker, $100 million to a company that worsened the toxic drug crisis. This government even knows McKinsey is terrible, as they've joined a lawsuit to hold the company accountable. So why don't the Liberals stop giving money to McKinsey and use that money to appropriately respond to combating the toxic drug crisis that's killing people in this country?
The Honourable Minister for Procurement.
Thank you, Mr. Speaker. And of course, Public Services and Procurement Canada is always committed to an open, fair and transparent procurement process while also obtaining the best value for Canadian taxpayers. In the case that the member opposite has alluded to, we of course do also have an integrity regime that we consult regularly, and it is clear in that integrity regime that civil litigation is not a grounds for suspension or department from the existing integrity regime, which was actually put in place by the previous government. Thank you, Mr. Speaker.
The Honourable Member for Vancouver East.
Giant housing corporations are treating people's homes like a stock market and evicting longtime tenants to jack up rents. This Minister of Housing thinks a 1% tax on empty homes and a 2-year ban on foreign investments will solve the housing crisis. He is wrong. The housing advocate said these half-liberal measures are dangerous and short-sighted. Financial firms already own 20 to 30% of the rental stock. Will the Liberals stop corporations from getting their hands on more low-cost rental homes with a moratorium and help nonprofits secure these homes with an acquisition fund?
The Honourable Minister of Housing.
The Honourable Member is denying the fact that we're the party in office that brought in the Canada Housing Benefit, a plan to support renters across the country. That is currently helping tens of thousands of vulnerable renters across the country. But in addition to that, we've legislated an annual 1% tax on vacant non-Canadian residential real estate, as well as a 2-year ban on foreign investments in Canadian residential real estate. We're also reviewing the tax treatment of real estate investment trusts, Mr. Speaker.
The Honourable Member for Calgary, Forest Lawn.
Carbon tax scam 1 cost on average $1,500 net on Canadian families after phony rebates. They just pile drive Canadians with a second scam that will cost Canadians another $500 without any rebates. They hid the facts, but their own budgeting officer exposed these scams. They've made the cost of gas, groceries and home heating more expensive. The first scam hit the most vulnerable Indigenous populations hard. The second scam is going to cripple lower income households even further. Just so Liberals can look more woke while more Canadians go broke. When will they scrap the scams and stop gaslighting Canadians?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. The truth is that the Conservatives have absolutely no plan to do anything to fight climate change and will set our country back on making promises towards a cleaner economy. When it comes time to ask the oil companies to reinvest their record profits in the innovative solution in clean technologies, the Conservatives immediately back down. We're proud to support the Clean Fuel Regulation, which, when fully implemented, is already contributing more than $2 billion in the last year alone, Mr. Speaker, to the Canadian economy. Thank you.
The Honourable Member for Calgary, Forest Lawn.
Let me sober this out-of-touch orange jumpsuit-wearing minister. Yesterday, Food Bank said that those accessing food charity quadrupled since this Liberal made inflationary crisis. They already made rents and mortgages double, and to continue down their woke, climate zealot ideology, they'll take another $2,000 out of the struggling Canadians' pockets while failing to meet any climate targets. How much more woke do they need to go? How much more broke do Canadians need to go before this Prime Minister wakes up?
The Honourable Minister of the Environment.
Mr. Speaker, I'm told that orange is a new black, but to expand on the benefits to the Canadian economy of the Clean Fuel Standard, let me talk about the Tidewater $342 million plant in British Columbia. This year, Mr. Speaker, Imperial Oil, 720...
I'm going to interrupt. We're starting to get noisy. It started off really well. I was really impressed. I just want to make sure that we continue. The Honourable Minister from the top so that everybody's quiet and can hear the answer, please.
Speaker, I'm told that orange is a new black. I would like to further expand on the examples I wanted to give, like the Tidewater $352 million plant in BC. Imperial Oil, all privately funded, $720 million plants for cleaner fuels in Alberta. Federated Co-op's $2 billion plant in Saskatchewan, O'Brien's plant in Newfoundland, which received an added $300 million of private financing in the last month alone, Mr. Speaker.
Well, member for Edmonton Mill Woods.
Mr. Speaker, after 8 years of this Prime Minister, Canadians' lives have become more unaffordable. They already have one Liberal carbon tax that is costing Canadians 41 cents per litre. And now there's a second carbon tax that will cost Canadians 17 cents per litre. Once you add a tax on that tax, it's going to cost Canadians 61 cents per litre, making everything more expensive. Why do they continue to force Canadians to pay for their failed policies?
The Honourable Minister of the Environment.
Mr. Speaker, if the Conservatives are going to oppose the clean fuel regulations, which they supported during the last election campaign, they should explain to Canadian farmers, particularly canola growers in Western Canada, why they oppose something that will increase domestic canola demand by over 5 million metric tons and support a strong canola price in this country. Canadians don't need short-term scare tactics, Mr. Speaker. What they're looking for is long-term affordable solutions to the climate crisis, and that's exactly what we're doing on this side of the House.
Honourable member for Edmonton Mill Woods.
Mr. Speaker, their failed carbon tax has not achieved one environmental target that they set. They need to get out of their ideological bubble and go talk to real Canadians who drive for a living. Talk to truck drivers, talk to delivery drivers, talk to cab drivers, go talk to some farmers, and they will tell you the real cost of their failed policies. On July 1st, the second carbon tax will cost Canadians an average of $573. That's on top of the first carbon tax that will cost $1,500. Mr. Speaker, do they really believe that Canadians can afford over $2,000 for carbon tax 1 and 2?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. And just this week, the Parliamentary Budget Office stated that the effects of climate change bit a $20 billion-sized hole out of Canada's economy in 2021 alone. Mr. Speaker, I understand that the Conservative Party of Canada doesn't believe in climate change, but they pretend to believe in economic responsibility. Why is it that the Conservative Party wants to cancel a market-based mechanism that is putting a price on pollution?
The Honourable Member for Mégantic-L'Érable. $436. That's what the average household in Quebec will pay, in addition to this new tax that applies directly to Quebecers. While more and more people can't afford to buy groceries, fill up their car, and they have to make difficult choices to live, these Liberals and this Prime Minister, who pays his own vacations and gas prices for 10 years, he should take a step back and stop making life more difficult for Quebecers who are having a hard time, who are struggling. The Honourable Minister of the Environment. Thank you, Mr. Speaker. I would like to correct a question that was made by the Conservatives earlier in this House that was talking about a Quebec tax, and the member sent us this tax, and on this report we've seen we have a cap-and-trade system in Quebec. It's a Quebec system that applies to Quebec and not the federal system. Honourable Member for Mégantic-L'Érable. 17 cents a litre and new regulations on clean fuel will cost Quebecers $436 more per year. That's the second carbon tax that the minister doesn't seem to want to repeat, Mr. Speaker. No one believes in this minister when he says it doesn't cost Quebecers more and they're not facing the carbon tax. When people buy groceries and they pay for products that were transported across the country, they realize things cost more. They're not crazy. They know it's the carbon tax. Why is the government singling out Quebec with the second carbon tax? The Honourable Minister. Thank you, Mr. Speaker. My colleague's statement is false. What we are doing is making sure that refineries who have made record profits in recent years pay their fair share. 26 cents extra on refining margins, and we think that they do have the means to pay for the fight against climate change. And Quebecers who are watching us agree with this, so that all sectors of this society and all parliamentarians work in the fight against climate change. The Honourable Member for Lac Saint-Jean. Mr. Speaker, 72% of refusals of Francophones from Africa were refused to study in Quebec. We saw this in 2020 and 2021. How come the Minister of Immigration himself last year admitted that there was racism within his own department? Have they done anything to change this? Nothing at all. When will this government stop discriminating against foreign students from Africa chosen by Quebec? The Honourable Parliamentary Secretary. Mr. Speaker, we understand that students and schools who accept them are disappointed when a request is refused. I'd have to say that I was in Tunisia last year during the Francophonie Summit, and I was able to meet many leaders and stakeholders in our Francophonie to find solutions to this issue. I'd also remind this House that for Francophone students from Africa the acceptance rate has now risen to 35% this year, the Honourable Member. 72% refusals is more than the number of requests refused from Ontario. We're talking about broken dreams, and this pushes Francophones to study elsewhere, even though they're a valuable resource for Quebec. And those who stay in our country after they study here become a strength for our nation. When will the government stop hindering our students? Thank you very much, Mr. Speaker. I agree with my colleague. We need these people to come here, and that is why we established a direct study program in Senegal and Morocco to accelerate requests. The approval rate was improved, and we know that we still have work to do. And we recognize the clear societal advantages, cultural and economic advantages that international students bring to Canada and to Quebec. We're doing everything we can, Mr. Speaker, to make it easier for students to come. The Honourable Member for Lac-Saint-Jean. Mr. Speaker, it's even more enraging because the government spends its time giving Quebec lessons, even though we know that they're breaking the dreams without any justification, and it doesn't make sense. These decisions are unjustified, and even the minister has realized that there is prejudice and this injustice keeps continuing. They should put the same amount of energy to fair treatment of people as they do to their nice speeches. The Honourable Parliamentary Secretary. Mr. Speaker, foreign students, as I said, bring an important contribution to Canada, and we've heard them very clearly. That is why we extended work permits that were on the verge of expiring, which allowed more than 100,000 graduates to remain in our country. We also allowed 500,000 students to benefit from off-campus work. Canada and will always be a destination of choice for students.
Foothills.
Mr. Speaker, I would encourage the Minister of Environment to go talk to a farmer, because I haven't spoken to a single one that supports the first carbon tax, let alone carbon tax number 2. And the Agriculture Minister admitted yesterday she has no idea what the impact carbon tax 2.0 will have on farmers or the cost of food. Here's what we do know. When the Liberals triple their first carbon tax, fuel goes up 41 cents a litre, diesel goes up 15 cents a litre, and the cost of food 34%. When they implement carbon tax number 2, the cost of fuel goes to 61 cents, diesel 25 cents a litre. Can the Minister of Agriculture confirm that the carbon tax 2.0 will be exempt from coloured farm fuel?
The Honourable Minister of Agriculture.
Thank you, Mr. Speaker. Once again, the first people impacted by the climate crisis are our farmers, and they have always worked to have the most sustainable agriculture possible. They've improved their practices to have the best equipment and to do R&D in this respect. We are here to support our farmers while the Conservatives take them for granted. We have a vision for the future for them.
Here's the problem, Mr. Speaker. The minister has no idea what the impact of Carbon Tax 2.0 is going to have on the cost of food, the impacts on farmers, the cost to transport that food, or the cost of Canadians to actually buy that food.
That's right.
And the first carbon tax is already sending Canadians to the food banks in shocking numbers. The number of trips to the food bank is up 60% in 2003. That is 8 million Canadians going to the food bank every single month. How much will Canadians have to pay to put food on the table when the Liberals implement Carbon Tax 2.0?
Good question.
The Honourable Minister of Agriculture. Thank you, Mr. Speaker. A few weeks ago, I announced a new $10 million for the infrastructure fund for local food organizations, nonprofit organizations, including food banks, community gardens, and greenhouses, to apply because it allowed them to acquire new equipment. Thank you. The Honourable Member for Chicoutimi. Mr. Speaker, with Liberal inflation, Canadians' paychecks no longer allow them to make ends meet. The Liberals already have a carbon tax that cost 41 cents more per litre of gas, but now we've learned that they're adding a second carbon tax on top of the first. This means the two taxes combined will represent 61 cents more per litre, increasing the price of transportation and food. When will the Liberals eliminate the double carbon tax to allow Canadians to breathe a bit more? Because right now they're suffocating. The Honourable Minister of the Environment. Thank you, Mr. Speaker. I'd like to remind my honourable colleague that Quebec has its own cap-and-trade system, which is a system that is completely different than that of the federal solution, and they have a price on pollution. And if he would like a technical briefing from my department about how this Quebec system works, I'd be happy to offer him one.
Member for Port Moody, Coquitlam.
Thank you, Mr. Speaker. The average rent in Coquitlam is now $2,800, the third highest in the country. Seniors, single mothers, and people with disabilities are being evicted as their long-time rental homes are being replaced with luxury condos. I met a single mom whose rent went up 50% just so that she could stay in her community after she was displaced by a for-profit developer. This is unacceptable. What are the Liberals going to do to keep rents affordable? Because what they're doing now is not working.
Hear, hear. The Honourable Minister for Housing.
Mr. Speaker, the Honourable Member knows or should know that rent control is under provincial jurisdiction. However, we on this side of the House believe that the federal government has a role and should play a role in helping renters. That is why we introduced the Canada Housing Benefit. That is why we partnered with political parties on this side of the House to make sure that we top up the Canada Housing Benefit, which is going to every vulnerable renter across Canada that needs it. It's a cost-shared program, and we're proud of that record.
The Honourable Member for Victoria.
Mr. Speaker, the average rent for a one-bedroom in Victoria is a whopping $2,000, and a two-bedroom is $2,600. Young people, seniors, those on fixed incomes can't afford these enormous rents. People in my riding are being hit hard. Many are without a home, in housing that doesn't meet their needs, facing rent evictions, or unable to save for the future. For every one affordable unit built, we are losing 15 affordable homes. So why do the Liberals refuse to take on giant housing corporations, and why are they failing to increase the supply of affordable rentals?
The Honourable Minister for Housing.
Mr. Speaker, I know that the NDP loves to bring up provincial jurisdiction issues. However, we do believe that the Government of Canada has a role to support renters. That's why we introduced the Canada Housing Benefit. And as far as building more rentals is concerned, we're the government that introduced the Rental Construction Financing Initiative, which is about building more rental supply in Canada, including affordable rentals. And we're now moving forward with the Housing Accelerator Fund, which is about building more supply, including more affordable housing, but also more affordable rentals.
The Honourable Member for Steveston, Richmond East.
Mr. Speaker, temperatures in Western Canada remain high, and so have the fire risks. Thousands remain evacuated in Alberta, and we have seen more evacuation orders in recent days from communities in the Northwest Territories and my home province of British Columbia. We have seen this government step up when Alberta reached out for help, providing CAF and other federal support, but this is just the start of Canada's wildfire season. Can the Minister of Emergency Preparedness update this House on what he and this government is doing to help currently affected communities and ensure all regions have the support they need?
The Honourable Minister for Emergency Preparedness.
Speaker, first of all, let me thank the member from Stevenson, Richmond East, for his very important question. And I'd like to begin my answer by acknowledging the incredible work of firefighters, first responders, and volunteers who have stepped up and are supporting those who have been displaced. Mr. Speaker, here today, we've heard a lot about the cost of fighting climate change. But, Mr. Speaker, we have evidence before us this week of the cost of inaction. And when we fail to respond, we can see that literally tens of thousands of people have been displaced from their homes. Over 700,000 hectares of forest has been burned. And the cost of assisting those people through recovery is unsustainable. Mr. Speaker, we have to take action, and we are.
The Honourable Member for Hastings, Lennox and Addington.
The news out of the PBO this morning is shocking. A second carbon tax. That would add another 17 cents on a litre of gas, increasing it from 41 cents to 61 cents. Wow. As the adage goes, fool me once, shame on me. Fool me twice, shame on you. Mr. Speaker, Canadians are no fools, and this government should be ashamed of its campaign of punitive raids on the bank accounts of Canadians to bankroll their historic debt. Mr. Speaker, with the cost of gas, heat, and groceries ballooning, does this out-of-touch government really think Canadians can afford this debilitating hit to their finances?
Hear, hear. The Honourable Minister of the Environment.
Thank you, Mr. Speaker. So when the Conservative Party of Canada in the 2021 election campaigned on bringing carbon pricing to $170 a ton or putting in place a clean fuel regulations, were they trying to fool Canadians? Is that what we're to understand, Mr. Speaker? Thank you.
The Honourable Member for Coast of Bay Central, Notre Dame.
Mr. Speaker, the Finance Minister has been dodging questions about her second carbon tax ever since she came back to work. Well, now we finally have the answer thanks to the PBO. Now, this additional 17 cents a litre is even going to be charged on fuel used by our fishermen. Oh, no. And for families in Newfoundland and Labrador, it's going to be an extra $850 a year. Combined with our original carbon tax, it's going to be $2,000 per year for those families. So, Mr. Speaker, my question is, when is this Liberal government going to stop trampling on the people of Newfoundland and Labrador and axe this useless carbon tax?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. First, our plan is working. We've reduced carbon pollution by more than 50 million tons. Canada has the best emission reduction profile of all G7 countries in 2020 and 2021. And what we're doing for the great people of Newfoundland, Mr. Speaker, is helping them land investment of more than $300 million in the last month alone in the new Bryanus plant biorefinery. Thank you, Mr. Speaker.
L'honorable député. The Honourable Member for Louis Saint Laurent. Mr. Speaker, the government said, and not quite correctly, that his plan was working. The UN published a report last fall that said that Canada came 58th out of 63 countries on climate change. And he says everything's going well. What's worse, the PBO today confirmed the report, saying that the second Liberal carbon tax would cost the average Quebec family $436. In Montreal, 1 in 5 families doesn't have enough to afford food. The Honourable Minister of the Environment. Thank you, Mr. Speaker. I could cite a long list of independent organizations that have all said our plan is working and that our greenhouse gas emissions have started to decrease.
there's Equiterre, Eco-Justice, Environmental Defense. They've all publicly said that our climate change plan is starting to work. There's a lot of work still to be done. I'm the first to admit that. But the last thing we need is the Conservatives who would yank us back 20 years in time when it comes to dealing with climate change. The Honourable Member for Louis Saint Laurent. Mr. Speaker, 58th, the minister responsible for ranking us 58th, talked about Equiterre. Mr. Speaker, 30 years ago, he was the founder of Equiterre. And he sued the then Environment Minister, saying that his promises were all talk and no action. Who said that? The founder of Equiterre. The situation is troubling for Quebec families. They're going to have to pay $436 more. How are they supposed to be able to afford that? Sorry. I just have a quick comment. I'd like to remind members that when you refer to another member, you refer to them either by their title or by their riding name, not by a made-up title. I know people have a lot of imagination, but that's the rule. The Honourable Minister of the Environment. Thank you, Mr. Speaker. Allow me to cite a few quotes from experts. Alison Simard said that the Liberals' reduction plan would be beneficial from the Climate Action Network. The city of Quebec City is pleased with this plan. It's crucial to the future of our cities and future generations. So these are all allies of the Liberal government, not the Conservative Party. The Honourable Member for Mirabel. Mr. Speaker, there's an illegal landfill in Kanesatake that's been contaminating the drinking water of 1 million people for years. It's a complex problem that needs to be addressed. It's unacceptable to see the federal government abdicating its responsibilities and passing them off on the SQ. Enough of this buck passing. What's at stake is the drinking water of 1 million people. The federal government can't continue to let the situation degenerate. What's the Minister of the Environment doing about this urgent matter? The Honourable Environment Minister. Thank you, Mr. Speaker, and I'd like to thank my colleague for his question. I've had conversations with him about this, as has the minister, the Quebec minister responsible for Indigenous relations, and the federal ministers. It's a complex problem that we can't make simple. There's no simple solution to. Everyone has a role to play. The Band Council, the Quebec government through the SQ, and the federal government also has a role to play. We're in discussion with the Band Council and the Government of Quebec in order to find a sustainable solution to this problem. The Honourable Member for Mirabel. Mr. Speaker, the federal government should stop passing the buck and take the lead, show some leadership. In an interview on Radio-Canada, the Minister of Crown Indigenous Relations said, we have to let go of this idea that every time there's a few Indigenous people involved in an issue, it's the federal government's problem. Mr. Speaker, the community of Kanesatake is asking for help. So is HoC and the whole region. The federal government can proceed with the decontamination. So yes, this is very much the federal government's problem. When is Ottawa going to call the communities together to come up with a concrete, quick solution? The Honourable Minister of the Environment. Mr. Speaker, the only party who's passing the buck is the Bloc Québécois. I myself acknowledged yesterday in an interview with La Presse that the federal government had a role to play. We are going to play that role. Just yesterday, the Minister for Indigenous Services talked with the band leader. So we have our job to do. We will find a solution.
The Honourable Member for Cumberland Colchester.
Mr. Speaker, this Liberal government has now spent $3.5 million on vending machines for this Liberal government's failed unsafe supply experiment. These vending machines are dispensing hydromorphone, which is more potent than heroin. There are such machines, 3 of them in Vancouver and 1 in Victoria. And the sad reality, Mr. Speaker, is that opioid deaths have continued to increase. In the last 2 years, they have gone up 17%. When will the Minister of Addiction stop this failed experiment and give way to compassionate treatment for those suffering from addictions?
Hear, hear. The Honourable Minister for Mental Health.
Mr. Speaker, yet again, the failed Conservative policies surface where people, without harm reduction, people don't live long enough to get to treatment. Polarizing the difference between treatment and harm reduction is really, really unhelpful. We need all aspects of internationally accepted drug policy, prevention and education, harm reduction, treatment, as well as enforcement. Diversion is illegal.
The Honourable Member for Mission Metzke Fraser Canyon.
Thank you, Mr. Speaker. Since the decriminalization of hard drugs by the Liberals and NDP, we've seen a record number of opioid deaths in the province of British Columbia. Not only that, this government has failed to uphold its part of the agreement as it relates to the protection of children. Why has this government not done more to protect kids from exposure to crack pipes and needles at schools and parks across British Columbia, despite it still being illegal?
The Honourable Minister for Mental Health.
Mr. Speaker, I think every member of the House understands that the increase in opioid deaths is because the extraordinarily toxic drug supply that came in after the reduction of deaths in 2019 in British Columbia. So this is hugely important. The exemption that we have approved in British Columbia specifically says that playgrounds and areas attached to schools and daycares is not exempt, and that those must be enforced.
Member for South Surrey, White Rock.
Conservatives know that a healthy recovery is the answer to the captivity of addiction. 34,000 Canadians have died from opioids from 2016 to 2022 alone. Today, we're told Ottawa plans to join a BC class action, accusing its favorite $100 million consultant, McKinsey, that turbocharged opioid sales of reckless opioid marketing. This is a copycat of what Conservatives called for on March 14th. Why did it take this Liberal government 2 years after the U.S. settlement to sue McKinsey and Big Pharma?
The Honourable Minister for Mental Health.
Mr. Speaker, once again, the opposition is behind the times. It's been since 2018 that we have been working with British Columbia in the litigation against Big Pharma and those who enabled them. And we are part of the Purdue settlement in June. At our request, BC also amended their legislation to reinforce the federal government's participation in these class actions. Canada has also addressed pharma's predatory practices by further restricting the marketing of opioids and increasing maximum financial penalties.
The Honourable Member for Sudbury. Mr. Speaker, let's talk about the Conservatives' flip-flop on pollution pricing. In 2007, the Harper government proposed a $15 carbon tax. In 2008, the same government promised to introduce a cap-and-trade system. In 2011, they scrapped that idea, along with any and all other climate measures. And in the 2021 election, they came around on carbon pricing again. It's nonsense, Mr. Speaker. Can the Minister of the Environment and Climate Change please tell the House about the ambitious climate action our government is proposing to ensure a healthy environment? The Honourable Minister of the Environment. Thank you, Mr. Speaker, and I'd like to thank my honourable colleague for her question. When it comes to climate change, Canadians expect the government to take action, and that's precisely what we're doing. With a price on pollution that encourages industry to reduce emissions, an emissions reduction plan for all sectors of the economy, a cap-and-trade system for the gas sector, and a national climate change adaptation strategy. Meanwhile, It's been 250 days since the leader of the opposition became leader of the Conservative Party. And not only does he still have no climate plan, he continues to deny the climate crisis. The honourable member for Charlesbourg-Haut-Saint-Charles. Mr. Speaker, Quebec's Minister of Higher Education has called on universities to cancel partnerships with Huawei, which is a threat to Canada's security. And since it's a federal matter of national security, she also called on the Prime Minister to provide the provinces with guidance on Biden banning Huawei from provincial institutions. She's asked, but this Liberal government refuses to respond. Since the very beginning, the Prime Minister has been dragging his feet. But the danger's real. When will he give Minister Derry an answer?
Responsibility, federal and provincial governments, universities, and researchers. Now, in February, we made our position clear on the protection of Canadian research and intellectual property. We've introduced new and much more rigorous approaches to expect all partners to take similar measures as well. We'll continue working to promote an open and collaborative research system while safeguarding national security. Hear, hear.
The honourable member for Wellington, Halton Hills.
Mr. Speaker, the World Health Assembly will be meeting next week in Geneva. Taiwan had an exemplary response to the recent global COVID-19 pandemic and has much to contribute to pandemic preparedness and global health initiative. My question to the government, does Canada support Taiwan's participation at next week's World Health Assembly?
The Honourable Parliamentary Secretary.
Mr. Speaker, Canada reconfirms our support of Taiwan's meaningful participation in international organizations. Its absence would be detrimental to global interest. That's why we support Taiwan's participation in the World Health Assembly and the World Health Organization. Taiwan's participation would benefit both the people of Taiwan and those around the world. Mr. Speaker, we will continue to invest in our relationship with Taiwan while working to enhance peace and stability across the strait. Thank you, Mr. Speaker.
Honourable member for Wellington, Halton Hills.
Mr. Speaker, G7 leaders will meet this weekend in Hiroshima, Japan, where the nuclear bomb was first used. They are expected to meet survivors of that bomb. They are also expected to issue a joint statement on the use of nuclear weapons in light of Russia's threats against Ukraine and the West. Will the government take this opportunity at the G7 to urge our closest ally, the United States, to resume the strategic stability dialogue on nuclear weapons with Russia?
The Honourable Parliamentary Secretary.
Mr. Speaker, through you, I'd like to thank the honourable member for that very important question. I'd also like to thank Japan for prioritizing this as part of the G7. Canada believes in a world free of nuclear weapons, and the current arsenals around the world remain far too large. We call on Russia to fulfill its international obligations, including under the New START Treaty. Putin's rhetoric is dangerous and reckless. Russia needs to end their unjustified war and come to the table for peace talks. We will continue to work with our allies towards this very crucial goal. Thank you, Mr. Speaker.
The honourable member for Kitchener Centre.
Mr. Speaker, Ontario's Greenbelt is a crown jewel, protecting nearly 2 million acres of environmentally sensitive land. Yet, Doug Ford calls the Greenbelt a scam. It's clear he's working to parcel it off to his developer friends. We can't let him do that. What does the Minister of Environment think of Premier Ford calling the Greenbelt a scam, and will he stand up for the Greenbelt with every tool available?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I profoundly disagree with the characterization that the Premier of Ontario has made about the Greenbelt. Protecting green spaces so that our kids and grandkids can have access to green spaces, to clean air and clean water is no scam, Mr. Speaker. Working to ensure that our kids and grandkids continue to have a bright future is no scam, Mr. Speaker, and the federal government will use all of its available tools to ensure that we can continue protecting the lands in the Greenbelt, as well as jewels like the Rouge National Park. Thank you, Mr. Speaker.
Honourable member for Vancouver Kingsway.
A new report shows the number of Canadian teenagers regularly vaping is now shockingly among the highest in the world. This puts the health and lives of youth at great risk, and experts say it is Liberal inaction fueling this growing crisis. The government's refusal to take on big tobacco is allowing them to use flavored products to hook a new generation of Canadians. Why are Liberals standing back while big tobacco uses flavors like cotton candy to lure teenagers to become addicted to nicotine?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'm glad and grateful for this question. We have indeed met with a number of key stakeholders in the area, including this morning the Canadian Cancer Society. We are grateful for all of their input. We know how tremendous the impact of vaping and smoking is in our society, including for younger Canadians and youth, and that's why we have already put into place strong regulations over the last few years on packaging, publicity and content of vaping products, and we'll be doing more.
The Honourable Member for Saanich Gulf Islands.
Thank you, Mr. Speaker. Moments ago, the Minister of Environment said he'll use every tool available to the federal government. Those tools are lying idle while Doug Ford revs up the bulldozers. We know that we could use endangered species legislation, look at impact assessment, but probably the strongest tool is the international, legally binding agreement of the Great Lakes Annex to prohibit the movement of water within the Great Lakes from basin to basin. 8 U.S. states, 2 Canadian provinces, and 2 federal governments stand behind that annex. When will the federal government stand up and demand that the Ontario government, under whose signature Mike Harris signed that accord, will live up to its terms?
The Honourable Minister of the Environment.
Speaker, as the member well known, we can use the Species at Risk Act once projects are being proposed. No such projects have been proposed so far, but we have already started an impact assessment review of the impacts of said development on the Rouge National Park. We did not wait. We're already acting, and we're looking at other areas of Ontario where we could launch similar studies to look at what the impacts of dezoning the Greenbelt lands could be on federal protected lands. Thank you, Mr. Speaker.
I'm afraid that's all the time we have today for the questions. I wish to draw the attention of the members to the presence in the gallery of the 2023 Killam Prize laureates, which are awarded to Canadian scholars who have distinguished themselves through sustained research, excellence in science and innovation. We have Mr. Peter Kulas, A.J. Hebley, Praveen Jain, Sarah Otto, et Charles M. Morin. Nous avons un rappel au règlement.
Point of order. The Honourable Member for Louis Saint-Laurent. Mr. Speaker, I feel that you're going to have unanimous consent from this House for the tabling of the report of PROC, which contains $436 more. I believe that there will not be any unanimous consent. I know that the member is very surprised at that, but that's the way it is. Point of order.
Member for Danforth.
Correct.
Yeah.
Mr. Speaker, during question period, the member for Calgary Forest Lawn referred to the Minister of Environment and Climate Change in a derogatory way, and calling someone names like that is unparliamentary. I would ask that the member opposite withdraw that comment and apologize.
We'll take a look at Hansard and see what happened, and then we'll come back to the House should I see it necessary. It being 3:10, pursuant to order made on Thursday, June 23rd, 2022, the House will now proceed to the taking of the deferred recorded division on the amendment of Mr. Culkins to the motion at third reading stage of Bill C-21. Convoquez les députés.
Call in the members.
La question est la suivante.
The question is as follows.
By Mrs. Fortier, move that Bill C-21, an act to amend certain acts and to make certain consequential amendments, firearms, be now read a third time and do pass. Monsieur Calkin, appuyé par...
Mr. Calkins, seconded by Mr. Bazan, moves that the motion be amended by deleting all the words after the word that and substituting the following.
To amend certain acts and to make certain... May I dispense? No? Okay. Bill C-21, an act to amend certain acts and to make certain consequential amendments, firearms, be not now read a third time, but be referred back to the Standing Committee on Public Safety and National Security for the purpose of reconsidering Clause 0.1, 1.1, and 17 for the view to ensure that the government cannot take away hunting rifles from law-abiding farmers, hunters, and Indigenous peoples. La période de...
The 10-minute period for members voting electronically has started, and the House will now proceed to the vote for members participating in person.
In favor of the amendment will please rise.
Mr. Bazan.
Mr. Bazan.
Mr. Commit.
Mr. Commit.
Monsieur Deltel.
Monsieur Deltel.
Ms. Lewis Haldeman Norfolk.
Ms. Lewis Haldeman Norfolk.
Mr. Straw.
Mr. Straw.
Ms. Dancho.
Ms. Dancho.
Mr. Barlow.
Mr. Barlow.
Mrs. Gray.
Mrs. Gray.
Mr. Moore.
Mr. Moore.
Mr. Baldinelli.
Mr. Baldinelli.
Mr. Mazer.
Mr. Mazer.
Mr. Lewis Essex.
Mr. Lewis Essex.
Mr. Jennis.
Mr. Jennis.
Mr. Seaback.
Mr. Seaback.
Mr. Small.
Mr. Small.
Mr. Ellis.
Mr. Ellis.
Monsieur Berthold.
Monsieur Berthold.
Mrs. Stubbs.
Mrs. Stubbs.
Mr. Tucker.
Mr. Tucker.
Ms. Findley.
Ms. Findley.
Mr. Chong.
Mr. Chong.
Mrs. Cramp-Nyman.
Mrs. Cramp-Nyman.
Ms. Ferrari.
Ms. Ferrari.
Mr. Schmale.
Mr. Schmale.
Mr. Vidal.
Mr. Vidal.
Mr. Perkins.
Mr. Perkins.
Mr. Davidson.
Mr. Davidson.
Mr. Kelly.
Mr. Kelly.
Mr. Viss.
Mr. Viss.
Mr. Cooper.
Mr. Cooper.
Monsieur Martel.
Monsieur Martel.
Mrs. Roberts.
Mrs. Roberts.
Mr. Morantz.
Mr. Morantz.
Mr. Malillo.
Mr. Malillo.
Mr. Van Popta.
Mr. Van Popta.
Mr. Lobb.
Mr. Lobb.
Mr. Kitchen.
Mr. Kitchen.
Mr. Muse.
Mr. Muse.
Mr. Redicott.
Mr. Redicott.
Mr. Waugh.
Mr. Waugh.
Mr. Steinley.
Mr. Steinley.
Mr. Lawrence.
Mr. Lawrence.
Monsieur Lou.
Monsieur Lou.
Mr. Cram.
Mr. Cram.
Mrs. Wagenthal.
Mrs. Wagenthal.
Mr. Couric.
Mr. Couric.
Mr. Carey.
Mr. Carey.
Mr. McLean.
Mr. McLean.
Mr. Patzer.
Mr. Patzer.
Mr. Macaulay Edmonton West.
Mr. Macaulay Edmonton West.
Monsieur d'Entremont.
Mr. d'Entremont.
Mr. Morrison.
Mr. Morrison.
Mr. Dalton.
Mr. Dalton.
Mr. Bragdon.
Mr. Bragdon.
Mr. Soroka.
Mr. Soroka.
Mr. Ruff.
Mr. Ruff.
Mr. Shields.
Mr. Shields.
Mr. Fast.
Mr. Fast.
All those opposed to the amendment will please rise.
Mr. Sajan.
Mr. Sajan.
Mr. Blair.
Mr. Blair.
Ms. Bennett.
Ms. Bennett.
Monsieur Duclos.
Monsieur Duclos.
Ms. Tassi.
Ms. Tassi.
Madame Petitpas-Taylor.
Madame Petitpas-Taylor.
Monsieur Serré.
Monsieur Serré.
Ms. Jazek.
Ms. Jazek.
Mr. Casey.
Mr. Casey.
Ms. Cara.
Ms. Cara.
Monsieur McKinnon-Gatineau.
Monsieur McKinnon-Gatineau.
Monsieur Dubourg.
Monsieur Dubourg.
Madame Bendayan.
Madame Bendayan.
Ms. Demoff.
Ms. Demoff.
Monsieur Lauzon.
Monsieur Lauzon.
Mrs. Vandenbelt.
Mrs. Vandenbelt.
Madame Brière.
Madame Brière.
Mr. Biddle.
Mr. Biddle.
Mr. Fillmore.
Mr. Fillmore.
Mrs. Romanado.
Mrs. Romanado.
Mr. Lamoureux.
Mr. Lamoureux.
Ms. Sahoda.
Ms. Sahoda.
Mr. Varani.
Mr. Varani.
Monsieur Fergus.
Monsieur Fergus.
Mr. Oliphant.
Mr. Oliphant.
Mr. Ananda Sangari.
Mr. Ananda Sangari.
Madame Koutrakis.
Madame Koutrakis.
Madame Lalonde.
Madame Lalonde.
Ms. Dillon.
Ms. Dillon.
Monsieur El Khoury.
Monsieur El Khoury.
Mr. Hardy.
Mr. Hardy.
Mr. Vancouverden.
Mr. Vancouverden.
Mr. Fisher.
Mr. Fisher.
Ms. O'Connell.
Ms. O'Connell.
Mr. May Cambridge.
Mr. May Cambridge.
Mr. Cedar Brampton East.
Mr. Cedar Brampton East.
Ms. Suds.
Ms. Suds.
Mr. Fragascatos.
Mr. Fragascatos.
Mr. Longfield.
Mr. Longfield.
Mr. Maloney.
Mr. Maloney.
Mr. McDonald Avalon.
Mr. McDonald Avalon.
Madame Shanahan.
Madame Shanahan.
Ms. Yip.
Ms. Yip.
Mr. Aldag.
Mr. Aldag.
Mr. Pulowski.
Mr. Pulowski.
Mr. Turnbull.
Mr. Turnbull.
Madame Mendez.
Madame Mendez.
Monsieur Zuberi.
Monsieur Zuberi.
Mr. Ali.
Mr. Ali.
Ms. Bradford.
Ms. Bradford.
Mr. Collins, Hamilton East, Stony Creek.
Mr. Collins, Hamilton East, Stony Creek.
Mr. Koto.
Mr. Koto.
Mr. Gahir.
Mr. Gahir.
Ms. Kayabaga.
Ms. Kayabaga.
Madame Lapointe.
Madame Lapointe.
Mr. Miao.
Mr. Miao.
Mrs. Valdez.
Mrs. Valdez.
Mr. Sousa.
Mr. Sousa.
Monsieur Terrien.
Monsieur Terrien.
Madame Normandin.
Madame Normandin.
Monsieur Bergeron.
Monsieur Bergeron.
Monsieur Garon.
Monsieur Garon.
Monsieur Desilets.
Monsieur Desilets.
Madame de Bellefeuille.
Madame de Bellefeuille.
Madame Michaud.
Madame Michaud.
Madame Vignola.
Madame Vignola.
Madame Gaudreau.
Madame Gaudreau.
Madame Larouche.
Madame Larouche.
Monsieur Perron.
Monsieur Perron.
Monsieur Barcelo Duval.
Monsieur Barcelo Duval.
Monsieur Beaulieu.
Monsieur Beaulieu.
Madame Saint-Clair Desgagnés.
Madame Saint-Clair Desgagnés.
Monsieur Trudel.
Monsieur Trudel.
Madame Desbiens.
Madame Desbiens.
Madame Bérubé.
Madame Bérubé.
Mr. Massey.
Mr. Massey.
Mr. Backrack.
Mr. Backrack.
Mr. Blakey.
Mr. Blakey.
Ms. Kwan.
Ms. Kwan.
Mr. Garrison.
Mr. Garrison.
Ms. Idlout.
Ms. Idlout.
Mr. Johns.
Mr. Johns.
Mr. McGregor.
Mr. McGregor.
Madame Hughes.
Madame Hughes.
Ms. Zarillo.
Ms. Zarillo.
Ms. Matheson.
Ms. Matheson.
Mr. Desjardins.
Mr. Desjardins.
Mr. Morris.
Mr. Morris.
The House will now wait for the electronic voting period to end before resuming its proceedings. Je désire informer la
I wish to inform the House that the electronic voting period has ended.
If members were not able to vote due to technical difficulties, they may now use the raise hand function and the chair will recognize them. Mr. Scarpaleggia.
Monsieur le Président, on m'a demandé de vérifier que mon vote a été enregistré.
Mr. Speaker, I was asked to check whether my vote against was recorded. Yes, the vote against was recorded.
Thank you, Mr. Speaker. I vote nay.
I believe
you're on mute, Mr. Sheehan.
No, we heard it.
Oh.
Mr. Sheehan, nay contre.
Okay, seeing no more, the table will now compile the results of the vote.
Yeas pour 109, 109. Nays contre 209, 209.
I declare the amendment defeated. The next question is on the main motion. La question.
The question is as follows. Mr. Mendocino, seconded by Mrs. Fortier, moved that Bill C-21, an act to amend certain acts and to make certain consequential amendments, firearms, be now read a third time and do pass.
If a member of a recognized party in the House wishes that the motion be carried or carried on division or wishes to request a recorded division, I would invite them to rise and indicate it to the chair. The Honourable Member for Charles 1.
I request a recorded division.
The 10-minute period for members voting electronically has started, and the House will now proceed to the vote for members participating in person.
All those in favor of the motion will please rise.
Mr. Sajan.
Mr. Sajan.
Mr. Blair.
Mr. Blair.
Ms. Bennett.
Ms. Bennett.
Monsieur Duclos.
Monsieur Duclos.
Ms. Tassi.
Ms. Tassi.
Madame Petitpas-Taylor.
Madame Petitpas-Taylor.
Monsieur Serré.
Monsieur Serré.
Ms. Jazek.
Ms. Jazek.
Mr. Casey.
Mr. Casey.
Ms. Cara.
Ms. Cara.
Monsieur McKinnon-Gatineau.
Monsieur McKinnon-Gatineau.
Monsieur Dubourg.
Monsieur Dubourg.
Madame Bendayan.
Madame Bendayan.
Ms. Demoff. Mrs. Vandenbeld.
Ms. Vandenbeld.
Madame Brière.
Madame Brière.
Mr. Biddle.
Mr. Biddle.
Mr. Fillmore.
Mr. Fillmore.
Mrs. Romanado.
Mrs. Romanado.
Mr. Lamoureux.
Mr. Lamoureux.
Ms. Sahota.
Ms. Sahota.
Mr. Varani.
Mr. Varani.
Monsieur Fergus.
Mr. Fergus.
Mr. Oliphant.
Mr. Oliphant.
Mr. Ananda Sangari.
Mr. Ananda Sangari.
Madame Koutrakis.
Madame Koutrakis.
Madame Lalonde.
Madame Lalonde.
Ms. Dillon.
Ms. Dillon.
Monsieur El-Khoury.
Monsieur El-Khoury.
Mr. Hardy.
Mr. Hardy.
Mr. Van Couverden.
Mr. Van Couverden.
Mr. Fisher.
Mr. Fisher.
Ms. O'Connell.
Ms. O'Connell.
Mr. May Cambridge.
Mr. May Cambridge.
Mr. Sidhu Brampton East.
Mr. Sidhu Brampton East.
Mrs. Suds.
Ms. Suds.
Mr. Fragascatos.
Mr. Fragascatos.
Mr. Longfield.
Mr. Longfield.
Mr. Maloney.
Mr. Maloney.
Mr. McDonald Avalon.
Mr. McDonald Avalon.
Madame Shanahan.
Madame Shanahan.
Ms. Yip.
Ms. Yip.
Mr. Pulowski.
Mr. Pulowski.
Mr. Turnbull.
Mr. Turnbull.
Madame Mendez.
Madame Mendez.
Monsieur Zuberi.
Monsieur Zuberi.
Mr. Ali.
Mr. Ali.
Ms. Bradford.
Ms. Bradford.
Mr. Collins, Hamilton East, Stony Creek.
Mr. Collins, Hamilton East, Stony Creek.
Mr. Koto.
Mr. Koto.
Mr. Gahir.
Mr. Gahir.
Ms. Kayabaga.
Ms. Kayabaga.
Madame Lapointe.
Madame Lapointe.
Mr. Miao.
Mr. Miao.
Mrs. Valdez.
Mrs. Valdez.
Mr. Sousa.
Mr. Sousa.
Monsieur Terrien.
Monsieur Terrien.
Madame Normandin.
Madame Normandin.
Monsieur Bergeron.
Monsieur Bergeron.
Monsieur Garon.
Monsieur Garon.
Monsieur Désilé.
Monsieur Désilé.
Madame de Bellefeuille.
Madame de Bellefeuille.
Madame Michaud.
Madame Michaud.
Madame Vignola.
Madame Vignola.
Madame Gaudreau.
Madame Gaudreau.
Madame Larouche.
Madame Larouche.
Monsieur Perron.
Monsieur Perron.
Monsieur Barcelot-Duval.
Monsieur Barcelot-Duval.
Monsieur Beaulieu.
Monsieur Beaulieu.
Monsieur Lemire.
Monsieur Lemire.
Madame Saint-Clair-Desgagnés.
Madame Saint-Clair-Desgagnés.
Monsieur Trudel.
Monsieur Trudel.
Madame Desbiens.
Madame Desbiens.
Madame Berruet.
Madame Berruet.
Mr. Massey.
Mr. Massey.
Mr. Backrack.
Mr. Backrack.
Mr. Blakey.
Mr. Blakey.
Ms. Kwan.
Ms. Kwan.
Mr. Garrison.
Mr. Garrison.
Ms. Idlout.
Ms. Idlout.
Mr. Johns.
Mr. Johns.
Mr. McGregor.
Mr. McGregor.
Madame Hughes.
Madame Hughes.
Ms. Zarillo.
Ms. Zarillo.
Ms. Matheson.
Ms. Matheson.
Mr. Desjardins.
Mr. Desjardins.
Mr. Morris.
Mr. Morris.
All those opposed to the motion will please rise.
Mr. Bazan.
Mr. Bazan.
Mr. Kimmich.
Mr. Kimmich.
Monsieur Deltel.
Monsieur Deltel.
Ms. Lewis Haldeman Norfolk.
Ms. Lewis Haldeman Norfolk.
Mr. Straw.
Mr. Straw.
Ms. Dancho.
Dancho.
Mr. Barlow. Mrs. Gray. Mr. Moore.
Mr. Moore.
Mr. Baldinelli.
Mr. Baldinelli.
Mr. Mazer.
Mr. Mazer.
Mr. Lewis Essex.
Mr. Lewis Essex.
Mr. Seaback.
Mr. Seaback.
Mr. Small.
Mr. Small.
Mr. Ellis.
Mr. Ellis.
Monsieur Berthold.
Monsieur Berthold.
Mrs. Stubbs.
Mrs. Stubbs.
Mr. Tucker.
Mr. Tucker.
Ms. Findley.
Ms. Findley.
Mr. Chong.
Mr. Chong.
Mrs. Cramp-Nyman.
Mrs. Cramp-Nyman.
Ms. Ferrari.
Ms. Ferrari.
Mr. Schmale.
Mr. Schmale.
Mr. Vidal.
Mr. Vidal.
Mr. Perkins.
Mr. Perkins.
Mr. Davidson.
Mr. Davidson.
Mr. Kelly.
Mr. Kelly.
Mr. Viss.
Mr. Viss.
Mr. Cooper.
Mr. Cooper.
Monsieur Martel.
Monsieur Martel.
Mrs. Roberts.
Mrs. Roberts.
Mr. Morantz.
Mr. Morantz.
Mr. Melillo.
Mr. Melillo.
Mr. Van Popta.
Mr. Van Popta.
Mr. Lobb.
Mr. Lobb.
Mr. Kitchen.
Mr. Kitchen.
Mr. Muse.
Mr. Muse.
Mr. Redicott.
Mr. Redicott.
Mr. Waugh.
Mr. Waugh.
Mr. Steinley.
Mr. Stanley.
Mr. Lawrence.
Mr. Lawrence.
Monsieur Lou.
Monsieur Lou.
Mr. Cram.
Mr. Cram.
Mrs. Wagenthal.
Mrs. Wagenthal.
Mr. Currick.
Mr. Currick.
Mr. Carey.
Mr. Carey.
Mr. McLean.
Mr. McLean.
Mr. Patzer.
Mr. Patzer.
Mr. Macaulay Edmonton West.
Mr. Macaulay Edmonton West.
Monsieur d'Entremont.
Monsieur d'Entremont.
Mr. Morrison.
Mr. Morrison.
Mr. Bragdon.
Mr. Bragdon.
Mr. Soroka.
Mr. Soroka.
Mr. Ruff.
Mr. Ruff.
Mr. Shields.
Mr. Shields.
Mr. Fast.
Mr. Fast.
The House will now wait for the electronic voting period to end before resuming proceedings. I wish to inform the House that the electronic voting period has ended. Si des députés n'ont pas pu voter en raison de problèmes techniques, ils peuvent maintenant activer.
If members were unable to vote because of technical problems.
If members were not able to vote due to technical difficulties, they may now use the raise hand function and the chair will recognize them.
Mr. Sheehan.
Monsieur President.
Mr. Speaker, I vote for.
Mr. Sheehan, yea pour.
Seeing no more, the table will now compile the results of the vote.
Yeas pour, 207, 207. Nays contre, 113, 113.
I declare the motion carried. Okay, we have 2 points of order so far. We'll start with Milton, then go over to London Fanshawe. The honourable member for Milton.
Mr. Speaker, addictions is a complex issue, and the deadly opioid epidemic, which has been fueled by a poison drug supply, requires a compassionate, evidence-based approach to save lives. Recently, members of the Conservatives, including the MPs for Saskatchewan,
is there a standing order that's being contravened? If you can start with that and then prove why, that would be wonderful.
Mr. Speaker, I believe that we can disagree on policy matters without resorting to derogatory name-calling and referring to other members as murderers.
Okay, that's a good point to bring up. What the honourable member is saying that we don't call each other names in this chamber, and I want to remind everyone not to call each other names, and the term that he referred to, as far as I'm concerned, is a name. Oh, excuse, est-ce que il manque?
Oh, I'm sorry. Is there a problem with interpretation?
Est-ce que ça...
Is it working?
Start? Okay, it started again. I just want to say that the honourable members brought up a point that's very valid. Calling each other names does not lead to good debate. It's more basically of a schoolyard type of action that we don't want to have in the chamber. So I want to remind both sides, for the rest of this very emotional debate that takes place tonight, or whatever debate we have in the House, not to call each other names. I mean, and making up names for each other is, I mean, I'm sure you do it with affection for each other, but no, it's not allowed in the chamber. It's not something that's allowed. I want to thank the honourable member for Milton for bringing that up. It's and the honourable member for London Fanshawe.
Thank you, Mr. Speaker. It's in relation to the past vote that just occurred. Apparently, there were 2 members who voted with their app, but no photo appeared. So we would like clarification on how that is ruled in terms of the validity of their vote, just for future context as well. But it was the member for Fredericton and the member for Prince George, Peace River, Northern Rockies. Thank you, Mr. Speaker.
In consulting with the table, normally it has to be brought up before the results are announced. So, I mean, it's just, that's why the whips have the information, and they're supposed to get back to us with that. But what we're going to do is look into it and find out exactly what was there. But in future, if someone's photo was not clear, I would ask them to bring it up as soon as we stop, because once I stop, I'll ask if there was any well, we usually go to the next step, which is asking for the results of the vote, and that's normally when it would be brought up during question period, or during the vote. Okay, let's go.
With the current rules, a period where it's possible for each whip to signal to the chair and to signal to the House the problems that have come up during the vote. So those problems should have been raised during the period when you asked members if there were problems during the vote. I think the rules are very clear on that. Thank you. You said it much more eloquently than I did. Thank you very much. And now I hear some noise from the other side. I don't know if it's in the hallways or if it's in the ante-chambers. It seems to have gotten quieter.
Inform the House that because of the deferred recorded division, government orders will be extended by 26 minutes. And I believe we have the Thursday question.
The Honourable Member for Mégantic-L'Érable. Thank you. Thank you very much, Mr. Speaker. Mr. Speaker, as we look forward to a week in our ridings, after a marathon of 5 weeks, we've sat several times until midnight. I think that we can salute the work that's been done and the effort that we've put in on behalf of our voters in our ridings. I would like to ask the Government House Leader to tell us not what we're expecting for tomorrow, because tomorrow we will already be, most of us, back home in our ridings. But for the week, when we come back from our ridings, will we have some work to do? Will we have sufficient resources in the House for committees? Will we have sufficient resources to make sure we get our work done? And in particular, what is the government planning for this House to do upon our return? Thank you. The Honourable Minister of Official Languages. Thank you very much, Mr. Speaker. Mr. Speaker, when we return on Monday following the constituency week, we will call third reading debate of Bill S5, which amends the Canadian Environmental Protection Act. Tuesday and Thursday will be opposition days. Wednesday, we will resume second reading debate of Bill C42 concerning the Canada Business Corporation Act. For Friday, we will commence debate of Bill C40, the Miscarriage of Justice Review Commission Act, also known as the David and Joyce Milgaard's Law. Mr. Speaker, I would also like to take this opportunity to inform members that we have posted the notice of opportunity for the position of Law Clerk and Parliamentary Counsel to the House of Commons. I would encourage members to help disseminate this notice to ensure that we have a permanent Law Clerk in place as soon as possible to support the important work we do as parliamentarians.
When we return on Monday following the constituency week, we will call third reading debate of Bill S5, which amends the Canadian Environmental Protection Act. Tuesday and Thursday will be opposition days. And again, we've done the process in French and English. So with that, I would like to wish all of my parliamentarians a wonderful constituency week, as I know that we're going to be busy in our ridings. Thank you so much, Mr. Speaker.
I'm now ready to... another point of order. The Honourable Member for Grey Bruce. Bring her on, Bruce. I was close.
Thank you, Mr. Speaker. I don't bring points of order up very often, but I just had a phone call from the member from Prince George, Peace River, and the Northern Rockies, and there was a little confusion about his vote, I guess, with the picture not coming up on his mobile app, but he's in his riding, and he's participating in the fires that are up there, and so I think it's already clear how his vote was recorded as a no, but just a little context as to why it maybe was a bit of a problem in his geography.
Yeah, we already said that we would look into it, and we'll get back to the House with some kind of an answer on that. Very good. The honourable member, or the honourable minister for official languages is rising on a point of order.
Mr. Speaker, I forgot to mention a part of the important work for next week, so if you would allow me to continue, as I want to make sure all the members of the House are fully aware of the work when we return. So finally, as I indicated, pursuant to Standing Order 81.4, I would like to designate Monday, May 29th for consideration in Committee of the Whole of all votes under the Department of Finance in main estimates for the fiscal year ending March 31st, 2024. Furthermore, Mr. Speaker, in relation to this upcoming debate, I would like to ask for unanimous consent to adopt the following motion: that notwithstanding any standing order, special order, or usual practice of the House during the debate on the business of supply, pursuant to Standing Order 81.4 on Monday, May 29, 2023. A, the time provided for consideration of the main estimates in Committee of the Whole be extended beyond 4 hours as needed to include a minimum of 16 periods of 15 minutes each. B, members rising to speak during the debate may indicate to the chair that they will be dividing their time with one or more other members. And C, no quorum calls, dilatory motions, or requests for unanimous consent shall be received by the chair. Thank you, Mr. Speaker.
All those opposed to the honourable minister moving the motion will please say nay. Agreed. The House has now heard the terms of the motion. All those opposed to the motion will please say nay. Carried. I'm now prepared to rule on the point of order raised yesterday, May 17, 2023, by the Parliamentary Secretary to the Government House Leader regarding an amendment adopted by the Standing Committee of Foreign Affairs and International Development during the clause-by-clause consideration of Bill C-281, an act to amend the Department of Foreign Affairs, Trade and Development Act, the Justice of Victims of Corrupt Foreign Officials Act, Sergei Magnitsky Law, the Broadcasting Act, and the Prohibiting Cluster Munitions Act. The Parliamentary Secretary explained that the committee adopted an amendment to Clause 2 of the bill that creates a new obligation on the minister to develop and maintain a government-wide international human rights strategy. According to the Parliamentary Secretary, this amendment proposes a new concept that exceeds the scope of the bill as adopted at second reading. The Parliamentary Secretary argued that for this reason, the amendment in question should be struck from the bill as reported by the committee.
When this amendment was proposed at the Standing Committee on Foreign Affairs and International Development, the committee chair ruled the amendment inadmissible on the grounds that it was beyond the scope of the bill. The decision was challenged and overturned. The committee then debated the amendment and adopted it. When considering legislation, the House and its committees are guided by specific procedural rules that have been long established. In relation to the scope of a bill, House of Commons Procedure and Practice, 3rd edition, states the following on page 770, and I quote, "An amendment to a bill that was referred to a committee after second reading is out of order if it is beyond the scope and principle of the bill," unquote.
C-281 does amend several acts, and it does create certain new obligations on the minister in relation to human rights. However, after a close reading of the bill, the new responsibilities for the minister are limited to specific areas, including communicating with families of prisoners of conscience and producing formal response to House and Senate committees.
After careful consideration, it is the opinion of the chair that the amendment creates a new obligation requiring the designated minister to develop and maintain a government-wide international human rights strategy. The chair of the committee correctly concluded that the amendment is beyond the scope of the bill, as it introduced a new concept not envisioned in the bill when it was adopted by the House at second reading. When a committee considers a bill at clause by clause, the committee chair must ensure that the proceedings on the bill conform to the procedural rules governing the consideration of amendments to bills. This includes ensuring that the committee's review of the bill falls within the scope and principle as established by the House at second reading.
When a committee fails to adhere to the will of the House as it pertains to bills, they overstep their authority as delegated to them by the House. Speaker Milliken said it well when on May 11, 2010, on page 2650 of the debates, he explained, and I quote, "As has been frequently noted, the Speaker's involvement in committee matters is limited, except in cases where a committee has exceeded its authority. The adoption of amendments that are beyond the scope of a bill is such a case. While some members may be of the opinion that a different bill, perhaps broader in scope, ought to have been introduced, I might base my decision on the bill that actually was introduced and approved by the House at the second reading," unquote. As such, the chair rules the amendment adopted by the Standing Committee on Foreign Affairs and International Development null and void, and order that it no longer form part of the bill as reported by the committee. The chair also orders a reprint of the bill at the earliest opportunity for the House by the House in its consideration of consequent stages of the bill. However, given that the House is scheduled to consider Bill C-281 at report stage later this day, so as not to disrupt the business currently before the House, report stage will proceed based on the version of the bill as reported back from committee, with the understanding that when the bill will be reprinted, the text of the inadmissible amendment in question at Clause 2 will not be included. I thank the members for their attention. Merci. Orders of the day.
Government orders, government bills, business of supply. Resuming debate on the opposition motion concerning the opioid crisis, standing in the name of Mr. Poilievre.
The honourable member for Yukon has 3 minutes and 45 seconds remaining for questions. Questions et commentaires. Questions and comments.
The honourable member for Beauport-Limoilou. Thank you, Mr. Speaker. Right now, with the motion that we have before us today, I have the impression that everybody's trying to pull the covers to their side of the bed. When I taught, I used an image of a book where if I described one side of the cover and somebody described the other side of the cover, we would have different descriptions. But at the end of the day, it's what's between the two covers that's important. And here, the goal is to find and to put in place every possible measure to help people who have an addiction, whether that be with services, whether that be with protected spaces, whether that be with safe doses. I would like to hear my colleagues speak about the importance of the health transfers to make sure that we have adequate services to those who are dealing with addictions.
I'm for Yukon.
Merci, merci.
Thank you. Thank you to my colleague for the question. And it's a very important question, and I am very happy that we are currently putting in place the bilateral agreements with the provinces and territories, including with my territory of Yukon. And I would also like to assure this House that mental health services and addiction services are a priority in those bilateral agreements. Thank you.
Questions and comments? Questions et commentaires? The Honourable Member for Nunavut.
And I'd like to thank the member for his intervention. I do appreciate the willingness that he's to provide to make sure that more Indigenous peoples get the supports that they need. A couple of weeks ago, I met with the Kluane First Nations, who's been seeking supports and assistance from the federal government for quite a few years now, and I wonder if the member could help describe what supports are being made in this kind of area for places like Kluane First Nations.
The Honourable Member for Yukon.
Thank you, and I really thank my Nunavut colleague for her question, and it's a very important one given the disproportionate impact that First Nations people in Yukon are feeling from the toxic drug crisis. I am in conversation with Kluane First Nation and many others to help support their needs and their requests, such as on-the-land treatment, more wraparound social supports, including mental health counseling availability, but also on prevention. So the territorial government is also involved in these discussions. Thank you.
Resuming debate, the Honourable Member for Richmond Centre.
Thank you, Madam Speaker. I rise today in this chamber to speak on this motion. In my riding community of Richmond Centre, I've heard many heartbreaking incidents. Michael, an artist, an empath, and a gentle, compassionate young individual, was passed away at age 26 from a tainted supply of drugs. Curtis was an intelligent, caring, and adventurous person, was 36 when he passed away from drug overdoses and poisoning. Madam Speaker, there are countless incidents like these happen in British Columbia and across Canada. And it breaks my heart to see mothers, fathers, friends, and families lose their loved one so dearly. Last year in Richmond, 29 people died of drug poisoning, and 2,314 died in British Columbia. Madam Speaker, on CBC News today, it says in British Columbia, 206 people suspected to have died of toxic drugs in April alone this year. Let's talk about the link between mental health and substance use. We know that mental health and substance use is something that is affecting more and more Canadians, and it's something that requires collaboration across all levels of government, as well as other partners in our community. And it is for that reason, in 2021, Canada's first ever Ministry of Mental Health and Addictions was created and showed the interconnected nature of mental health with substance use. It has also highlighted our government's commitment to take action through an integrated approach on these issues, which have significantly impacted individuals, their families, and communities. It is important to stress that mental illness and substance use often go hand in hand. People with mental illness are twice as likely to have a substance use disorder compared to the general population. Substance use can also increase the underlying risk of mental health issues and can exacerbate the symptoms of existing mental health issues. In fact, 50% of people in treatment for substance use also live with mental illness. We know that childhood trauma, low income, lack of access to stable housing, discrimination, racism, and the historical and ongoing effect of colonization and the residential school system on Indigenous community all plays a major factor. There are many challenges faced by Canadians experiencing mental illness and harm from substance use. These include a lack of available services and support close to home, care that is not comprehensive or responsive to an individual's needs, and the experience of stigma and discrimination both in seeking care and in society. Youth and young adults, Indigenous people, Black Canadians, and those identifying as LGBTQ2+S+, are amongst those Canadians impacted the most. As a result of unmet or under-addressed mental health and substance use needs, individuals and communities face significant health, social, and economic burdens. This includes paying out-of-pocket services, increased emergency department visits, and public safety concerns. Our government has long recognized that Canadians with mental health and substance use needs require ongoing support to meet a complexity of needs. We have seen the record on Conservative on this issue. They will stand up in the chamber using stigmatizing language to try and play politics with this issue and act like they aren't misleading Canadians with a biased or one-sided perspective on this crisis. Canadians have spoken on complexity of these mental health and substance use issues and how often they are interconnected with other social issues such as homelessness. For example, we know that up to 75% of women experiencing homelessness also experience mental illness. In British Columbia, 67% of people experiencing homelessness or housing instability identify substance use issues, and 51% identify a mental health as a concern. Accessing appropriate housing options that provide ready access to needed wraparound supports can be a significant challenge due to the housing shortage and maintenance issues with existing housing, insufficient community base, trained provider capacity, and silos between health, housing, and social sectors. This is why our government is investing in affordable housing for Canadians, including $4 billion through the Rapid Housing Initiative, aimed at quickly creating new affordable housing for individuals who have severe housing needs and are at risk of being homeless. Ensuring Canadians have access to housing, social support, and the health service they need is a major preoccupation of municipal and community leaders. Our government is working with them and with the province and territories to break down silos so Canadians can have access to the integrated support they need. We are also committed to working with Indigenous government and communities to support access to a comprehensive range of evidence-based, culturally appropriate, and trauma-informed service and supports needed to support mental health and substance use issues individuals are facing, including opioid overdose crisis and advanced whole of society approach to these issues. Through the Mental Wellness Program, Indigenous Service Canada is providing support for substance use prevention, harm reduction, treatment, and aftercare psychosocial wraparound service, and trauma-informed health support to Indigenous community. In addition, our government has provided targeted support for innovative, community-based projects that address mental health and substance use issues. The opposition members will stand up and say that the government is not putting resources into treatment, but yet, since 2017, we have invested more than $400 million in over 380 projects through the Substance Use and Addiction Program to support community-based organizations. In 2018, our government committed $150 million over 5 years to address the opioid crisis through the Emergency Treatment Fund, which also had cost match funds by province and territories, over $300 million in funding for substance use treatment across Canada. This shows how much we are putting into treatments and how we should not be taking lessons from a party that wants to revert us back to Harper-era policies. Tackling the opioid overdose crisis requires a holistic and integrated approach that focuses on mental health and well-being. And this is what this government has been doing so that Canadians have been resilient and healthy now and into the future. Enough is enough. We won't be able to bring loved ones home if they're dead from toxic supplies. Madam Speaker, this is a fight that we must triumph. This is a nonpartisan issue, and we will prevail with collaboration with provinces and territories, municipalities, and local community organizations such as, in my riding, Richmond Addiction Service Society, Turning Point Recovery Society, and Pathway Clubhouse. And I want to thank the Minister of Mental Health and Addictions for her continuous championship on this matter, and all the first responders, frontline, and healthcare workers for all you do. Thank you, Madam Speaker.
Questions and comments? The honourable member for Cumberland Colchester.
Well, thank you very much, Madam Speaker. You know, it's interesting. Earlier in the House, we heard about vaping numbers going up, and what we know in this opioid crisis is that this Liberal government is installing vending machines for high-potency powered drugs in Vancouver and Victoria. I wonder if the member opposite might think that it would be appropriate to give away free vaping products in high schools and vending machines.
Yeah. The honourable member for Richmond Centre.
Well, Madam Speaker, thank the members for his questions, and I would like to put it as a common sense approach. Would you want your kids to access to toxic drugs through a vending machine, or accessible for the community so that children are easily accessed to harmful substance for their health? And I think our government is working very hard to create more programs to support the people in need in this overdose crisis. Thank you.
Questions et commentaires. The député de...
The Honourable Member Avignon-Matane-Matapédia. Thank you, Madam Speaker, and I'd like to thank my colleague for his speech. I read the Conservative motion, and I noticed that they use a very harsh word, funereal, and I don't think that the government is seeking to kill people. I would like to hear what my colleague has to say about that, if he can tell him what the purpose of those proposed programs are. I imagine it's not to kill people. Thank you.
Member for Richmond Centre.
Thank you, Madam Speaker, and thank you, Honourable Member, for your questions. Excuse me for replying a response in English. However, our government are invested heavily into harm reductions, and with the 4 pillars recognized internationally as a necessary, successful substance use strategy, we base on prevention, enforcement, treatment, and harm reduction. However, the fact is, if the person is dead, then there's no way for us to help them at all, and even go through any treatments that we can provide. Therefore, it's important for us to understand what is needed in our community to address to this opioid crisis. Thank you.
Questions and comments? The honourable member for Vancouver East.
Thank you very much, Madam Speaker. Of course, what we know is that the Conservatives is trying to mischaracterize the entire situation. The harm reduction approach that is being proposed, one of the effects of it is that it helps connect people to other health services, including the possibility of treatment and rehab. But if you don't make that connection, that's never going to happen. So my question to the member is this. When the Conservatives say that we should eliminate harm reduction initiatives such as Saver Supply, how on earth then will we be able to successfully connect people to other services when we can't even reach them?
The honourable member for Richmond Centre.
Thank you, for Honourable Member, for your questions. And yes, I absolutely agree. There are parts that, as government, we need to look after Canadians. And it's important for us to really bridge the connection between mental wellness and substance use. And it's important for us not to be stigmatized in this topic, because we are creating fear in the community. We're misleading our Canadians. That won't help with the situation of this opioid crisis. And it's important for us to address to the fact that we're here to prevent death in our community through opioid crisis. Thank you, Madam Speaker.
The honourable member for Hamilton East Stony Creek.
Thanks, Madam Speaker. And it's important to note that the Leader of the Opposition was part of a government that tried to muzzle scientists as it relates to climate change. He was also part of a Conservative team who undermined public health officials as it relates to the pandemic and all things related to the vaccine. And now the Leader of the Opposition pretends to know more than trained professionals and doctors as it relates to the opioid crisis that we're dealing with. So my question is to my friend and my colleague, can he reiterate why it's so important to rely on doctors and the medical profession as it relates to the response to this crisis?
Answer from the honourable member for Richmond Centre.
Thank you for your questions. And I like to say it's important for us to base on science and fact and not mislead by media and not quoting on media sources that has not, there's no evidence behind it. So it's important for us to really understand what really helps our community to minimize death in our community. Thank you very much.
Resuming debate, the honourable member of South Surrey White Rock.
Thank you, Madam Speaker. I will be splitting my time with the honourable member for Sherwood Park, Fort Saskatchewan. Today we are addressing the health of our nation. After 8 years of this Prime Minister, everything feels broken, especially in my home province of British Columbia. Drugs, disorder, violent crime are all on the rise in our neighborhoods. People are lining up at food banks in record numbers because they can't afford groceries. Many can't afford a home. And worst of all, the opioid crisis is claiming the lives of our sons and daughters. Under the watch of this Prime Minister, there have been 34,000 opioid deaths, and that number is growing by the day. In BC alone, overdose deaths are up 330%, by far the worst rate of all provinces. The BC coroner released a report today saying that 206 people died of overdose in April. 1 month, 206 people, including one death at a safe injection site. The report said 70% of victims are between the ages of 30 and 59. People in that age bracket should be buying a home, having children, and enjoying successful careers. Instead, in the Prime Minister's Canada, they are chasing their next hit. Why? Because all three levels of government, including the federal Liberals, the provincial NDP, this NDP caucus, and left-wing mayors and councils have decriminalized illicit drugs, flooded the streets with so-called safe supply, and have failed to create the treatment and connection needed for people suffering with addictions to build a drug-free life. Over 800 people have died in the first 4 months of this year. If overdose deaths continue at this pace, we could lose up to 2,400 British Columbians this year. Death by overdose cannot be normalized. Instead, we need treatment and recovery. These programs will help those struggling with addictions, and we need them now. The Liberal NDP coalition is flooding our streets with drugs and supercharging this opioid crisis. One Global News reporter took to the streets of Vancouver to find out where are all these safe supply drugs going. The reporter was able to buy 26 hits of safe supply drugs for only $30 in just 30 minutes on Vancouver's downtown east side. Outreach workers on Vancouver's downtown east side claim that the safe supply hydromorphone tablets can be bought for as little as 25 cents per pill on the streets. No wonder the BC coroner reports 7 people per day are dying from drug overdoses in my province. This heavy amount of free drugs on our streets perpetuates the addiction cycle, prolongs suffering, and prevents recovery. It's leading to more deaths, not less. How many more Canadians must die before this Prime Minister learns that treatment, not free drugs, save lives? We need to help get people off drugs so they can effectively address their addiction issues, enjoy improved health, reconnect with family, get jobs, and become contributing members of society. Let's be clear. This government's radical agenda is fueling the opioid crisis. They use the term safe supply as though it were a medical term, but in truth, that phrase is nothing more than marketing jargon used by Big Pharma. Let's speak the truth. There is nothing safe about safe supply. The Liberal and NDP drug pushers point to other jurisdictions that have decriminalized hard drugs to justify their radical agenda. For example, they say Portugal set the gold standard for decriminalization of illicit drugs. But they forgot to mention Portugal ensured treatment and recovery services were expanded before they changed the laws. They also omit that health outcomes in Portugal have worsened since they decreased treatment services. What's worse, they are ignoring a made-in-Canada model that is saving lives in Alberta. That province has become a beacon of hope for how lives can be turned around with professional, caring drug treatment services. Overdose deaths, that's worth clapping for. Overdose deaths are down in that jurisdiction by 30%, while BC overdose deaths continue to climb. We know that merely providing safe supply drugs will never get people out of an addiction cycle. When Conservatives form government, we will follow Alberta's example and build world-class recovery communities and implement similar services around the country to save lives. We also need to consider the impact that the so-called Safe Supply program is having on our youth. On the streets of Vancouver, people living with addictions are selling these cheap drugs to kids, then use the money to buy stronger, deadlier fentanyl. Impressionable youth are accessing this cheap, plentiful supply of highly addictive drugs as a gateway to harder, more dangerous substances. In plain terms, the Safe Supply program is a direct threat to the lives of our youth. A BC coroner report confirmed that overdose victims are trending younger and that opioid addiction among BC's youth is increasing. Speaking as a mother, we cannot allow the government to ignore the evidence when our teenage sons and daughters are lying face down on a sidewalk in a zombie-like state. Safe supply drugs are putting youth on the path to hardcore addictions, and this needs to stop. Too many parents have lost children to drug overdoses in this country. The story of Jack Bodie from Burnaby is far too common. Jack was a productive and active 17-year-old boy who was deeply loved by his family. Tragically, Jack snorted half a pill laced with fentanyl. Inhaling the drug slowed down Jack's breathing and heartbeat, and within minutes, his entire system shut down and he passed away. Jack's death sent his family into deep and profound grief. His dad, now a treatment and recovery advocate, maintains that the real tragedy is that there are thousands of families across Canada dealing with the same grief that he faced over the death of a child due to a drug overdose. Vancouver Police Constable David Steverding works on Vancouver's downtown east side, and he's a member of the Odd Squad, a group of dedicated police officers who provide drug use prevention education to youth throughout Canada. The constable has worked with hundreds of people living with addiction and their families, and he said, and I quote, "People's comments are often that drug use is a personal choice and that it's a victimless crime. The people that are overlooked in these comments are family members and friends. In a lot of cases, they are absolutely helpless. They have to stand by and watch as that person spirals downhill," end quote. To the families who have tragically lost sons and daughters to a drug overdose, my message is this. We will make sure your child did not die in vain. We will scrap the dangerous social experiment of safe supply and ensure other kids who struggle with addictions get the treatment they need so they can come home to their families drug-free. And the consultants and Big Pharma who turbocharged opioid marketing will pay for it. We will hold them to account as government policy. Recovery, treatment, rehabilitation. That is how we're going to bring home our loved ones. It's how we will turn hurt into hope. It is the common sense of the common people. Hope is possible, and hope is on the way. Thank you, Madam Speaker.
Questions and comments? Questions et commentaires? L'honorable député de Mirabel.
The Honourable Member for Mirabel. Madam Speaker, sometimes the Conservative Party leads us to understand that the Liberals want to legalize all drugs, but in British Columbia what they did is decriminalize some substances so that those who have addictions can be referred to the right services so that they receive adequate and appropriate care. So is this Conservative motion just in order to fill prisons up with people with health problems? And also this motion reinforces stigma that exists against these people. These people just need help and need help getting out of it.
That member, Madam Speaker, for what he just stated. There was nothing in what I said that said anything about prisons. That is ridiculous. We're talking about treatment, recovery, support for those who are suffering with addictions. Shame on him.
Questions and comments? Questions et commentaires? The Honourable Member for Cumberland Colchester.
I thank the great member for South Surrey White Rock for such an interesting and very taking a very complex subject and making it understandable for all Canadians. I wonder if the member might comment briefly on the wisdom of spending $3.5 million worth of taxpayer money to put vending machines, 3 in Vancouver and 1 in Victoria in her home province, and increasing access to powerful opioid-type medications. Thank you.
The Honourable Member for South Surrey White Rock.
I thank the member who is a medical doctor, so he's always very knowledgeable on these subjects, and I thank him for his question. Of course, I do not agree with this. The easier the access, the harder it is to deal with the problems that come from that easy access. We have people, young people, their brains are still developing. A brain is not fully developed until you're in your mid-20s. We know that. And we know the effect of drugs, even so-called softer drugs like marijuana, can lead to psychosis, paranoia, can unmask schizophrenia. And then now we're talking about drugs where a 17-year-old can snort half a pill and dies. It is irresponsible and unreasonable that we spend taxpayers' dollars to give young people access, such as at a vending machine, to hard drugs. Unforgivable, actually, Madam Speaker.
Questions and comments? The Honourable Member for Nunavut.
There's been information collected that shows that because of safe supply programs, there's been a significant decrease in hospitalizations for infectious complications among safe supply clients. Hospitalizations dropped from 26 in the year before the program entry to 13 in that year, and I wonder what that, how that member can interpret such helpful data that shows that these safe supply programs do work.
The Honourable Member for South Surrey White Rock.
Madam Speaker, I've spent a fair amount of time in this space. I was the president of the Little House Society, which is a recovery house in British Columbia. So I have some knowledge on the issue. And a continuum of care, of course, has to be part of recovery, support, and treatment. But unlimited, safe supply, where people receiving that safe supply are then selling it to kids cheaper and cheaper in order then to use that money for their own harder drugs, this is a tragedy. And people who run recovery houses like Last Door Recovery in New Westminster, they are on record saying that they know, and the people they deal with, 100% of them who have received safe supply drugs have never used all of the drugs they've received. They're selling them.
Resuming debate, the Honourable Member for Sherwood Park, Fort Saskatchewan.
Thank you, Speaker. After 8 years of this Prime Minister, everything feels broken. Life costs more, work doesn't pay, housing costs have doubled. The Prime Minister divides to control the people, and worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is this worse than the opioid crisis, and that has expanded so dramatically in the last several years. Across the board, we see that this government is not working. And that is why I am in full support of today's opposition motion, which proposes to reverse the damage being done by this government's drug policy and which advances an authentically compassionate alternative approach to the opioid crisis. Conservatives believe in universal and immutable human dignity. When it comes to those who are struggling with addiction, we believe in both meeting people where they are at and in helping them pursue an ambition for recovery and doing it successfully. The approach of all of the other parties in this place reflects a basic pessimism about the potential of those struggling with addiction.
That's right.
They want to meet people where they are at, but leave them there, while we want to meet people where they are at and help them pursue recovery. Parents, brothers, sisters, friends, they don't just want to see those struggling receive a kind of palliative care. They want to see us take the steps that will allow those who are struggling to come home drug-free. This means that we need to make smart choices with scarce resources, investing those resources in treatment and recovery instead of spending those dollars to buy dangerous drugs and give them away. The approach of every other party in this House is to dramatically increase the supply of dangerous, hard drugs into our neighborhoods. Now, they argue that this is an appropriate response to the drug supply being poisoned, that because of a poisoned drug supply, they want to offer cleaner versions of these drugs. But let's be clear, hard drugs are poison.
That's right.
Giving away taxpayer-funded poison is not a solution to people being poisoned. Giving away less potent versions of these drugs ignores the nature of opioids themselves. Opioids have a tolerance-inducing effect, which means that people generally need higher and higher doses in order to achieve the same impact. If a person is on a course of treatment and recovery where they're offered targeted alternatives with unique properties, then they can go the other way. But absent the intentionality, the reflexive course of opioid use is a dangerous upward escalator. So free government-funded opioids today will still lead to the use of even more potent, unregulated opioids tomorrow. As we are seeing now, this policy of supplying government-funded hard drugs into neighborhoods and communities does not just hurt those who are already facing addictions. It also makes these hard drugs more plentiful, more available, and easier for vulnerable kids to access for the first time. We know this because of what we're seeing in BC, where these so-called safe supply policies have been tried. But we also know this because of the particular history of the opioid crisis. And this is where I want to focus my remarks today. Where did the current opioid crisis come from? In fact, the evidence shows us that most people who struggle with opioid use disorders did not start down this road by experimenting with street drugs. They started down this road because a family-owned pharmaceutical company called Purdue Pharma set out, starting in the 1990s, to revolutionize pain management through the aggressive marketing of OxyContin and sought out to make a lot of money in the process. This history is well told in a number of books I would recommend: Empire of Pain by Patrick Radden Keefe, Dreamland by Sam Quinones, and Chapter 7 of When McKinsey Came to Town. Here is the essential background. Opium is the original opioid, and there was a long-standing reluctance in the medical community to prescribe it, except in the most extreme cases. Purdue Pharma sought to create the impression that OxyContin, their new semi-synthetic opioid, was less potent than opium. Actually, it was more potent. OxyContin also incorporated a controlled release technology. It was designed to facilitate a controlled release of opioid-related pain relief over a period of time. And this also helped create an illusion of less risk. But OxyContin's controlled release mechanism wasn't tamper-resistant and could easily be modified to release all of the hit at once. So it carried all of the same, in fact, greater risks than opium. Purdue Pharma made unfounded claims minimizing the addiction risk associated with OxyContin and aggressively marketed it as the solution for all kinds of pain, acute pain following an extreme event, but also ongoing chronic pain. They marketed it as a low-risk, powerful pain relief option, and they marketed it very successfully. As a result, many people with different levels of short-term and long-term pain had the opioid OxyContin prescribed to them. Because of the well-known by now tolerance-inducing effect associated with opioids, people could not get the same level of pain relief at the same dose. So they would seek higher and higher doses and eventually transition away from just prescription drugs to street drugs as well. For those here or elsewhere who have lost loved ones to opioid use disorders, many will recognize this story. Pain, perhaps after a car accident or long-running unexplained chronic pain. Then opioids prescribed, followed by opioid addiction and a subsequent spiral as higher and higher doses are sought to achieve the same effect. Perhaps at some point people seek treatment and recovery, but they find a complete lack of accessible available services. Purdue Pharma's objective was to minimize any concern or stigma around their new product, OxyContin. When it was released in 1996, OxyContin was a new drug, and indeed false claims were made to minimize its risk. It was also sold generally through regulated pharmacies. So this wasn't about stigma. It wasn't about unpredictability of supply or alteration in supply. This is actually a test case of what happens when drugs are easily available with little or no stigma. In effect, the over-promotion of opioids by Purdue and others with dangerous pharmaceutical-grade drugs easily available, this was the original safe supply program. And that's what gave us the opioid crisis in the first place. Needless to say, for pioneering this original safe supply program, Purdue is not getting any congratulations. It has become a global pariah. And the name of the Sackler family that owned Purdue is being stripped off universities and art galleries that they donated to. This original safe supply program is now seen for what it is, an elaborate scheme to market the problem of pain and then sell a solution that was far worse than the problem, undertaken contrary to the evidence and with the sole aim of making one family rich. Now, Conservatives have advanced a simple proposal in response to the wrongdoing associated with this first attempt at making Big Pharma rich through so-called safe supply. Our proposal is that Purdue Pharma, the Sackler family, and all of the other bad actors involved, including McKinsey, pay compensation for the full costs associated with the opioid crisis, and that the government spend 100% of the dollars collected through such litigation to fund treatment and recovery. The government needs to be ready to step up and help, yes, but let's make those responsible for this problem pay to fix it, to fill the treatment and recovery gap. Now, Speaker, I haven't had time to review all of the history here, but there's one piece that I think is particularly noteworthy. The original formulation of OxyContin was set to go off patent in the United States in 2013. However, likely in an effort to extend patent exclusivity, Purdue Pharma released a new formulation of OxyContin with certain abuse-resistant features. It then filed papers with the FDA asking the agency to reject generic versions of the original pill on the grounds that the original version were unsafe. Purdue also pulled the original formulation from the U.S. market. The FDA concurred with the company and blocked generic reformulations in the U.S. This led to the marketing of a new, somewhat safer, tamper-resistant product, but it also allowed Purdue Pharma to continue to have patent exclusivity in the United States and make even more money. But while both Purdue and the FDA said the original formulation was unsafe, Purdue continued to sell the original, easier-to-abuse version here in Canada for a full year after the original OxyContin was off shelves in the United States. In other words, Purdue was selling a drug in Canada which they had explicitly lobbied the FDA in the United States to deem unsafe. Notably, sales rose dramatically in border areas, quadrupling in Windsor, suggesting that the company knew that the more dangerous versions of the drug were being sold into Canada and smuggled back into the United States. Purdue admitted that it was aware of the resulting spike in OxyContin sales in Canadian border towns. Madam Speaker, this is clear evidence of Purdue's extreme malice and of the particular impact that this has had for Canadians. So what can we learn from these events? First of all, we need to be constantly aware of the risk of large companies over-marketing potentially dangerous products. This is the cause of the opioid crisis, and we are seeing risks of this happening in other cases. We also can learn, we must learn, that so-called safe supply doesn't work. Trying to minimize the recognized risks associated with clearly dangerous products, making them widely available through pharmaceutical sales, it clearly doesn't work. It didn't work. It gave us the opioid crisis and in the first place, and it's not working now. And Madam Speaker, in order to deter this kind of behavior, we need to punish the perpetrators of this crime. The perpetrators are not those suffering from addiction, but it's the bad elite actors who push these drugs onto people who are unaware of the risks and sought to minimize those risks. Therefore, Madam Speaker, I am pleased to support this motion and to move an amendment to it, which brings in this concept of holding bad actors responsible and of using the resources thus gathered to fund treatment and recovery. I move, seconded by the member for Grand Prairie.
Member's time is up. I did give the honourable member the 1 minute mark. The time is at 0 now.
I started reading
after I got up. So let me check with the officers. So there was like just a few seconds, it seems, in between. So the honourable member, I will allow him to move his motion.
That the motion be amended by adding the following: and to directly sue the companies responsible for causing and fueling the opioid crisis for all damages associated with the crisis, and direct all funds recovered through such litigation to prevention, treatment, and recovery programs.
Here, here. Here, here. Okay.
To keep track of the time, I did indicate that because they can lose that opportunity. On a-tu le papier?
Oui, on l'a eu.
Therefore, it is my duty to inform the honourable members that an amendment to an opposition motion may be moved only with the consent of the sponsor of the motion, or in the case that he or she is not present, consent may be given or denied by the House Leader, the Deputy House Leader, the Whip, or the Deputy Whip of the sponsor's party. Since the sponsor is not present in the chamber, I ask the acting Deputy Whip if he consents to this amendment being moved. The honourable member for Fundy Royal.
Madam Speaker.
Mr. Genia, seconded by Mr. Workington. Mr. Workington moves the following amendment: that the motion be amended by adding the following: and to directly sue the companies responsible for causing and fueling the opioid crisis for all damages associated with the crisis, and direct all funds recovered through such litigation to prevention, treatment, and recovery programs.
The amendment can be received. Questions and comments?
Honourable member for l'honorable député de Van.
The honourable member for Mirabel. Thank you, Madam Speaker. First, I'd like to say to my colleague, and it's been a long time I've said this, I really enjoy listening to him. He's a great speaker, a passionate man, and despite our political differences, he often appeals to values that we share, and he did that when he talked about universal human dignity. And for us, one way that we can achieve that is to have a healthcare system that is universal. And right now in Quebec, there are over 20,000 people who are waiting for mental health care services, including people who are dealing with addiction and who are trying to get out of it. The government offered the provinces $1 out of the $6 that they've asked for health care. So I'd like to ask my colleague, in a Conservative government, would the missing $5 out of $6 be given to the provinces? The honourable member for Sherwood Park, Fort Saskatchewan.
Madam Speaker, I thank my friend and colleague for the question. I do want to focus on the need for funding, as he alluded to, in particular in the area of treatment and recovery. And this is something that Conservatives have been championing for a long time, the need for stronger engagement in funding treatment and recovery. And we recognize in the context of scarce resources that money is much better spent on treatment and recovery than it is on purchasing dangerous drugs and giving them away. But also that as we seek to fund health care, as we seek to fund treatment and recovery, as well as mental health challenges that people face, that holding financially responsible bad actors that have caused this problem and having them pay a greater share of those recovery bills rather than taxpayers or rather than the individuals who are victims, that makes a lot of sense. Let's have the perpetrators pay for the treatment and recovery.
Questions and comments? The Honourable Member for Vancouver East.
Thank you very much, Madam Speaker. New Democrats absolutely support the idea that Purdue Pharma should be sued, that they should be made to pay. That was something that the NDP called for the Liberal government to do long time ago. I'm glad that the Conservatives trying to figure that out are now on board. But to suggest, though, that safer supply is somehow this equivalent to that of what Purdue Pharma is doing is wrong. Safer supply, Purdue Pharma, by the way, was allowing for the drug to be made available and selling it to doctors, suggesting it to the doctors, that this is an effective pain killer without acknowledging the addictive component of it. But on safer supply is only applied to people at the highest risk who are already addicted. And so is a fundamentally different thing. Now, Lisa Lapointe, the chief coroner, actually said the drug poisoning crisis is the direct result of an unregulated drug market. That is what is at issue. That is what safer supply is trying to deal with. So is Lisa Lapointe wrong?
Member Sherwood Park, Fort Saskatchewan.
Madam Speaker, my honourable colleague spoke about intentions and what the intention of the program is. By the way, I don't deny that there are good intentions on all sides of the House when it comes to this issue. I'm just interested in looking at the results. And the reason I say that the Purdue program of over-promotion and of trying to minimize stigma around the substance in order to get more people to use it, the reason I see that as very similar and in substantive sense the same as the Safe Supply program is that it was about flooding more supply of dangerous substances into the market, making them easier to access. And of course, at that time, still today, that increase in supply is supposed to only go to certain people in certain kinds of situations. But what we've seen is that when there's a big increase of supply of dangerous drugs into the market, it doesn't only land in the hands of those who are supposed to get it. It lands in the hands of children who haven't used it before, and it increases the risks to everybody.
The Honourable Member for Vaughan Woodbridge.
Thank you, Madame la Présidente. I'd like to ask the Honourable Member from Sherwood Park, Fort Saskatchewan. Did I get that? Yeah, I got that right. And today there was an article from the London Free Press titled "London Doctor Rips Unfounded Anecdotes About Safe Drug Supply Programs." And you read this article, it again goes on to state just the ignorance that's going on when it regards to ignoring medical research, medical evidence from the safe supply of drug programs that are put in place in this country, the safe prevention sites. And if you read through this article, Madame la Présidente, these criticisms prevent danger to harm reduction policies across Canada. And I think it's a fact that we need to follow evidence-based policies. And if I can get an answer on why they're not following evidence-based policies, Madame la Présidente.
I'm Sherwood Park for Saskatchewan. A brief answer, please.
Well, thank you, Madam Speaker. With great respect for my colleague, I get evidence from a variety of sources, which sometimes might include the London Free Press, but do include broader reading than just one article that cites one physician. I think the evidence we've seen over the last number of decades is very clear that when hard, dangerous drugs are destigmatized as substances, when they are made more available, more accessible, more people get them, more people use them, and more people suffer and die as a result of it. And why would the government fund those kinds of programs when they could instead be investing in treatment and recovery?
Resuming debate, the Honourable for Vaughan Woodbridge.
Thank you, Madame la Présidente, and I'd like to say I will be sharing my time with the Honourable and esteemed colleague from Longueuil, Charles Lamont. I pronounced that correctly, I apologize, but I think I got some of it right. Madame la Présidente, before I begin my formal remarks on this, Madame Speaker, all of us as members of Parliament get to know constituents and get to know their families and in our ridings and serve them to the best of our abilities. And sometimes we are called upon to visit a viewing and funeral home when someone passes away. In the almost 8 years that I've been here as a member of Parliament, I've been to many, many viewings and expressed my condolences and many times to families, and I go there with the utmost humility and respect. On one of these instances, I went to a viewing of a 26-year-old individual who had passed away from opioids, and know his father and the family well. And I'll never forget that evening. I'll never forget seeing his childhood books from elementary school that we keep as parents and memorabilia, and how this person should have had, this individual should have had a full life, a much more longer life, and it was taken away from him. And I've been to many viewings, and when I go to the folks that are in their 80s and 90s, we always say they lived a full life, God bless, and they're not suffering anymore. But that viewing, I'll never forget this young individual. He battled, and he lost his battle to opioids in this crisis. And that's the human face. And that's why we, as parliamentarians, we as legislators, we need to do the right thing. We need to make sure we're doing the right thing for our constituents. And evidence-based policy is the right thing. It's not the Nancy Reagan just say no to drugs. It's not ideological stance, which I'm seeing come forth from the other side. It's none of that. It's doing what's right and what's evidence-based, and that's how our government proceeds on a day-to-day basis, and that's how I feel I can best represent the constituents of my riding of Vaughan Woodbridge. Madame la Présidente.
Madam Speaker, as everyone in this House knows, the toxic drug supply and the overdose crisis is devastating communities across Canada. Before the COVID-19 pandemic, there were 10 fatal overdoses every day in Canada. Today, we're losing 20 Canadians a day to this crisis. Many more of our friends, families, and community members are now in hospital, calling emergency support services and mourning the lives lost in the last 7 years of this crisis. Unfortunately today, Madam Speaker, we are debating a misguided motion which is rooted in outdated ideology, a motion which would recycle a narrow and discredited approach instead of implementing a comprehensive plan to deal with a crisis that is killing people. Even former Prime Minister Stephen Harper's public safety advisor, Benjamin Perrin, has seen the light and described the current Conservative approach, as embodied in this motion, as being a rehash of long discredited Conservative drug war tropes that have proven not only ineffective, but also costly and deadly. An effective strategy to tackle substance use rests on 4 internationally recognized pillars: prevention, treatment, enforcement, and harm reduction. And that includes access to a safe supply. In December 2016, our government launched Canada's Drug and Substance Strategy. It's a strategy that takes a public health approach to substance use. By doing so, we committed to a comprehensive, collaborative, compassionate, and evidence-based drug policy. Under Canada's Drug and Substance Abuse Strategy, the Government of Canada has taken evidence-based actions to address the toxic drug supply and the overdose crisis. And to date, this government has announced over $1 billion in funding, Madam Speaker. This funding includes almost $500 million through Health Canada's Substance Use and Addictions Program. And that money supports community-based treatment activities, harm reduction, prevention, and stigma reduction. In addition, this funding has supported research and monitoring initiatives, and it has also strengthened the ability of law enforcement agencies to fight the production and the trafficking of illegal drugs. Looking ahead, Madam Speaker, Canada's Drug and Substance Abuse Strategy will continue to guide our government's approach to drug policy. And this will include a full continuum of evidence-based options and innovative life-saving strategies, which will allow us to meet people where they are and provide the support that they desperately need. Madam Speaker, substance use is an extremely complex issue, And Canadians consume drugs for a wide range of reasons. Not everyone who uses drugs is addicted. And even when a diagnosis exists, treatment services may not be available or affordable. Moreover, not everyone is willing, eligible, or able to undergo treatment. The path to recovery is a different path for each individual person. Services to keep people alive and safe, which support better health outcomes, should not be limited to treating people with a formal diagnosis of substance use disorder. The crisis we're seeing right now affects people who are trying drugs for the first time, people who use drugs occasionally, as well as people who are silently struggling with addiction. There's no one-size-fits-all solution to this crisis, Mr. Speaker. We need a full range of measures that meet the needs of people where they are and which reduce the potential risks associated with substance use. Harm reduction is a key part of this work, and it's a key part of this government's strategy to deal with the toxic drug supply and the overdose crisis. Evidence has shown us that risk reduction measures such as supervised consumption sites, face-to-face or virtual help services, a safer supply, take-home naloxone and drug verification technologies support people who use drugs by putting them in touch with health and social services, and most importantly, help to keep them alive. For example, Mr. Speaker, in one of the hardest hit provinces, the data that we're seeing from British Columbia shows that the combined effect of expanding access to take-home naloxone programs, supervised consumption sites, and opioid agonistic treatment has been crucial in preventing overdose deaths in the province. In addition, between 2015 and 2021, nearly 105,000 naloxone kits were used to address overdoses in British Columbia. In 2016, there was only one supervised consumption site in Canada. Since then, the number of federally approved supervised consumption sites has increased to 41, and they are now available in British Columbia, Alberta, Saskatchewan, Ontario, and Quebec. This is because we invest in what works. We follow the evidence. At these sites, over 46,000 overdoses have been reversed, and there have been over 4 million visits. That's a point that's worth repeating. These safe consumption sites that the Conservative leader wants to close have prevented more than 46,000 overdoses since 2017. Thank you, Mr. Speaker.
Consumption sites have saved almost 50,000 Canadians from dying.
When we say that harm reduction meets people where they are, that's what we mean. These harm reduction services save lives every day. The helpline services provide support to a person using drugs, either in person or remotely by phone, video chat, or through an app. And they provide assistance in the event of an overdose. In the first 14 months of operation, the National Virtual Overdose Response Service has monitored over 2,000 substance use events and responded to over 50 unfortunate situations. These events required emergency response, and no deaths were reported. Mr. Speaker.
Forward to questions and comments from
From all of my colleagues. Thank you.
Before going to Q's and C's, I just want to, it's my duty pursuant to Order 38 to inform the House that the question to be raised tonight at the time of adjournment is as follows. The Honourable Member for Sherwood Park, Fort Saskatchewan, on public services and procurement. So, questions and comments? Question commentaire. L'honorable député.
The Honourable Member for Mirabel. Thank you, Mr. Speaker. In the Conservative motion, it's suggested that safe supply programs don't fight addictions, but rather create addictions. And yet, it seems like the data shows that these programs allow us to meet people who are dealing with addictions on a more regular basis, to offer them accompaniment services towards sobriety, which are better adapted to their needs. So I'd like to ask my colleague to speak about the advantages of this approach, which in its current situation is maybe not ideal, but I'd like to hear him speak more about those programs.
The honourable member for Vaughan Woodbridge.
Merci, Monsieur.
Thank you, Mr. Speaker. I would like to thank my colleague for his question. It's a very important question. Our program to reduce the number of overdoses.
It's obviously harm reduction. It's obviously getting drugs off the street. It's obviously having a safe supply, and it's obviously having a safe treatment program for individuals that unfortunately have fallen dependent on these types of substances. And you need to have these four pillars, and they all need to be working in unison. They all needs to be monitored and making sure they are working. Obviously, the 46,000 people that we've estimated the system has saved their lives is something that we need to speak to, we need to look at. We can always strengthen the system, yes, but we need to do it from an evidence-based approach. Thank you, Monsieur le Président.
Comments, questions, commentaires. The honourable member for Cumberland Colchester.
Thanks very much, Mr. Speaker, and I thank the member opposite for his speech. I'd like to hear a very specific answer to a question is, how many treatment beds has this government actually added in their wonderful program? And how does he justify the $3.5 million spent on vending machines to dispense high-potency opioids like hydromorphone?
Member for Vaughan Woodbridge.
Thank you, Mr. Speaker, and I thank the honourable member's intervention from Cumberland Colchester and his advocacy on health matters. I believe he is the health critic for the official opposition. What I'll say this, our government is continuing to invest monies into treatment programs, into a safe supply program for individuals that unfortunately are dependent on these drugs. I remember many, many years ago walking into a Shoppers Drug Mart in the town my wife is from. There were two young individuals there who were getting their yellow mixture of water and another powder because they were dependent. And we need to make sure these individuals, we avoid them from getting dependent on those type of substances or the substance they were on, but there are available safe supply, and it's exactly what they were doing that day, and I bet you we were saving their lives. Thank you, Mr. Speaker.
Questions and comments, questions, commentaires. The honourable member for Esquimalt, Saanich, Sooke.
Mr. Speaker, and I'd like to thank the honourable Liberal member for his speech, his very reasonable speech in response to a quite unreasonable motion before the House. And in doing so, I'd like to ask if he agrees with me. On Vancouver Island, there are more than a dozen overdose prevention sites, which people like to call safe consumption sites, and they save hundreds of lives every year. But they also help connect those with addiction problems to social services and treatment programs in the community. So does he agree with me that the closure of those overdose prevention sites would actually contribute to more deaths and larger numbers of addiction problems in the community?
Member for Vaughan Woodbridge.
Mr. Speaker, I really would like to thank the honourable colleague from Vancouver Island for his very informative and substantive question. Those safe prevention sites are literally saving the lives of our most vulnerable in society, and we need to always take care of our most vulnerable in society. And any closure of those sites would obviously be detrimental to the most vulnerable in our society. We as a government, myself as a parliamentarian, and all parliamentarians need to make sure we are taking care and helping and assisting the most vulnerable in our society, particularly those that are dependent on substances where they are, in fact, could pass away from taking them if they do not receive treatment or if they do not receive a safe supply of alternative medicines. Thank you, Mr. Speaker.
Questions and comments? Question commentaire. The honourable member for Longueuil, Charlemagne.
Thank you very much, Mr. Speaker. And this is a really important subject. And the director of my constituency office just buried her nephew after a fentanyl overdose in the streets of Montreal. And I don't think anyone in this House would disagree that the issue of overdose and addiction is one of great importance. I'd like to ask my honourable colleague if he'll elaborate a little bit more about how Safe Supply is going to save people like the nephew of my constituency director.
The honourable member for Vaughan Woodbridge.
To my honourable colleague, first, my sincerest condolences, all our sincerest condolences to any person in Canada who has lost a loved one due to this crisis. We as a government must maintain and look at evidence-based policies which can assist those Canadians from having to go through this scenario. We will be there for them. And in this case, I offer again my sincerest prayers to this young individual that their life have been cut short because of this.
Reprise de continuing debate. The honourable member for Brampton Centre.
Thank you, Mr. Speaker. As everyone sitting in this House knows, the toxic drug supply and overdose crisis is devastating communities throughout Canada. Now, we are losing 20 Canadian a day, and prior to COVID, 10 people were fatally overdosing every day in Canada. But now it has increased. Many more of our friends, families, and community members are being hospitalized, calling emergency support services, and grieving lives lost over the past 7 years of this crisis. Unfortunately, we're now debating a misguided motion rooted in outdated ideology that would recycle and discredited narrow approach rather than a comprehensive plan to deal with the crisis that is killing people. Even former Prime Minister Stephen Harper's public safety advisor, Benjamin Perrin, has seen the light and describes the current conservative approach epitomized by this motion as, quote, rehashing conservative war on drugs tropes that have been long since discredited and have been found to be not only ineffective but costly and deadly, end quote. There are 4 pillars recognized internationally that are necessary for a successful substance use strategy: prevention, treatment, enforcement, and harm reduction, including safer supply. In December 2016, our government launched the Canadian Drug and Substance Strategies, which uses a public health approach to substance use. In doing so, we committed to a comprehensive, collaborative, and compassionate and evidence-based drug policy. Under the Canadian Drugs and Substances Strategy, the Government of Canada has taken evidence-based action to address the toxic drug supply and overdose crisis and announced over $1 billion in funding. This funding includes $490 million throughout Health Canada's substances use and addiction program to support community-based treatment, harm reduction, prevention, and stigma reduction activities. In addition, this funding has supported research and surveillance activities and strengthened law enforcement capacity to address illegal drug production and trafficking. Going forward, the Canadian Drugs and Substances Strategy will continue to guide our government's drug policy approach, which includes a full continuum of evidence-based options as well as innovative life-saving strategies to meet people where they are and provide them with the support they need. Mr. Speaker, substance use is an extremely complex issue, and Canadians use drugs for a multitude of reasons. not everyone who uses drug is suffering from an addiction. And even when a diagnosis exists, treatment services may not be available or affordable. Moreover, not everyone is always willing, eligible, or able to enter treatment. Recovery looks different for everyone. Services to keep people alive and safe, and that support better health outcomes, should not be limited to just treatment services for those people with a formal diagnosis for a substance use disorder. Given the crisis is affecting people trying drug for the first time, people who use drug occasionally, and people who are struggling with an addiction in silence. There's no one-size-fits-all solution to this crisis. We need a range of interventions that meet people where they are and reduce the potential harms related to substance use. Harm reduction is a key element of that work, and that this government's strategy to address the toxic drug supply and overdose crisis. Evidence has shown us that harm reduction measures such as supervised consumption sites, in-person or virtual spotting, services safer supply, take-home Nexalon, and drug checking technologies are supporting people who use drugs by connecting them to health and social services, and most importantly, keeping them alive. For example, in one of the hardest hit provinces, evidence in British Columbia has shown that the combined effect of expanded access to take-home Nexalon programs, supervised consumption sites, and opioid agnostic treatment has been crucial to averting overdose deaths in the province. In addition, between 2015 and 2021, nearly 125,000 naloxone kits were used to reverse an overdose in BC. In 2016, there were only 2 supervised consumption sites in Canada, both in Vancouver. Since then, the number of federally approved supervised consumption sites offering services has grown to as high as 40 and are available in British Columbia, Alberta, Saskatchewan, Ontario, and Quebec. This is because we are investing in what works and where the evidence is. At these sites, more than 46,000 overdoses have been reversed, and there have been over 4 million visits. That is the point worth repeating. Mr. Speaker, the safe consumption sites the Conservative leader wants to shut down have reversed more than 46,000 overdoses since 2017. When we say that harm reduction meets people where they are, this is what we mean. These harm reduction services are saving lives every day. Spotting services support someone who is using drugs either in person or remotely by phone, video chat, or an app, and provides help in case an overdose occurs. During the first 14 months of operation, the virtual national overdose response Service monitored over 2,000 substance use events and responded to over 50 adverse events. These events required an emergency response, and no fatalities were reported. Although the conservative opposition will tell you otherwise, harm reduction efforts are not antithetical to treatment. They are part of the continuum of care. They meet people where they are, and they can connect people with the spectrum of health and social support. Thank you, Mr. Speaker.
Questions and comments? Question commentaire. The honourable member for Mission Mascouy Fraser Canyon.
Thank you, Mr. Speaker. During today's debate, the Liberals have been conflating safe supply and safe consumption sites. They're two separate policies. The reality is that the member opposite from Brampton Centre just cited, well, safe consumption sites save 46,000 lives. Well, if anyone who spent some time on the downtown east side or in the Fraser Health region, in my community, which has even higher overdose death rates than they do in Vancouver, know that someone who receives an overdose could receive good care from there, but that's not preventing them from accessing and using fentanyl and other illicit drugs in conjunction with the free drugs that they're getting from safe supply providers. If these policies that this government is pushing so hard were so good, why do the death rates continue to increase in my community? Why do the death rates across British Columbia continue to increase? And why have the death rates continued to increase since this government decriminalized fentanyl? Thank you, Mr. Speaker.
Honourable member for Brampton Centre.
Thank you, Mr. Speaker. I like to thank my colleague for his question. Harm reduction is a major concern here, and evidence-based strategy is a major play in here to save lives. We know in prior to 2015, we did not have safe spaces, but with this strategy, we have more safe centers where, a harm reduction and assistance being provided, and we're saving life by doing that. Thank you, Mr. Speaker.
Commentaire question for Foothills. Oh, sorry, I got it. As much as I enjoy calling him, the deputy.
The honourable member for Avignon, La Métis, Matane, Matapédian. Thank you, Mr. Speaker. I appreciate that. One of the things that I find about those good pilot projects put in place by Health Canada is the wide array of services. For example, mental health counselling, and in the fight against the opioid crisis, the federal government has certainly more work to do, but I think the Quebec and the provinces as well. And that depends on federal health transfers. What Quebec and the provinces have asked for, financially speaking, over 10 years is not what they got. They only got 1/6 of what they were calling for. And in Quebec alone, there were over 20,000 people who were on a waiting list to have access to mental health services. So I think these pilot projects are good, but does my colleague not agree with me that the federal government should do more for healthcare funding? The honourable member for Brampton Centre.
Thank you, Mr. Speaker. I like to thank my colleague for her question. At supervised consumption sites in Canada, there have been more than 236,000 referrals to health and social services. These referrals are supporting individuals on their path to recovery and wellness. So that means the plan is working. Thank you, Mr. Speaker.
Commentaire, questions and comments. The honourable member for Esquimalt-Saanich-Sooke.
I thank the honourable member for Brampton Centre for his quite measured speech on what is quite an unmeasured or immoderate resolution from the Conservatives. And I wonder if he agrees with me that the Conservatives seem to be conflating safe supply with new addictions, and it's certainly not the case. Safe supply is a way of keeping those who are already suffering from addictions, suffering from substance use problems, alive until we can get them into treatment, we can get them out of the situations that have led to their dire circumstances. So I wonder if you agree with me that safe supply is certainly essential to preventing loss of life in our communities.
33 seconds left. The Honourable Member for Brampton Centre.
Thank you, Mr. Speaker. I'd like to thank my colleague for their question. Healthcare professionals, including those operating safer supply services, they must follow federal rules around the secure handling of controlled substances, including measures to help prevent diversions. Thank you, Mr. Speaker.
Again, as we're getting to the end of this, make sure we get short answers and short questions so that people can get to participate in the debate. Reprise du débat, continuing debate. The Honourable Member for Cypress Hills Grasslands.
Well, thank you very much, Mr. Speaker. And I rise in the House today to speak to a challenging issue, and one that has affected the lives of too many Canadians across our great country. And after 8 years of this Prime Minister, everything just feels broken. Life costs more. Work does not pay. Housing costs have doubled. The Prime Minister divides to control the people. And worst of all, crime, chaos, drugs, and disorder rage in our streets. Nowhere is this worse than the opioid overdose crisis that has expanded so dramatically in the last several years. The opioid crisis has now killed over 35,000 of our loved ones since 2016. 6 individuals have succumbed to overdoses in my hometown of Swift Current, with 2 very recently of fentanyl just within this past couple of months. Mr. Speaker, this is tragic. This crisis has claimed the lives of too many Canadians and will continue to do so if we as legislators cannot work collaboratively to enact policies that will help reduce both the supply and the demand of these highly powerful, highly addictive, taxpayer-funded drugs. It is clear that current policies implemented by this Liberal government to combat this issue are not working. Since 2017, the federal government has spent over $800 million on its failed Canadian drugs and substances strategy, including over $100 million in funding for hard drug supply projects across Canada, and plans to spend an additional $74 million to scale up these projects over the next 5 years. So you might ask, what do we have to show for this huge investment? Have the trends reversed? Are our loved ones coming home drug-free? Well, let's look at the facts. Since tax-funded drug supply was ramped up in 2020, opioid deaths have only gone up, according to the Public Health Agency of Canada. In 2020, slightly less than 7,000 people died of opioid overdoses, while only 3,000 died of overdoses in 2016, according to the Library of Parliament. It's clear that the Liberals' policies are not working, and pumping taxpayers' money in to fund these drugs is not solving the problem. This begs the question, what is the government hiding? And I look forward to a response from the members opposite. And maybe when I split my time with the member from Foothills, maybe they will enlighten him as to what is happening. But ultimately, Mr. Speaker, this issue is one about hope. We need to offer hope to our friends, to our families, to our neighbors, our fellow Canadians, and especially those who find themselves addicted to these substances and feel unable to free themselves from the grip of addiction. I would ask this House, if someone is struggling with addiction, what message does it send them to offer them more of these hard drugs? Does that send a message of hope to these individuals? No. Or are we saying that we've given up on them? At its root, funding these hard drugs is an inferral that we believe that they may be unable to overcome these addictions. But, Mr. Speaker, we know that that is not true. There are incredible stories of Canadians across the country who have found themselves at their lowest, despairing of ever being able to free themselves of the bondage of drug addiction. And yet, Their stories of recovery are powerful stories of hope. And if you ask them how they recovered, the answer is not one of safe supply programs by the government. It's about recovering in addiction treatment and recovery programs. I had a constituent reach out to me and tell me about a family member that had struggled with addiction. And for this person, it started as an early teen with marijuana and quickly escalated to other substances like cocaine and morphine. But Mr. Speaker, it was treatment that was available. It was not safe supply that was able to get this person the help that they needed to be able to finish high school, but not only finish high school, but to be able to graduate with honors and even win a provincial academic award. That's the story. That's hope, Mr. Speaker, and that's hope that's been realized. I also spoke with an organization that works with at-risk youth, and there was an individual that came to work there that had previously dealt with an addiction in his life and was using his lived experience to help the youth there to hopefully prevent them from what he did and what he had went through. Unfortunately, this person had a relapse one weekend when he was back home and ended up taking fentanyl for the first time in his life. Do you know how long it took him to be able to detox from that, Mr. Speaker? It was 8 days for taking fentanyl one time. The Liberals' plan isn't to prevent people like this from getting their hands on drugs. It's quite the opposite. It's to put drugs in their hands, and it's to make drugs more accessible. I used to work for a telecommunications company in a community that had a methadone clinic because of the high volume of drug users in the area. I would regularly come across needles in the back alleys that I was working on. It was an occupational safety hazard, to say the least. Many people there had large dogs in the yards and houses to ward off the would-be thieves looking to steal things to sell for drug money. One day I was working in someone's basement running a telephone line, and as I was running the wire, I threw a bundle up over top of the cold air return, and as the wire came over the other side, I gave it a pull to get the rest of the wire. Now I was standing underneath the cold air return, thankfully, because there's 4 needles that fell, and 3 of them landed on the floor, and one of them it must have bounced off the wire or something, but it bounced off of my shoulder before it hit the floor. Something that I did not expect to have happen, and something I certainly did not go into that day looking to encounter on the job site. I've also been in many houses and apartments where you can see that people are functioning addicts. They are uneasy. You can see the look of hopelessness that is on their faces. And perpetuating that with more drugs, more government drugs, is not going to be the way to offer those people hope. These people are just trying to get through another day. They're trying to get through another hour. And in some cases, Mr. Speaker, it might even only be another minute. And this gets to my key point. Where is the hope for these people? The government has done a lot of things, but all the things that they are doing is only contributing further to the problem, Madam Speaker. It is contributing to the state of homelessness. And many of these people, because of what the government has done, are turning to drugs and to hard drugs. They're losing their homes, they're losing their jobs, they end up on the streets, and it just perpetuates into where people are at, where the stats are showing that people are ending up. That's why Conservatives are calling for the government to immediately reverse its deadly policies and redirect all funds from taxpayer-funded hard drug programs to addiction treatment and recovery programs. Think about the amount of money going into supplying these deadly substances and how those same funds could be channeled into recovery programs which have a proven track record of helping Canadians overcome their addictions. I think it's safe to say we'd be in a much better place today if our attention was placed on recovery. But above and beyond that, Madam Speaker, we also need to look at an upstream approach to this issue. So we have to come to a point in our history as a society where we must ask, why is it that our neighbors and friends are seeking out these deadly substances? What is the root of the hurt and despair that's fueling these addictions at an unprecedented rate? What is driving them to seek out drugs? Where have we failed our brothers, our sisters, our neighbors, our family members from finding meaning and fulfillment in their lives? I've always believed that family is the foundation of society, and while we work to reduce addictions, we must also work to ensure that the very foundation of society is preserved. We must ensure that children are growing up in safe and secure homes, homes where they learn the value of important things in life and where they find the meaning and fulfillment in life. Modern medicine always encourages us to look at the root of the problem, to find the upstream approach to health, and to examine the social detriments of health. or social determinants, of health. So while we work to combat the issue of addiction, we must also look at the root cause and keep our loved ones from turning to these hard drugs in the first place. Madam Speaker, every life lost to an overdose is one too many. These people are loved, and we owe it to them to offer them hope in the midst of despair. I started my speech by saying we must work collaboratively on this issue, and I'll say it again. Human life, every single life, is too valuable. There's too much at stake. Let's get this issue right for the sake of our children, for the sake of our future generations. Thank you very much, Madam Speaker. Let's bring it home.
Questions and comments. Questions et commentaires. L'honorable député de Saint-Jean.
The Honourable Member for Saint-Jean. I thank my colleague for his speech. Today, Conservatives have been trying to scrap initiatives that have been put in place, such as safe supply and replacement therapy, because sometimes these drugs are resold or diverted so that the user can then buy fentanyl. Does the colleague feel that we should prioritize recovery treatment? But in order for someone to recover, they have to be alive. So how does the colleague feel? Could we set up a supply system where there would be safe replacement therapy? Would the colleague agree that people should be able to have a safe supply, which would be a pharmaceutical grade and not have fentanyl?
Well, merci beaucoup pour la question.
Thank you for the question.
I appreciate the way she's trying to ask the question, but Madam Speaker, I do think the issue is that rather than offering people safe supply, which again, when we look at what's in these drugs, one tablet of hydromorphone has the equivalent of 10 Tylenol T3s. That's not the solution that people are actually looking for, and that's a much different approach than offering somebody methadone or some of the other programs that are out there to try to help people come off of the high or deal with their addictions. So, I mean, we need to make sure that we're very pointed and specific at what we're trying to deal with here, and that's why we're concerned about the government spending gross amounts of money on further heightening the opioid crisis rather than trying to alleviate it.
Comments, the Honourable Member for Nunavut.
I'm quite concerned with what I've heard from the member. His language was quite creating a lot of negative labels, a lot of stigmatization. Having been all my life as an Inuk and seeing other Indigenous peoples refusing to call themselves Indigenous because of the racism that exists, it's hard to listen to the people generating more stigma, and I hope that the member reconsiders how he thinks of people that are suffering from substance abuse problems and how people need extra supports. I do want to ask, because I think that safe supply is a form of treatment, it's a form of recovery, that because there are options for people to recover from these struggles, that it should not be eliminated as a treatment option. There can't be a one-size-fits-all to ensuring that we can do better to help people to get off of these hard drugs that we know are causing many problems for individuals. And I wonder if the member agrees that there can't be a one-size-fits-all way to treat people that are having these struggles, and that it's better to have more options of treatment for them.
The Honourable Member for Cypress Hills Grasslands.
Well, the majority of my speech was about trying to provide people with treatment, to provide people with recovery. We want to provide people hope, Madam Speaker, and I don't think that offering people recovery and treatment and hope is racist. I am not trying, no one in this House, nobody has come into this debate with the goal of trying to stigmatize anybody. Nobody is doing that, okay? That is not what we are doing. What we're trying to do is make sure that the government is not just further worsening the crisis by offering more drugs and enabling people to get their hands on drugs so that they can sell it to be able to get more drugs and harsher drugs. We're trying to offer people hope, offer people alternatives. That's what this is about. This is not a one-size-fits-all approach. That's not what we're advocating for. What we're advocating for, though, is the government to quit being drug dealers.
Member for Kitchener Centre.
Madam Speaker, recovery doesn't work if the person's dead before they get there. The member spoke about working collaboratively and in a less partisan way. Well, less than a year ago, the member for Courtenay Alberni put forward a bill that would have at least moved forward with what Health Canada's expert task force on substance use had been calling for. It wasn't partisan, and the member opposite, the Conservative Party, and most Liberals voted against it. Why?
Honourable Member for Cypress Hills Grasslands.
Well, Madam Speaker, we put forward a private member's bill. I think it was the member from Kootenay, Columbia, who put it forward to divert drug addicts from jail to recovery. Do you know who voted against it? The NDP. The bill didn't make it past second reading. So where's the collaborative approach in that? Offering people recovery is what the bill was about, right? And there's one more point I want to make to make this abundantly clear. There is no such thing as safe drugs. All drugs are harmful. All of them. Doesn't matter how, some are just more lethal than others, right? That's like fentanyl is extremely lethal.
We have to move on and resume debate with the Honourable Member for Foothills.
Thank you very much, Madam Speaker. And it's frustrating that we're here again talking about the opioid crisis, which I think we've had debates on many times in my years as a Member of Parliament. And it just seems after 8 years of this Prime Minister, everything feels broken. Life costs more, work does not pay, housing costs have doubled, and the Prime Minister divides to control the people. And worst of all, crime and chaos, drugs and disorder rage on our streets. Nowhere is this worse than the opioid overdose crisis that has expanded so dramatically in the last 3 years. In fact, Madam Speaker, during the time that we've debated this motion today, another 20 Canadians across this country have died as a result of an overdose death. Now, these are numbers, certainly, but these are also brothers, sisters, sons, daughters, mothers, fathers, friends, and loved ones that we have lost as a result of this opioid crisis. And what I find most frustrating is it seems that only the Conservatives are fighting for change, a change from the failed experiment, which is safe supply, that is destroying families, devastating our towns and cities, and ripping families apart. Any metric for any program that has seen a 300% increase in overdose deaths cannot be viewed as a success. That is not science-based. That is ideological-based. And we have to change. We have to rip the veil off the myth that is safe supply. Our nation is struggling with this ongoing opioid crisis where more than 35,000 Canadians have died of overdose deaths since 2016. That is unacceptable. And following 8 years of this Liberal government, those numbers are only getting worse. And they're getting worse where these policies are embraced the most. Provinces like British Columbia, where many of my colleagues from that province have gotten up and asked questions and spoken today, voicing their frustration of what's going on in their ridings and their communities. British Columbia is suffering as a result of the policies of a Liberal federal government and an NDP provincial government. And I know I'm not the only one in this House, Madam Speaker, of my colleagues who have lost friends, we've lost loved ones, friends, of overdose deaths and suicide. That is why the Conservatives are asking for and demanding an evidence-based approach to address this issue. I had the honour of chairing and co-chairing a Conservative working group where we focused on the opioid crisis, and we spoke to experts not only across Canada, but around the world. And speaking with those stakeholders, the one thing that was clear is funding or lack of funding is not the issue. The funding is there. What is the issue is a priority, and the priority needs to be on treatment and recovery, and a metrics to measure that recovery. And this term, safe supply, as many of my colleagues have mentioned tonight, this describes a policy which I think is one of the best marketing schemes of all time. There's nothing safe about injecting your body with the toxic poison that are these drugs. It doesn't matter what it is. This is not meant to be ingested or injected. And consuming these powerful drugs only leads to a spiral of addiction and despair. And today we have the Liberal government that is only exasperating this crisis. They have spent almost $80 million of taxpayer money subsidizing these drugs, which are flooding our streets with addiction and crime. And in this year's budget, they've announced another $100 million to go to the safe supply. And the consequences of this are stark. Free drugs, subsidized by the taxpayer, decriminalizing cocaine, heroin, and fentanyl, has supercharged the opioid crisis. And Madam Speaker, I want to tell you a quick story about why this hits so close to home for me. One of the most important people in my entire life, I had to break into their apartment and find them on the floor, OD'd on fentanyl. It's a picture I want no one in this house to ever have to see, what this drug had done to this person. But when I took them to the hospital, perhaps I was naive. I just expected the doctors and nurses to put this person in recovery and treatment right there. But their answer was, yeah, they OD'd on fentanyl, they're going to be okay tomorrow, and we'll be releasing them in the morning. Wow. You can put them on a waiting list for 6 weeks for a recovery program. A waiting list for a recovery program. Now, had there not been friends and family that made sure that this person was okay and she has recovered, I can't imagine if she went back on the street and back on fentanyl. The focus and the dollars need to be on recovery and treatment, not perpetuating the opioid crisis which we have seen. And I find it very frustrating when the Minister of Mental Health and Addictions keeps saying, well, we've saved 42,000 people from addiction or from overdose. No, you haven't. You have prolonged what is likely inevitable. If you keep them on the safe supply, they will overdose eventually, more than likely. They are now, and the article in the National Post by Adam Zito has to be an eye-opener, a shock to Canadians. So we're seeing what's actually going on in the ground. Canadian families have to stand up. We cannot be intimidated any longer. Our voice needs to be heard. This is the easy way out, and it is clearly not working. Canadian families need to say, enough is enough. We want our streets back. We want our loved ones back. And there is hope, Madam Speaker. We have provinces like Alberta, where they have studied this and they realized that safe supply was not the answer. They warned safe supply could cause the next wave of addiction crisis, and that has happened, and they are right. But between 2021 and 2022, because of the system that they have implemented, drug overdoses have declined in Alberta by 46%, because they invested in 10,000 detox treatment centers and are serving 29,000 Albertans every single year. Imagine the difference you could make if provinces followed that similar model. We're going to divert the funds from safe supply, which is not safe, and focus it on recovery and prevention. Madam Speaker, that is what Conservatives are asking and demanding this Liberal government to do, is to dismantle this failed experiment which they call safe supply. Addicts are diverting their safe supply. They're selling those drugs on our playgrounds and our schoolyards, getting the next generation addicted, using the proceeds of that revenue and buying fentanyl, cocaine, and heroin, which is being decriminalized, which I can't believe I'm saying, on the streets. Madam Speaker, there is hope. There is hope to end the hurt and get Canadians the treatment and the recovery they deserve, but we have to end this failed experiment, which is safe supply, because it is simply not working, and we have to change it now.
It being 5:41, it is my duty to interrupt the proceedings and put forthwith every question necessary to dispose of the business of supply. The question is as follows. Mr. Poilievre, seconded by Mr. Ellis, moved that given that
Canada is in the midst of an opioid crisis that has killed over 35,000 people since 2016. Two, since 2017, the federal government has spent over $800 million on its failed Canadian drugs and substances strategy, including over $100 million in funding for hard drug supply projects across Canada, and plans to spend an additional $74 million to scale up these projects over the next 5 years.
3. 3, since tax-funded drug supply was ramped up in 2020, opioid deaths have only gone up, according to the Public Health Agency of Canada. 4, in 2020, slightly less than 7,000 people died of opioid overdoses, while only 3,000 died of overdoses in 2016, according to the Library of Parliament. 5, en Colombie.
5, in British Columbia alone, yearly drug overdose deaths have increased by 330% between 2015 and 2022.
6, dans l'Est de
6, recently, a Global News reporter in East Vancouver was able to buy 26 hits for $30 in just 30 minutes of a dangerous and highly addictive opioid that is distributed in tax-funded drug supply programs and flooding our streets with cheap opioids.
The House called on the government to immediately reverse its deadly policies and redirect all funds from taxpayer-funded hard drug programs to addiction treatment and recovery programs. Amendment. Mr. Jean is seconded by Mr. Workington. Move the following amendment: that the motion be amended by adding the following: and to directly sue the companies responsible for causing and fueling the opioid crisis for all damages associated with the crisis, and direct all funds recovered through such litigation to prevention, treatment, and recovery programs.
If a member of a recognized party present in the House wishes that the amendment be carried or carried on division, or wishes to request a recorded division, I would invite them to rise and indicate it to the chair.
The Honourable Member for Northumberland, Peterborough.
Madam Speaker, I request a recorded vote.
Pursuant to order made on Thursday, June 23, 2022, the division stands deferred until Monday, May 29, 2023, at the expiry of the time provided for oral questions. The Honourable Member for Longueuil-Charlemagne.
Thank you very much, Madam Speaker, and I'm sure if you canvass the House, you'll find agreement to see the clock at 5:46.
Agreed. Orders of the day. What?
Orders of the day, private members' business, affaires émanant des députés, consideration at report stage of Bill C-281, International Human Rights Act, standing in the name of Mr. Lawrence.
La décision du président, on l'a dit? So, ruling by the Speaker on Bill C-281, an act to amend the Department of Foreign Affairs Trade and Development Act, the Justice for Victims of Corrupt Foreign Officials Act, the Sergei Magnitsky Law, the Broadcasting Act, and the Prohibiting Cluster Munitions Act. There are 4 motions in amendment standing on the notice paper for the report stage of Bill C-281. La motion numéro 4.
Motion number 4 will not be chosen by the Speaker as it could have been presented at committee.
Examined, and the chair is satisfied that they meet the guidelines expressed in the note to Standing Order 76.15 regarding the selection of motions in amendment at the report stage. Motions numbered 1 to 3 will be grouped for debate and voted upon according to the voting pattern available at the table.
I will now submit motions 1 to 3 to the House.
Motion number 1, Mr. Lawrence, seconded by Mr. Genis, moves that Bill C-281 in Clause 2 be amended by replacing the French version line 19 on page 2 with the following droit de la personne. Motion number 2, Mr. Lawrence, seconded by Mr. Genis, moves that Bill C-281 in Clause 3 be amended by replacing in the English version line 15 on page 3 with the following rules of the Senate or the standing orders of the House of Commons for responses to.
And motion number 3, Mr. Lawrence, seconded by Mr. Genis, moves that Bill C-281 in Clause 4 be amended by replacing in the French version lines 1 to 3 on page 4 with the following.
1.1. Aucune licence ne peut être attribuée ou renouvelée dans le cadre de la présente partie à l'égard d'une entreprise de radiodiffusion, y compris une entreprise qui distribue de la programmation étrangère qui. Débat.
Debate.
The Honourable Member for Northumberland, Peterborough South.
Thank you. Thank you very much, Madam Speaker. Thank you. Thank you. And you know what? I was going to just sit down now, but because my colleagues are asking me for more, I will continue my speech there. But now I'm going to totally disregard them and continue on, Madam Speaker. So, Madam Speaker, it is my absolute privilege and honor today to rise with respect to Bill C-281, the International Human Rights Act. This is a bill that many individuals have contributed to, including the member from Fort Saskatchewan, Sherwood Park, as well as many other members. And we had a fantastic discussion at committee, and I was very proud to be a member of Parliament where we were having productive discussions. But for those who are unaware of the legislation, I want to go through and sort of outline some of its key parts. So this private member's bill will seek to do four things. First of all, it'll seek to raise the awareness of Canadians and people held across the world who are being held not because of any type of crime they've committed, but because of the beliefs they hold or who they are as individuals. Of course, we've seen the two Michaels who were held by the regime in Beijing, and we've also seen many prisoners of conscience held for many different reasons, of course, both in past in the Soviet Union and otherwise. Many times individuals were held because they held beliefs different than the regimes. We've seen individuals who have been incarcerated by governments across this world simply because of the person they choose to love. And so what we are calling for is that the government go forward and publicize what they are doing to help the prisoners of conscience around the world. Specifically, we're asking for the government Foreign Affairs Department to share the following information: the number of prisoners of conscience detained by each government or detaining authority, the names of prisoners of conscience. I will talk briefly about the names of prisoners of conscience. We had quite a bit of debate at committee and otherwise, and I think we landed in a really good spot, a spot where everyone can be happy. There were concerns expressed from across the political spectrum that perhaps publicizing individuals who are being held for their beliefs may cause them additional issue, may even put them at peril. And so what we've done in this legislation is now given the government the broad latitude to redact those names where they believe their security may be impacted by the publication of those names. And we're also requesting that they consult with the families of these individuals so that those families who have members who are being held as prisoners of conscience across this world, who want the names published, who want the force of the Canadian government in putting their name on a list so that they can point to it and say, yes, my brave brother, my brave sister, my brave father is standing up to speaking truth to power in an authoritarian regime. But others who feel that no, this might be in some way imperil them or reduce their ability to eventually be released, can choose not to. And so by publishing this list, the idea is that we bring awareness to the cause of prisoners of conscience, that they don't just get swept underneath the rug in the name of diplomacy or in the name of economics, that we make sure, as Canada's traditional role has been steadfast in standing for human rights both at home and abroad, and by having this provision in there, we get to hear, we get to find out through this mechanism what Canada is doing to protect these prisoners of conscience, both Canadians and around the world, and where it makes sense to also publishing their names so that the families can point to it and say, the government of Canada believes that my brother, my mother, my sister, my dad, my mom is being held as a prisoner of conscience, and we have an ability now as parliamentarians to hold the government to account. If they are doing enough, to say thank you. Thank you for helping those folks, For those who they are not doing enough for, we also have the ability to ask questions and to provoke and advocate for, as prisoners of conscience are often some of the bravest people in the world. They're people who have stood up for women's rights. They're people who have stood up for freedom, for liberty, for LGBTQ rights. These are individuals who are heroes and should be protected. The next provision in there is with respect to the Justice for Corrupt Officials Act, the Sergei Magnitsky Act. Many members of caucus and many individuals, including Bill Browder and of course Sergei Magnitsky himself, were instrumental in creating these sanctions that seek to hold those who perpetrate the worst of human rights crimes accountable. Knowing that individuals can't torture, incarcerate individuals simply for political beliefs or fighting for the cause of freedom and then hop on their private jets and attend cocktail parties around the world. These sanctions are so critical to raising the standard of human rights in Canada and, more importantly, across the world. Canada has not just an ability, but we have an obligation to stand for human rights as a country that has been blessed with with constitutional democracy, with liberty, with freedom. We have an obligation to the world to fight for human rights around the world. And the Sergei Magnitsky Act is incredibly important in doing that. Unfortunately, Madam Speaker, we've seen an inactivity on this file. Unfortunately, the government has had very few instances of triggering this Magnitsky Act, especially in recent years. And let's be clear and let's be honest, let's be frank, there are no shortage of individuals who could be held accountable. We've seen the atrocities in Ukraine. We've seen the atrocities created by and done by the regime in Beijing. We've seen what these individuals are doing. We've seen what's happening to the Uyghur people. We've seen what's happened to the Tibetan people. We need to make sure that individuals who commit these most horrendous of crimes, these most vile of human rights offenses, are held to account. And what Bill C-281 does is it gives Parliament the ability to oversight. They have the ability now, Parliament will now have the ability through our committee structure to ask, why are you not sanctioning this individual? And the government will be compelled to answer why. In many countries, it goes even further. Representative or legislative bodies are actually given the ability to have trigger it themselves. But this is a great first step along the way to encourage and advocate and make sure, as far as possible, that the executive, that the government is doing their job. And I am so proud to help and advance the cause of Sergei Magnitsky and others who have done an amazing job of fighting against the human rights violations we've seen in the Russian regime and elsewhere. The next section I'll talk about briefly is the Broadcasting Act. Unfortunately, we have seen foreign regimes be able to broadcast their propaganda over Canadian airwaves. The most egregious time was Russian Today, using it to broadcast hate against the Ukrainian people. Fortunately, their license was revoked. However, the CRTC lacked a process to do it. This puts a process so that where genocidal regimes are using our airwaves to broadcast propaganda, we now have an ability to withdraw that license. Finally, the prohibition of cluster munitions. This will put in place the Act the ability to restrict Canadian companies to finance the construction of cluster munitions. Cluster munitions are not weapons of war. They are weapons of terror that often kill civilians and often children. There are numerous stories of children. Cluster munitions are really just small, or bombs of bombs, and there are numerous stories of children actually going out in the field and playing with these and unfortunately dying. These four provisions are at least a small step, Madam Speaker, in making our world a little bit better place, in fighting for human rights and restoring Canada's place in the world as a hero, as a worker for human rights. Thank you.
Resuming debate, the Honourable Member for Pierrefonds-Dollard.
Merci, Madame la Présidente.
Thank you, Madam Speaker. It's a pleasure and an honor to rise to speak to this bill, Bill C-281.
To congratulate the member across the aisle from Northumberland, Peterborough South, for introducing this bill. This bill, entitled the International Human Rights Act, is now at third reading. Canada is steadfast in its commitment to uphold human rights both at home and abroad. We consistently look for opportunities to bolster commitment and to add to our robust foreign policy toolkit and to better address ensuring human rights crises wherever they are. We protect those in vulnerable and marginalized situations and ultimately advance respect for human rights globally. I'm pleased to have the chance right now to discuss this bill, C-281. This bill seeks to amend 4 instruments. First, the Department of Foreign Affairs Trade and Development Act, which establishes a federal department known as Global Affairs Canada. The Justice for Victims of Corrupt Foreign Officials Act, also known as the Sergei Magnitsky Law, which also allows government to impose sanctions against individuals responsible for gross human rights violations. Third, the Broadcasting Act, which gives the CRTC the authority to regulate broadcasting in Canada. And fourth, the Prohibiting Cluster Munitions Act, which implements Canada's commitments under the Convention on Cluster Munitions. The purpose of this bill is to further promote, protect, and advance human rights internationally, a purpose which our government is also strongly committed to. During debate at second reading, many of my colleagues from all parties, including the sponsor of this bill, noted and identified that the initial draft of the bill contained several aspects of important concern. It was in the spirit of this multi-partisan support for human rights that this bill was agreed to and referred to the House of Commons Standing Committee on Foreign Affairs and International Development. The hope and the goal was to see that through expert testimony from witnesses representing the implicated departments as well as civil society, along with diligent work of committee members, that key improvements would and could be made. As a member of the Foreign Affairs Committee, I was entitled to spend several meetings over the span of more than a month, and we worked hard on this task. I'd like to thank all colleagues on the committee, including the sponsor of this bill, as well as witnesses who testified, department officials who gave their times and studied the bill, and for the contributions and efforts that they all made. As a result of the proposed amendments at committee, members from all political affiliations have strengthened this bill. The amendments address many of the issues raised in the original drafting. While these changes have made substantive improvements, I would like to expand upon some remaining concerns, as well as highlight some areas that could use further refinement. First off, the Department of Foreign Affairs Trade and Development Act. On this particular item, Canada strongly supports the vital work of human rights defenders to advance respect for human rights and strengthening the rule of law. Bill C-281 introduces new reporting requirements for the Minister of Foreign Affairs. It also requires an annual human rights report that outlines that the Government of Canada's efforts to uphold its commitments to human rights globally. This includes support for human rights defenders, particularly a list detailing activities undertaken by Canadian officials to secure the release of persons identified as prisoners of conscience. While this is a new initiative for the Minister and for Global Affairs Canada, this also is a first moment when such a reporting requirement is mandated under the Act. It also aligns well with the government's established priorities. Such a report will help to demonstrate Canada's robust engagement on human rights. It creates space for greater transparency. It also creates accountability for our actions, particularly Canada's advocacy on behalf of prisoners of conscience, which can range from those with Canadian citizenship to those with no connection to Canada, but with causes that are crucial to Canada's interests. That said, the personal safety and security and privacy of all persons needs to be paramount. The government must ensure that at all times it is able to continue to act in the best interests of Canadians. Publicizing a list within the report, including the names of persons of conscience, people whose cases the government is actively working on, as well as the circumstances of their detention and the government's efforts to engage with them on their behalf, could have serious consequences, including undue harm to the individual detained, something none of us want to do. To ensure the value of do no harm is respected, any information in the report that could endanger the personal safety and security of a person should not be made public. Numerous witnesses have testified to exactly this point during committee proceedings. Committee members have also opined on this exact item, saying that there is need for discretion in this regard. While the proposed exemptions provide considerable reassurance that the minister will be able to respect these individuals' wishes, act in the best interests of individuals, the requirement to produce a list of prisoners of conscience remains a concern, particularly for Canada's ability to pursue effective, quiet diplomacy and coordination with other countries on particular files and cases. Careful implementation will be key. Additionally, Canada must ensure it can continue with its efforts to more broadly advance human rights internationally. We must ensure Canadians abroad can count on consular support and diplomatic advocacy if needed to establish bilateral relations with countries on all corners of this globe. An amendment introduced at committee also added a legislative requirement for the minister to produce a government-wide international human rights strategy. While the idea has merit, and the government is committed to working with all parties in the House on advancing human rights around the globe, we support the ruling made earlier that such a proposal went beyond the scope of the bill as agreed to at second reading, especially given the substantial financial and human resources that would be involved to both develop and to maintain such an effort across the whole of government. Next, the Justice for Victims of Corrupt Foreign Officials Act, the Sergei Magnitsky Law. This bill seeks to amend this exact act, or law, I should say. Sanctions are an important tool used by the Government of Canada to address human rights violations. They must be used when appropriate. Amendments to this bill in this respect, supported by all parties, are appreciated. This included ensuring that timelines for responses by ministers to reports by committee, as proposed under the Act, remain consistent and established with practices specified in the standing orders or rules of Senate, as well as changes to avoid inadvertently giving individuals or entities a heads up of the consequences that sanctions may be coming their way. Next, Prohibiting Cluster Munitions Act. Canada is a proud signatory and fully compliant with the Convention on Cluster Munitions, underscoring our continued commitment to the eradication of these deadly weapons. While we are supportive of including language that would seek to explicitly prohibit instruments in cluster munitions, we remain concerned with the current wording of the bill. We continue to believe that the bill will be stronger if it had incorporated an element of intent. This would ensure that innocent investors, such as pension beneficiaries or mutual fund holders, are not held criminally liable for actions of professional investment managers knowingly financing or the production of these terrible and vile weapons. While all parties acknowledge this challenge, the committee was unfortunately unable to reverse the language to address this concern in a way that preserved Canada's steadfast stance against financing cluster munitions. This is an area of need that needs to be addressed as the bill continues through this legislative process. Finally, the Broadcasting Act is also touched upon in this bill. There are some important vehicles of the transmission of ideas. C-281 recognizes the important role of prohibiting the issuance of the renewal of broadcasting licenses with respect to broadcasters. I'm sure others will be able to contribute to this debate. I'd like to thank members and all those who have contributed to this discussion and hope that we can make this legislation improve upon the good intention behind this legislation, this bill. Thank you, Madame la Présidente.
Resuming debate, the Honourable Member for Montarville. Thank you, Madam Speaker. You will have noticed that I am wearing the Vyshyvanka, to the great delight of my member from Mirabel, which is the traditional Ukrainian embroidered shirt, obviously as a sign of support for the very courageous Ukrainian nation, which is the object of an unjustified and illegal invasion from Russia. And I'm beginning my speech talking about Vyshyvanka because there's a link, and you will see as I give my speech. So I'm very pleased to speak to Bill C-281. I think that is an extremely nobly motivated bill, but sometimes this bill, as I would say, this bill is trying to do too much. And so it's got very different scopes. It touches upon a number of bills, and so it remains a bill that has a number of flaws. Flaws that we tried to remedy in committee through amendments. And you will have noticed, Madam Speaker, that there are a few that were brought to report stage. And despite these amendments, we still have an impression that it's a bit of a dog's breakfast. And so, or rather, it's a bit of a hodgepodge. So it's not very easy to read or understand. There are still flaws, despite the efforts that were made in committee to enhance the bill. So there, as I say, there are still a number of flaws, and I will just mention a few of them. So this bill seeks to increase the government's transparency with regard to human rights and international human rights matters. Now, there's a problem with the definition of what a prisoner of conscience is, because a prisoner of conscience can implies a value judgment. So what is a prisoner of conscience? And so then we discussed a number of definitions, and one which was proposed by a former director of Amnesty International in Canada. And I think we managed to come up with something that allowed us to correct this wording with around the prisoner of conscience. And now the definition refers more to people whose human rights are violated under international law. And so we managed to correct this definition in the bill. There was also a proposed amendment that was deemed in order, but that the committee had, or rather that, so we overturned the decision of the chair, and it was quite astonishing to see that our colleague, the parliamentary secretary to the government house leader, intervened yesterday to ask that this decision be deemed out of order. Now, this is quite astonishing, because this is what it reads. The minister develops and keeps updated the pan-governmental strategy with regard to international human rights. So the parliamentary government house leader said that this should be removed, so that this minister should keep up to date in terms of international human rights, should keep this strategy updated. And this is the same government, Madam Speaker, that is applying for a seat on the Human Rights Council, is asking us to remove something from the bill that says that the minister should keep a whole of government strategy on international rights, that he should keep it updated. So it's unbelievable unacceptable. This government claims to be a staunch defender of human rights, but that on the first opportunity it has, it withdraws this minister's obligation to develop and update this human rights strategy. It is quite astonishing, Madam Speaker, because if it hadn't been for what the parliamentary secretary to the government House leader yesterday said, perhaps the chair would have accepted that amendment, but it was deemed out of order because of what the parliamentary secretary to the government House leader said yesterday. Now, another element of this bill is to impose new measures to counter corrupt foreign operatives, and the minister must present reports under the Magnitsky law. So there's nothing specific about that, about this provision, Madam Speaker. Another provision, and here we see that the government is casting its net too wide, is to ban the renewal of broadcasting licenses to foreign propaganda enterprises when the House of Commons or the Senate recognizes that the state has committed genocide, whether it be under the Magnitsky Act or the Special Economic Measures Act. No, obviously the Magnitsky law was adopted, but it has never been applied by this government. And I have to say that this amendment to the bill is a problem for the government, because that would mean that finally when a House or Senate committee, or when a House or the House or Senate chamber identifies a state as having committed a genocide, that would bind the government. And we remember that this House practically unanimously voted to recognize the Uyghur genocide, but the government didn't take this into account. The Canadian parliamentarians were not listened to. The government does whatever it wants. And this provision would mean that from now on, the government would have to take into account the opinions of the House, the Senate, and their committees. And that certainly is not to the government's taste. The last amendment, and once again you can see that the government is casting its net too wide, is has to do with the prohibiting cluster munitions. Now, we understand that Canada signed the International Convention on Cluster Munitions. And once again, as I said, we can't be against motherhood and apple pie. So, of course, we agree with this provision, but it has indirect impacts that are potentially harmful. For example, the Canadian government is seeking to purchase a number of F-35s from Lockheed Martin, but Lockheed Martin manufactures cluster bombs. So does that mean that the government of Canada is violating its own law by dealing with a business that manufactures cluster munitions? So there's an amendment that was put forward to correct this in the bill, but there's something else. Because this bill wants to crack down on direct or indirect investors in businesses that manufacture cluster bombs. And it was tried. Yes, Madam Speaker, you ruled against an amendment that I had proposed by saying that it should have been presented in committee, but we couldn't because there was no consensus to do so. And that is why we brought it to report stage in the House. But the problem is that you and me and my colleagues here can, despite ourselves, through investment funds, invest in companies that manufacture cluster bombs. And therefore, we could theoretically be held accountable for a violation of these provisions, which say that we cannot directly or indirectly invest in businesses that build cluster bombs. So we tried to correct that. We were unable to do so. And that means that if the bill passes in its current form, then we could all here in this House and our fellow citizens be guilty of violating the law. So despite these flaws that I've been referring to in my speech, Once again, Madam Speaker, I'm very sad to say this. We can't be against motherhood and apple pie. So unfortunately, we will have to vote for this bill, but it's quite bungled, despite the efforts that were made in committee and even at report stage. As I say, I think we will have to say that the provisions of this bill are still imperfect, and we will have to come up with a better bill, but we will be voting in favor. Thank you.
Resuming debate, the honourable member for Cowichan, Malahat, Langford.
Thank you very much, Madam Speaker. New Democrats are happy to support Bill C-281 at this report stage and third reading, and we'd like to thank the member for Northumberland Peterborough South for bringing this bill forward. This bill makes 4 changes to different pieces of Canadian legislation to improve Canada's work on international human rights. It first requires the minister to publish an annual report on human rights, as well as a list of prisoners of conscience for whom the government is actively working. It amends the Prohibiting Cluster Munitions Act to prohibit a person from investing in an entity that has contravened certain provisions of the Act. It amends the Justice for Victims of Corrupt Foreign Officials Act, the Sergei Magnitsky Law, to require the Minister of Foreign Affairs to respond to a report submitted by a parliamentary committee that recommends that sanctions be imposed under that act against a foreign national. And finally, Madam Speaker, it prohibits the issue or renewal of broadcasting licenses in the case of genocide as recognized by the House or Senate, subject to Canadian sanctions. We heard very clearly from witnesses at the committee stage that Canada's approach to international human rights could be much stronger, and we want to thank those witnesses for their testimony and their guidance. The NDP introduced 4 strong amendments to this bill, 3 of which were accepted by the committee. Our first amendment proposed changes to the list of names of prisoners of conscience for whose release the Government of Canada is actively working. We were concerned, as all parties were, that a fully public list of names may put certain individuals at risk of reprisal from authorities in the countries in which they are detained. We also took note of the government's concerns over privacy and security of individuals. In the end, after significant conversation among the parties, the committee agreed to an NDP amendment with sub-amendments from other parties. The resulting list still details the number of prisoners of conscience detained by each government or detaining authority, the circumstances of their detentions, and the efforts the Government of Canada has made to visit them or attend their trials. It also includes a list of names. However, our amendment gives the minister the power to not include certain information on the list if the government had concerns that it would not be in the best interests of the personal safety of the prisoner. The minister is also required to consult with family members of representatives of the prisoners of conscience before they make such a decision. This would alleviate concerns that the government initially had with publishing such a list. I also note that the committee agreed to the NDP's proposal to ensure that the government's annual report include a description of the Government of Canada's communications with the families of prisoners of conscience and its consultations with civil society on matters of human rights. Several civil society witnesses testified that the Liberal government was not doing enough consulting with human rights experts, and it is clear that the government needs to do a much better job at communicating on these issues. The NDP amendment also defined the term prisoners of conscience in the bill. Our second amendment, Madam Speaker, required the minister to develop and maintain a government-wide international human rights strategy. The Canadian government does not currently have an international human rights strategy. What we heard from expert witnesses at committee, including Human Rights Watch and human rights expert Alex Nev, was that Canada needed such a strategy by which the annual report, as required by this bill, could be measured. While this amendment was deemed out of scope, the committee voted to overturn the decision of the chair with no opposition. All parties voted unanimously at committee stage to accept this NDP amendment and establish a government-wide international human rights strategy. But yesterday, Madam Speaker, the Liberals went back on their commitment to do this and appealed to the Speaker to reject the amendment. It is shocking that the Liberal government is now refusing to develop an international human rights strategy when just last week the Foreign Affairs Minister announced that Canada was seeking a seat at the UN Human Rights Council. The Liberals' decision goes against the will of the committee, goes against the advice of experts, and most importantly, is completely inconsistent with its stated goal to promote human rights. How can you say that you are promoting human rights when you are afraid to do the work? This is highlighting the inconsistency and hypocrisy of the Liberal government, who have a lot of nice things to say, but just aren't willing to do the hard work. There is no good reason why the government should not proceed with this amendment, and I must say, Madam Speaker, we are extremely disheartened and disappointed by their decision. Moving on to the rest of the bill, we are happy with the sections on the Magnitsky Act and the Broadcasting Act and agree with much of what our colleagues from the other opposition parties have said today. With my remaining time, I would like to discuss the NDP's amendments to the Cluster Munitions Act, and once again, the lack of leadership from the Liberal government when it comes to disarmament issues and cluster munitions. We are pleased that the committee agreed to an NDP amendment that would include Canada's positive obligations under the Cluster Munitions Convention in Canada's legislation. However, New Democrats also introduced an important amendment to fix Section 11 of Canada's cluster munitions legislation, and this was rejected by the government despite it being the exact same Liberal amendment their party introduced back in 2013. In 2013, the NDP and Liberals fought very hard to have Section 11 of Canada's cluster munitions legislation fixed. The late Paul Dewar, the NDP's foreign affairs critic at the time, said, quote, "When we sign international agreements, it's important that we live up to our signature. It's important that the legislation we adopt does not undermine the treaty we negotiated and signed on to and accepted," end quote. The NDP amendment we introduced was the exact same amendment that former Liberal MP Marc Garneau introduced when Parliament was first considering the Prohibition of Cluster Munitions Act. Mr. Garneau was a strong opponent of Section 11 in Canada's legislation, as was Bob Rae, as were all Liberals at the time, including the Prime Minister, the Minister of Finance, and others who currently hold seats in this chamber. Our amendment, Madam Speaker, used the same language you will find in Canada's legislation on landmines, which we can all agree sets an important precedent. Cluster munitions are banned for a reason. The humanitarian impacts of cluster munitions are horrendous. We can all agree that under no circumstances should any Canadian ever use, order the use of, or even transport cluster munitions. This amendment would have still allowed Canadians to participate in joint operations with non-party states, but it would have fixed the loophole to finally make Canada's legislation consistent with the Convention and with the opinions of over 100 other countries, including many of our NATO allies, as we heard clearly from witnesses. In 2013 and 2014, the Liberals argued strongly to fix Section 11. Marc Garneau wrote an op-ed in the Globe and Mail arguing it needed to be fixed. Bob Rae gave strong speeches in the House of Commons against it. And at third reading in 2014, the Liberals voted against the unamended bill, with the current Prime Minister and Deputy Prime Minister voting against. The objections were over this exact clause. Ambassador Rae testified last month that he had not changed his position, that this clause is wrong. Many Liberals, I think, feel the same. And every expert witness who testified to this, including Earl Turcotte, who negotiated the treaty for Canada, they all want to see this fixed. But the Liberals did not support moving the NDP amendment forward. They refused to fix Section 11 of the Cluster Munitions Act, just as they are now also refusing to take bold steps on a human rights strategy. It is very disappointing to watch the government try to explain away its bad decisions on this bill. This was an opportunity for them to show real leadership on human rights, make real change, do the real work, and move Canada forward. Instead, they have chosen to approach this issue with a reluctance and excuses. This is not the human rights leadership we need. Thank you, Madam Speaker.
Resuming debate, the honourable member for Sherwood Park for Saskatchewan.
Thank you, Madam Speaker. It's a pleasure for me to speak in support of Bill C-281 and in the process to recognize the work that was done by and continues to be done on this important legislation by my colleague from Northumberland, Peterborough South. It's also notable, I think, that we're debating the International Human Rights Act today on what is also Tamil Genocide Remembrance Day. And I want to extend my thoughts, prayers, and best wishes to the Tamil community here in Canada and around the world who are marking this day, who are remembering loved ones who were lost as part of those terrible events at the end of the Sri Lankan Civil War. And we think about and remember the continuing victims of persecution and oppression that Tamil people face in Sri Lanka. And it's been clear to me in the time I've been working on international human rights as a parliamentarian that the Tamil community has been at the forefront of advocacy for human rights for their own community, but also for other communities, supporting human rights causes that don't affect their own community, but building those bonds of solidarity. So on this particular occasion, I want to salute the work of the Tamil community on human rights, and it's appropriate in that light that we are debating this human rights legislation today. Today is also Vyshyvanka Day, where we celebrate Ukrainian culture. We celebrate the embroidered shirts that are traditionally worn in Ukraine, and many members of parliament have been donning those shirts today as well. And we recognize the ongoing human rights abuses that Ukrainians face as well. These are two examples of many examples around the world where peoples face injustice at the hands of governments and in other circumstances. And this is why Conservatives are responding to the call from various diaspora communities, but from Canadians of all backgrounds, to say that they want to see the government, all governments, do more to stand up for justice and human rights around the world. And it is in that spirit, responding to these various calls, that my colleague has put forward C-281, the International Human Rights Act. Now, this bill contains a number of different provisions. It's been called a hodgepodge by some. It's been called an omnibus bill by others. But I think it makes sense for members to use the opportunities they have to try to advance multiple important human rights objectives at the same time. There's no reason to do less when we can do more. And so there are different elements to this bill. This bill does amend different acts, all with the goal of advancing international human rights. But if there's a common theme to many of these provisions, I would say that in many respects, this could be called an International Human Rights Accountability Act. That is a unifying thread of the different parts of it are that it seeks to strengthen the role of Parliament in standing up for human rights and make the government more accountable to elected parliamentarians in its considerations on human rights issues. Members of Parliament, I think, are often much more responsive to concerns about human rights issues around the world because rather than members of the executive who may end up being a little bit more distant from what they're hearing from Canadians, members of Parliament are constantly drawn into an awareness of things that are happening around the world through the activism of our constituents who may have, for various reasons, particular familiarity of those issues. And it is through this, the People's House, that these human rights concerns have often been driven, and we have, as a House, sought to hold the government accountable and push the government to do more on human rights issues. I think this has been particularly the case with this government, but it may be a general feature. If I look at legislatures around the world, I can see many examples where legislatures go further in demanding action on human rights than executives. And this is why, in general, on human rights issues, if you believe in the importance of having a strong pro-human rights foreign policy, strengthening the hand of Parliament relative to the executive is worthwhile. This is not a bill that would just apply in the case of one government or one Parliament. It seeks to, in the long term, through various governments of various stripes that will no doubt exist in the future, strengthen the hand of Parliament. And this is why I think it's worth North understanding this as an International Human Rights Act, but also as an International Human Rights Accountability Act. It requires the minister to report to Parliament about human rights activities. It requires the government to respond to recommendations with respect to Magnitsky sanctions that may come out of parliamentary committees. It takes these steps in requiring that greater responsiveness. And it requires that when Parliament recognizes a genocide, that we would not have broadcasting license going to entities that are responsible to that genocide. We know the role of incitement by authoritarian powers in justifying genocidal actions. I do not think it makes any sense to allow those kind of genocidal messages from authoritarian, violent powers around the world to be broadcast freely on Canadian airwaves. Of course, people can access this information online inevitably, but when we license Canadian broadcasting with Canadian airwaves, there's no reason to give that privilege to foreign authoritarian powers that are committing genocide. And I'll say one instance where we've seen Parliament be ahead of the executive is on the recognition of the Uyghur genocide in particular. We had a unanimous vote among parliamentarians who cast their ballots on that issue, recognizing the Uyghur genocide, and the government still hasn't acted. And one of the debates we had at committee on this trigger mechanism for the CRTC was about whether a vote by Parliament should carry that much weight. And my view is that when Parliament speaks, when Parliament recognizes a genocide, that's not just and should not be just a symbolic action, but that means something, and that it should have a concrete impact in terms of the way the government and various other bodies respond. So I think it's important to address some of the criticisms. I get the impression that all members are actually voting in favor of this bill at this stage, which is a wonderful thing. But let's deal with a few of the notwithstanding that general support, a few of the critiques that came up. There was some discussion about the reporting requirements. And we had a lot of discussion about the reporting requirements at committee as they relate to prisoners of conscience, because my view is, and what I've heard from advocates, is that generally speaking, when you have a prisoner of conscience, drawing more attention and awareness to their case is a good thing. Having their name on a list as being a person of particular concern that governments are advocating for, governments are aware of, generally speaking, advocates will tell you that that's positive for likely to have a positive impact on the outcome for that individual. But I also acknowledge that that may not be universally the case. So we discussed what the best way to provide alternative options allowing for redaction in certain cases would be. And in the end, what we resolved on was a redaction provisions that are extremely generous to the government. The government has the power to make determinations on the basis of broad criteria to not include information about names, circumstances, etc. of prisoners of conscience advocated for. The new provision says that the minister must make all reasonable efforts to consult with family members or representatives of the prisoners of conscience and may decide not to include certain information in the list if a person consulted by the minister requested that information not be included, or the minister is satisfied that not including it would be in the best interest of the advancement of human rights or the personal safety of the prisoner. So those who are saying that, well, there may be some cases where publishing a name is not good for the person or doesn't advance human rights or puts them at risk, or in any of those cases, the government has broad latitude to simply choose to do the redaction. Now, our view is that requiring the government to go through this exercise of identifying the list, putting it together, centralizing it, is a positive exercise, even if none of that information is released publicly. The government could theoretically say, we don't believe releasing any of this information is helpful for human rights, therefore we're going to redact all of it. I hope that won't happen. I don't think that should happen, but the government has very broad latitude. So there is no reason at all for members to be concerned about the provisions around the publication of this information, because the latitude in terms of the minister to choose not to publish information is extremely broad. He or she simply has to decide they don't think it's in the interests of the advancement of human rights, and therefore they can leave that information out. So one of the other issues that was raised was just the issue of intent around possible inadvertent investments to do with cluster munitions. And I will say respectfully that one of the challenges of this committee is we received some mixed messages from some of the parties, I think in particular the government, around this. But I think the provision reflects the discussions that were had, and the idea that someone would be prosecuted who didn't intend actually just ignores so much about the principles of how a criminal law works. For someone to be convicted of an offense, they have to have intent to commit the offense. And so that basic, long-standing common law principle of intent, I think, substantially addresses the concerns that members have raised in this respect. This is a great bill. This advances human rights in many important ways. It will be a game changer. And it's not just about this government. It's about decades into the future, making sure Canada can be a stronger voice on the world stage for human rights, and I'm proud to support C-281.
Debate. Is the House ready for the question? La mise aux voix porte sur la motion.
The question is on motion number 1. A vote on this motion also applies to motions number 2 and 3.
Motion number 1, Mr. Lawrence, seconded by Mr. Genius, moved that Bill C-281 in Clause 2 be amended by replacing in the French version line 19 on page 2 with the following droit de la personne. If a member of a recognized party present in the House wishes that the motion be carried or carried on division, or wishes to request a recorded division, I would invite them to rise and indicate it to the chair. The Honourable Member for Longueuil-Charles-Lamont.
Thank you, Madam Speaker. We request a recorded division.
Conformément à l'ordre adopté.
Pursuant to order made on June 23, 2022, the division stands deferred until Wednesday, May 31st, at the expiry of the time provided for oral questions.
Le vote par appel nominal s'applique.
The recorded division will also apply to motions number 2 and 3.
In accordance with Standing Order Number 38, Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that this House should now adjourn. The Honourable Member for Sherwood Park for Saskatchewan.
Thank you, Madam Speaker. I'm following up on a simple question that I asked this government earlier, which was, do they believe that McKinsey is an ethical company? We haven't gotten a direct answer from the government on that, and I don't think it's a difficult question at all for reasons that I'll explain later. But the question was, does the government think McKinsey is an ethical company? And the reason why I would ask the government of Canada whether they think this private company is an ethical company is because contracts to McKinsey have gone up dramatically under the tenure of this government. McKinsey has received over $100 million in contracts from this government during the time when this Prime Minister was in office. And this has happened in the context of various close relationships that existed. Dominic Barton being the global managing partner of McKinsey, also advising the Prime Minister's Growth Council, recommending the creation of the Canadian Infrastructure Bank, many McKinsey people coming to work for the Infrastructure Bank, McKinsey analysts doing pro bono so-called work for the Growth Council, and therefore McKinsey being able to kind of infiltrate itself into government and then get all these contracts. So there's a long-running close relationship between this government and McKinsey that led to McKinsey getting over $100 million in contracts. And actually, the government has since revealed that McKinsey, that not all rules were followed. Rules weren't consistently followed, in fact, in the awarding of contracts to McKinsey. So there's a failure to follow rules. There were strategic efforts by McKinsey clearly to integrate themselves into the operations of government. And there were people from McKinsey like Dominic Barton who were given prominent positions within government, head of the Prime Minister's Growth Council, and subsequently ambassador to China. And while ambassador to China, although he no longer worked for McKinsey, of course, in that role, McKinsey was involved in facilitating a meeting with the Infrastructure Bank that he attended. So all these kind of suspicious interactions or integration between the government and McKinsey.
So it's important to then ask the question, what is this company that has exercised such outsized influence over the direction of our country? And we're asking this question today in a context where we just had an opposition day debated on the opioid crisis. We have this horrific opioid crisis in this country, and part of the reason why we have an opioid crisis is because Purdue Pharma, working with McKinsey, fueled that crisis. McKinsey gave Purdue Pharma advice on how to supercharge opioid sales, recommending things like paying bonuses to pharmacists in cases where there were overdoses, recommending things like having online pharmacies that would circumvent the kind of checks on addiction that traditional pharmacies put in place. These were the kind of things that McKinsey recommended, and McKinsey has had to pay out significantly for it. They reached a settlement of over $500 million in the United States. So while in the United States, McKinsey is being held accountable and forced to pay compensation to victims of the opioid crisis. In fact, Republicans and Democrats in equal measure across various states have pursued McKinsey for this. In Canada, this Liberal government has this close relationship with McKinsey and has given them over $100 million in contracts. Now we're finding lately that this government is joining British Columbia's class action lawsuit against McKinsey over their role in the opioid crisis. So in response to significant opposition pressure, us saying that these bad actors need to be held accountable, the government is finally saying they're gonna take a step in that direction, join this lawsuit. But they still haven't been willing to say they're going to reform the integrity regime so that McKinsey doesn't get contracts in future. So what sense does it make for this government to continue to pour out largesse on McKinsey, hiring them for contracts of dubious value, spending over $100 million taxpayers' money in the process, and they won't answer the simple question, do they think McKinsey's ethical?
Honourable Parliamentary Secretary to the Minister of Seniors.
Thank you very much, Madam Speaker. And this evening I would be pleased to speak about the procurement process in the federal government. This is a process that is run by professional, nonpartisan public service that Canadians can be proud of. Canadians can rest assured that public servants are held to the highest standards when they enter into contracts. Canadians can also be assured that public servants are guided by the best value when they evaluate proposals and make contracting decisions. These contracts help the public service deliver the programs and services that Canadians rely on. The central document guiding the public service in the contracting process is the Directive on the Management of Procurement. This directive came into effect on May of 2021. The directive replaced the previous contracting policy, which had been in place for 33 years, and after a one-year transition period, the contracting policy was rescinded. This directive was part of our government's plan to modernize policies on managing the assets and services the federal government acquires. Our government is proud of this achievement. The directive is principle-based and focused on outcomes. It supports business owners who are a critical partner in the procurement process by outlining roles and responsibilities. It also places an emphasis on socioeconomic, Indigenous, and environmental objectives, and I will get back to that point later on, Madam Speaker. The directive sets out guidance and obligations for the professional public service to follow when procuring goods and services. Now, fundamentally, the directive ensures that the procurement of goods and services continues to be done in a way that is fair, open, and transparent. Canadians can be assured that these principles are the backbone of all government contracting. This is demonstrated in the objective of the directive, which I will quote, and quote, the objective, I get a smile on my face when I say this, but the objective of this directive is that procurement of goods, services, and construction obtains the necessary assets and services that support the delivery of programs and services to Canadians while ensuring best value to the Crown, end of quote. This objective is backed up with 6 results that directive intends to achieve. For example, procurement must support operational outcomes while demonstrating sound stewardship and best value. I'd like to get back to the point that I made earlier about the emphasis on the directive puts on socioeconomic, Indigenous, and environmental objectives. In 2019, our government made a fundamental change in procurement policy. We redefined best value to mean a balance between competitive pricing and best outcome. This means public servants who evaluate bills are able to consider the socioeconomic, environmental returns of their contracting. This extends throughout the life cycle of the good or service being purchased. This represents a fundamental shift in procurement where best value is not always the lowest price, but the optimal balance of resources and outcomes. This includes outcomes from a socioeconomic perspective and outcomes for the environment. The directive reflects this policy change by enabling departments to use their
procurement processes to support environmental, Indigenous, and socioeconomic considerations as appropriate to achieve the best value for Canadians. To achieve this result and all 6 expected results, the directive creates the new role of Senior Designated Official. Now, each department will appoint a Senior Designated Official who will be responsible for establishing a departmental procurement framework that consists of processes, systems, and controls that will guide procurement in their department. The Senior Designated Official is also responsible for developing guidance regarding procurement officials within their organization. This includes identifying competencies, building capacity, and establishing professional development for these officials. The government has considered procurement carefully and taken a comprehensive approach in the Directive on the Management of Procurement. Canadians can be assured that the professional, non-partisan public service is guided by a modernized Directive on Procurement that ensures that contracting is fair, open.
For Sherwood Park for Saskatchewan.
Madam Speaker, I want to thank the member for speaking from the heart tonight. But in all seriousness, the words he read had nothing whatsoever to do with the question that I asked, which is not entirely unusual from this government, but it is particularly obvious in the case of what has just transpired. These things used to annoy me. Now I think we just have to laugh at the absurdity of the exercise. Madam Speaker, I'll give the member another chance, I suppose. My question was, does he believe that McKinsey is an ethical company? If they're not ethical, should the integrity regime be reformed to ensure that companies that are responsible for fueling the opioid crisis, that are being sued finally by the government for that, should not also be accessing massive amounts of government procurement? Are they an ethical company? Should the integrity regime be reformed?
The Honourable Parliamentary Secretary.
Thank you, Madam Speaker, and I can assure the member that under the Directive on the Management of Procurement, the professional, as I said, the professional nonpartisan public service must maintain the integrity of the procurement process. Departments must obtain the best value in their procurement decisions, which has been redefined by our government to allow a comprehensive assessment of socio-economic and environmental returns throughout the life cycle of the good or service. The Directive on the Management of Procurement has established guidelines and controls to guide the professional, nonpartisan public service in achieving these goals. Thank you, Madam Speaker.
The motion to adjourn the House is now deemed to have been adopted. Accordingly, this House stands adjourned until Monday, May 29th, 2023 at 11 a.m., pursuant to order made on Thursday, April 20th, 2023.